At Make Mothers Matter, we want to celebrate a specifically feminine feature, and that is motherhood, whether we are or not mothers. As much as fatherhood is just as important, motherhood is a feminine specificity. The reality is that all over the world, there is a huge majority of women caring for theirs or for others' children, for the elderly, and all dependents. Women care for their family, and that's a beautiful and indispensable work. It has a huge economic value. It has a huge impact on development, and it makes all these women actors of development and change makers. As much as it is obvious and real, it seems to be an untold story. Women themselves sometimes do not know how much this specificity of motherhood and its unremarkable everyday life is in fact remarkable, fundamental to our future. And the better mothers are supported, informed, and recognized, the better their present and the future of all of us. What we want at Make Mothers Matter is for the world to be aware of how much mothers matter.
Hi, everyone, and welcome to the Opening Up Data to Drive Gender Pay Equity in the Care Economy panel at MouthFest. This is my first MouthFest panel, so I'm really excited to be part of this great community today. My name is Mercedes de los Santos. I'm a project manager at Open Data Charter. We are a global organization working to promote our 6 open data principles into public policies to ensure governments collect, share, and use well-governed data to respond pressing challenges. As the title suggests, these sessions is focused on strategies and experiences held by international organizations such as the Center for Global Development and Open Data Watch, and Buenos Aires City government in promoting gender equality through open data. To make an introduction to the sessions, I will present our topic. So the pandemic has brought to light in an unprecedented way the importance of care work for the sustainability of life and the unequal distribution of work among men and women across households, public services, the private sector, and community organizations. Surveys conducted since the start of the pandemic had confirmed that women have suffered the greatest increases of caregiving. So more quality data is needed to provide a gender perspective on who has received the biggest impacts, which requires support, and what kind of support social systems need to provide. So government policies and programs require quality data to calculate possible care needs and intervention that reduce inequality gaps. One of the clearest ways in which barriers to women's economic and social autonomy are made visible is through their disproportionate share of the formal and informal care economy. Revealing such disparities through data, particularly in household setting and the informal economy, is crucial to government that wish to address gender pay equity. From a policy view, it's clear that we require new plans to deal with the care crisis exacerbated by the COVID-19 pandemic. In this scenario, presenting example of data policies that help make problems visible and offer effective solutions of care supply and demand, it's an important step to closing gender pay gaps. So this panel will showcase the care indicator system as a collaborative project, between the Open Data Charter and the government of City of Buenos Aires, as well as the insight of our guests in their work with data and its intersection with gender and care economy. We hope to present the latest discussions on how the production and generation of care data can be incorporated into the public agenda through policies that seek to transform gender relations. So, as I mentioned, this session is focused on sharing some thoughts and experiences around this topic and discuss with all of you what promising solutions we can identify to address these challenges and try to tackle it so shared, trustworthy, and open data. So to begin with that, I have in this panel a wonderful woman to explain about this problem that we are facing now, in the past, and probably in the future. I would like to start the discussion with Sheida, who will introduce us to the current state of open gender data around the world and why it is important for equal pay. She will discuss the broad data ecosystem in which open data on equal pay exists and the actions needed to overcome the challenges that hold us from making the most impact. Welcome, Sheida. Sheida is a managing director of Open Data Watch, an NGO focusing on monitoring and promoting open data in national statistical offices. She has been an active member on the UN Secretary General's Advisory Group on Data Revolution, co-chairs the Sustainable Development Solution Network, Data Network, and has played a key role with the startup of the Global Partnership for Sustainable Development. As a senior advisor, Sheida works closely with the Data 2X, focus on knowledge creation and advocacy for closing gender data gaps. So, Jada, could you tell us a bit more about your emergency findings and key promising actions to the open gender data? How can open data be a catalyst to drive gender pay equity in the care economy? Sheida, the floor is yours. We are looking well your presentation.
Thank you, and thanks, Mercedes, and thanks to Open Data Charter for organizing this event. And really delighted to be part of the RightsCon and also this session in particular. So we are here today to discuss how we can harness open data to drive gender pay equity and overall, in fact, gender equality. I think gender pay and attention to the care economy is really a great sort of leading indicator for us to understand gender equality. So it's really an important topic, tremendously critical issue facing our world right now in crisis. Many of these issues actually get even worse during the crisis. And really an important issue for whoever, well, wherever we are, not only session organizers, panelists, and many, I'm sure, audience that are listening to us today. In fact, equal pay is enshrined in the Sustainable Development Goals under SDG 8. So this means that, for me, it means that 193 countries, member countries, endorsed the 2015 the SDG agenda, and in fact really committed themselves, this leader of our governments, to achieving equal pay is really a priority activity and a critical element that should really guide our discussions and work going forward. And within that 8.5, there's a very important indicator, which is monitoring the earnings of employees by age, sex, occupation, and persons with disabilities. So this is a very important, 8.5 is a very important target and goal for us to monitor, and the indicators underneath that. But while this acknowledgement at the international level is critical, what is really measured gets managed, as we all say. And we need to have access to high quality and open data to understand the status quo, identify our blind spots and critical countries or areas for action, and actually monitor our progress. My presentation today will walk us through the state of open data, particularly focused on gender data, and why openness is such a critical factor as a catalyst for impact and change. I see many of you are converters in this in open data, so I really don't have to work that hard. But for gender data, it's tremendously important as a sort of creating an enabling environment for us to be able to use data for this care economy, for this gender equality and gender pay. And I hope this broader context would allow us to set the scene for a more in-depth discussion. So, but before going ahead, I just wanted to quickly, again, I know many of you are open data experts, so excuse me, but this is the definition that we're using for open data, that data needs to be made open in terms of legally, in terms of the license, in terms of accessibility. It should be machine readable, and it should not have barriers for taking the data and using it further. So it should be really non-proprietary. So why are these four conditions, and why is this so important? But I'm using the data value chain to particularly show the importance that's attached for us to think of open data and think of all the different stages of how we use data to drive change and have an impact. Many investments that we make in data collection actually get stuck by data not getting published, or sometimes data gets published, but in PDF format or in non-accessible format. So what we are really advocating is the data value chain should be really used to drive the data from collection to publication to uptake and to impact, to maximize the value of the investment that we have in data. And open data is really one layer, important layer for making this to happen, for data to go from collection to impact and bringing about change. But despite a lot of the work that has been done on opening data and the value of data, we still have some way to go. My group, one of the things we're doing is we watch actually the state of open data, official data, such as the indicators of SDGs in 197 and 194 countries, in fact. And this map, summarizing it, is very elaborate. But this map basically shows the latest round of what we have done called Open Data Inventory Audit Assessment. And the color, you will see that there's still a lot of improvements needed in the world. Dark red means that the countries are not in the state that they should be. And then going to yellow and to orange, yellow, and green, and darker green, you'll see some improvements. We've been monitoring this data for many years now, and we see quite a lot of improvements in many countries. So, countries are putting more emphasis on importance of data and investing in data availability and data openness. So that's really good news. Another good news is you don't really have to be a rich country to be able to make your data available and and used, and including the SDG data for 8.5. So there are many developing countries, in fact, that are doing quite well in making their data available and accessible. But another component of the open data inventory that we watch for is specifically looking at gender. And here what we're trying to show is that in many cases for Odin evaluation that we do, we take some 20 so indicators across 8 categories and look at the sex disaggregation and their availability and openness of data, which are relevant for gender, for particularly consequences for women. And here we see that since 2016, the median score on the Odin Gender Index has risen by 21%. But at the same time, you see that the score on the remaining non-gender related categories, for example, in the economic, financial statistics, they're rising much faster by 40%. One of the reasons for this is that this data, more of the economic and financial data, have been in very high demand for many years by politicians, by decision makers. So the data producers and data investors have had a better chance because of the high demand to produce this data and make it accessible. And the point, and I hope one of the points that will come out from our discussion is how can we create a bigger demand for this data, for the care data, and for equal pay data, so that there would be more motivation and more investments to create this information for us. But bottom line is clearly there's still work to be done to ensure that gender data and open and accessible at national and subnational level, and also at the micro level, at the household and individual level, becomes much more easily produced, up to date, and accessible. If you look at the SDG global database right now, you will see this data, but often they're late. The latest data, for example, for the 95 countries is between 2016 and 2019. So accessibility is not only important for, is also important for actually bringing more timely data to bear. So how do we go? Usually this is my kind of way of doing things, or my group, is that we look very deep in the gaps in data. We look at where the gaps are, the causes of data, but we're always looking ahead and quite optimistic as how we can, what are the ways that we could improve the status quo. So here I have four actions recommending for the path forward for open data for gender equality. One is that we really need to continue to monitor and maybe targeting very well, monitoring the openness of equal pay data and this SDG indicators, and highlight the progress. Not always sort of focus on the bad news, but really highlight those areas where, and those regions and those countries that are making a breakthrough. The second thing is to advocate for more national gender pay transparency regulation, and of course, international standards. Both international standards for production of this data, for reporting of this data, for actually making sure that this data come with metadata and they are used and they actually make a difference. The third one is very important because most of what we're talking about is public sector data, the data that's being collected by public sector and is making it accessible. So forging public-private partnership, particularly for this topic, is tremendously important to support the opening of private sector data alongside, so that we can actually make sure that there is equity in that as well. Equity in access to data, but also equity in the pay. And then finally, documentation and communication cases of use and impact to show the value of the open data on equal pay. We try to make a lot of the stories and a lot of the values, to document some of the values that we get from impact of data. And I think this topic is tremendously important, and we would be very interested to take that on and do further work and advocacy. And the Open Data Charter is doing a great job in that area. And I'm really interested also to hear from Megan, because she's doing an amazing job there. I'm sure she's going to talk about care, cash, and data, my three favorite words these days. So, the last thing I wanted to say is that what we are trying to change, the change that we're trying to make in this data ecosystem and the impact of data is, right now, most of the time we are caught into what I call a vicious cycle, where the poor quality of data, poor investment data, and capacity just kind of drives itself from one stage to another. And with the open data, and particularly with focus on some of the thematic areas like today on the pay and care, equal pay and care, we are hoping that we would be able to really increase the demand for data, and as a result, create a virtuous cycle of better resources, better capacity, and better governance for data. So here was my presentation. I didn't time myself, but I don't think I'm over time. But really, thank you again for this opportunity. I'm really looking forward to the discussions and answering any questions you may have. Thank you, Mercedes. Over to you.
Thank you, Sheila. It was an excellent presentation. I think that it was a lot of information and a lot of things to think, particularly in the open data community, and how to communicate open data community with gender community. I think that one of the things that you mentioned is lack of transparency and inconsistency, in the information available inhibits the understanding of gender inequalities, cause and effect, and slows progress in promoting gender equalities in the workplace. So I think it's too important to continue monitoring and targeting the openness of the equal pay data. So thank you so much, Sheila. Probably later I want to know more about the challenges in publishing gender disaggregated data, because I think it's too important. But now I will want to give the floor to Megan O'Donnell. She works on issues related to women's economic empowerment and financial inclusion, gender data and measurement, and development effectiveness at the Center of Global Development. Actually, she has working on gender impact of COVID with increased unpaid care work, driving Malta's gender gap in lost employment, income, and business closures. Megan is a policy fellow and assistant director for gender at Center for Global Development. She has a master's degree in Middle Eastern Studies from the University of Oxford and a bachelor's degree in politics and French from the University of Virginia. So, Megan, could you share with us what CGD is, what you work, and how you work, and help us bridge the care inequality? The floor is yours.
Thank you so much, Mercedes, for that kind introduction and for inviting me to join these wonderful panelists today. And thanks to Sheila, who I always learn from, and whose leadership at ODW has really sort of pushed the agenda forward at the intersection of open data and gender equality. I am going to seek to complement what Sheila presented in the next few minutes by explaining the work that we've done over the past couple of years under an initiative that I've directed called the COVID-19 Gender and Development Initiative, and then dive deepest into kind of donor financing for care. What data we have available, what we've been able to pull together, though it has been a bit of a challenge, and where we still have data gaps, and we need to be able to fill those in order to make progress in this sector going forward. So, Mercedes, you started in your introduction, and Sheila sort of agreed with the point that obviously COVID has magnified some of the challenges that we've seen, the gender gaps in who performs unpaid care work within the household, who also is paid but paid poorly to do that care work, outside the household. And my colleagues Charles Kenny and George Yang about a year ago pulled together data on pre-COVID rates of who was doing childcare unpaid in the households. And then we're able to devise a model projecting what had happened during COVID due to school closures, preschool closures, other quarantine measures that meant that disproportionately mothers and women as caregivers were needing to step out of the labor force to care for children who were not able to go to school. And the results were pretty dramatic. So we see in their calculations that women have performed an additional 173 hours of unpaid childcare. That's just childcare, so not taking into account other sort of care and domestic work. In contrast to men's uptick, which was at 59 hours. And to put that into context, 173 hours sounds like a lot, but it's equivalent to 22 days of full work, or almost a full month's worth of work minus the weekends. When we look as well at this intersection, Mercedes, that you've sort of flagged in bringing us all together around the care economy and pay, we also have recent work done under the initiative in partnership with ODI that looks at the intersection of care for older persons and migrant workers. And I'm happy to pop all of these reports and links into the chat after I stop speaking with you. And it is not surprising, but we confirm the intuition that these are the folks, oftentimes because they are the most marginalized. They are working within households, they are working informally, they have migrated oftentimes from low income to higher income settings where they don't have networks, access to information, the language skills, are not empowered and equipped to be able to advocate for labor protections and proper working conditions. All of that is a perfect storm for poor pay and poor working conditions. And so it's no surprise that even though we still have improvements to make as it relates to pay data within this sector, we're going to need to figure out a strategy to improve the broader kind of working environment, including pay, given that these are disproportionately jobs that women are holding. Okay, so with that all as sort of the problem and the context behind the scenes, the other thing that we sought to do under the COVID Gender and Development Initiative, and this is where Shada just said the words cash, care, and data, was to propose policy solutions to promote not just an inclusive recovery from the crisis, but also longer-term gender equality. And when it came to care and really the intersection of care and data, we wanted to seek to provide a baseline figure of the extent to which care had been financed and supported by international financial institutions, by bilateral donor agencies, and to some extent by national governments, although as I'll touch on in a moment, there's been great work done by our partner organizations at the national level. So we focused on the IFIs and the donors that are really CGD's sweet spot to complement those who were looking at national level policies. So the first thing we did was to go back in history 20 years. So we started at the year 2000, all the way up to 2021 when we published this paper. And we looked at 8 multilateral development banks. So this was the World Bank, the Inter-American Development Bank, African Development Bank, et cetera. They're peer institutions across regions. And we were able to pull together data on every childcare project that they had financed over that 20-year period. And I will say encouragingly that there were quite a number of projects. There were quite a number of interesting designs and innovations that we can certainly learn from and hope to scale and replicate over time. But the overall financing figure was pretty dismal. And it may not be a surprise to this group, but to put it into context, over that 20+ year period, we found $2 billion total going into these sorts of projects. I should say that that's not just dedicated financing specific to childcare, but that's projects with a financing component related to childcare. And 2 billion might sound like a lot in isolation, but when you put it in context, we also know that just in 2021 alone, 2.2 billion went to oil and gas projects. And it pales in comparison to other sectors as well, right? Whether we're thinking about healthcare, whether we're thinking about primary and secondary education, or other forms of sort of hard infrastructure, childcare and broader care has just never been prioritized by the donor community. It has not been a traditional area of focus. We see this trend play out on the bilateral side as well. We put out a piece that, again, I can share the link to, that examined G7 countries. And the most recent data we had was from the OECD GAC that you all may be familiar with, looking at G7 countries' investments in early childhood education, finding that that constituted just 0.07% of ODA. So not even 0.1% of ODA. Now, I will say this is also where we run into a gender data gap and an issue that we'll need to solve going forward, because as you all know well, early childhood education is not synonymous with childcare, and it's not synonymous with the broader care economy. So one of the things we would absolutely love to see improved upon going forward, especially as we're looking at these donor institutions, is the ability to code for care in that data so that we have sort of a clearer understanding of what is being financed and what results it's having going forward. As I mentioned, on the government side, there are fantastic resources by partner institutions, including Women, Business, and the Law, sitting at the World Bank, whose most recent report put out a first ever chapter on childcare laws and policies across 93 economies, as well as UNDP and UN Women, which put out a COVID response tracker, which includes COVID response related to care services. These are equally kind of dismal stats. The Women, Business, and the Law report showed that just 11 countries in their sample provide free care, and that just 34% provide any kind of subsidy or income support to low-income families. So quite a lot of improvement to be made there. On the UNDP and UN Women side, this categorization of all gender-sensitive COVID response measures by and large constituted cash transfers, which are obviously important and correspond to our cash care and data framework, and measures around gender-based violence, prevention and mitigation and support. Very, very few focused on care, in spite of how much we know COVID has impacted this dynamic. So we see this as a really missed opportunity. Mercedes, how am I doing on time?
No, it's okay.
Still
Let's
okay.
wrap up. Yeah, you have 1-2 minutes more. Yeah.
Okay, great.
No problem.
Huge missed opportunity because we have partners now who are working to synthesize data on the return on investment opportunity. So how are we going to make the case for the fact that this money should be invested in childcare and strengthening the broader care economy, as opposed to those oil and gas projects, for example? Well, one of the ways is to say that this is going to be good, not just for families, but for whole economies. And it's Frame, one of our partners that focuses on mobile phone surveys and generating data that way, that just put out a report pointing to the fact that if childcare provision were sort of meeting the need in Nigeria as an economy, for example, you'd see 9 million people, mostly women, re-enter the workforce. So an 8% increase in labor force participation. The Eurasia Group has done similar analysis at the global level, finding that the global gender pay gap, super relevant to today's conversation, would be reduced by 8.6%, and that would generate $527 billion in additional money towards GDP. So I'll just close by saying that obviously the case is being made and there's a lot of momentum building around this issue. We are encouraged to see, for example, the first ever IDA commitment coming out of the World Bank Group that focuses on childcare and supporting childcare provision in 15 low-income countries. The World Bank has also just launched a new childcare incentive fund that is meant to leverage IDA funds and encourage low-income countries to throw in their own money to start to improve the care economy in those countries. And actually today, just this morning, I joined a kickoff meeting for the Inter-American Development Bank's first community of practice focused on early childhood education, which obviously has intersections with the broader care agenda. We are optimistic about the fact that the G7, which is sitting in Germany as its presidency this year, will hopefully continue to build momentum in the right direction, as will the Global Alliance for Care, which was launched at last year's Generation Equality Forum. but it's clear that data is going to have to be a huge part of pushing forward in each of those different pathways. We're going to need the return on investment figures, not just for Nigeria and globally, but across national contexts and even sub-national contexts like Buenos Aires. So excited to hear from Marisa. We're going to need data on what works for whom, design and implementation features that need to be prioritized as these programs are designed. And we're going to need data continuing on that baseline of what is the existing financing and policy landscape, and how can advocates and outside influencers be pushing for improvements over time. So thank you so much. I'll end there.
Thank you, Megan. I think that you bring up a very important topic about this, about that we are discussing, because we can publish a lot of information and a lot of data that's aggregate, but we have to think in the importance of the support in this kind of policies. In Open Data Charter, we promote the open by with a purpose, and the idea of that is try to publish information thinking in the impact. And for that, we need to think in this economy recovery that we are facing now in all of our countries, in trying to put money or support in the care policies too. I would like to discuss later, before after Marisa, about if you know or if you can explain more about this experience in which bilateral organizations are supporting some of these care policies. So, but after that, we get in the discussion. I would like to give the floor to our third panelist, Marisa Miodowski. She's a representative of Buenos Aires city government, and she's working, and she works a lot promoting gender equality through public-private partnership and data sharing in open format for public consultation. At the beginning of this year, I think, they launched the care indicator system that is really interesting and innovative initiative about how demand and support are distributed in the Buenos Aires city. So Marisa is a gender policy specialist from Argentina. She studied political science at the University of Buenos Aires and has a master's degree in sustainable international development from the Heller School for Social Policy in the United States. Since 2016, she works in the government of the city of Buenos Aires, where she coordinated the city gender equality strategy from 2018 to 2020. In 2021, she joined at the Buenos Aires Statistics Office, where she has coordinated several data production projects, including the care indicator system, that I think that it's the unique system in the, at least in local government. So Marisa, could you share with us the work that Buenos Aires city government is leading to promote gender equality through data, and how you envision this care indicator system is helping you out with that? So the floor is yours, Marisa. Excited to hear you.
Okay. Well, good afternoon, everybody, and thank you so much for the opportunity of being here, for the opportunity to listen to Sheida and Megan. I have just learned a lot, and I'm eager to read the documents that you just mentioned, because they are like music to my ears. We love data. We want to use data. We want to use all these lessons learned and the policy recommendations that international organizations give to governments. And I'm currently, as Mercedes said, sitting at the local government at the city of Buenos Aires, working mainly in a data producer office. I left my former role as using the data for policy making. I moved to another place, producing data and making this data available. But while doing that, we always try to see what the state of the world is doing, and all these documents and the recommendations that we are producing are really useful for us, not only to guide our work, but also to convince policymakers about the relevance of investing on all that. Because as you probably know, producing data is expensive. Mainly producing data from surveys or censuses is costly, Governments have to invest a lot of public resources that are worth investing to, but because they are later like the main research for policy making, but we have to make the case. So all this research and the work that we have mentioned is really important for us. And based on that, on all that, on the previous knowledge that in other parts in America.
I think, Marisa, you have some technical problems?
No.
Okay. Now I can hear you well. Sorry, go ahead.
I was saying that based on the knowledge developed by international organizations, but also by our local researchers, our local advocates using data, we have embarked last year in producing this care indicator system that I would like to share with you today. I would love to use the time guiding you through this system, sharing what we have done, and I would like to answer a couple of questions. First, what is the care indicator system about? What is its purpose? What type of information it does provide? Who is the audience that is using and reading and analyzing the data published in the system, and also how it could be improved. So I'm going to share my screen. Let me see. Here it is to show you. Are you watching my screen now?
Yes, we can watch it perfectly.
Okay, so this is the first part of the care indicator system. And as you can see here, we first have a definition about what the system is about. And as Mercedes introduced it, the care indicator system is it shows how care is organized in the city of Buenos Aires. And the first thing that we do after explaining the objectives and the purpose of the system is to go. I'm sorry, this is in Spanish because our main audience is our colleagues inside the city government, and also researchers and academicians and advocates in the city of Buenos Aires. But we want this to be also a model for other parts of Latin America. But if donors believe on us, we will be translating in English soon. So the second part refers to the definition of care. Megan just mentioned that it was difficult for her to code the operations, the projects that the international community has invested in other parts of the world, because some did not qualify as care, some were related to education. So here we provide the definition about what care is for us in this system. And we picked the definition that was provided to us by one of the NGOs, one of the organizations from the civil society that helped us in developing this system. And by care, we refer to all of these activities that allow the reproduction of people's daily lives through the provision either of physical elements, but also from symbolic needs. And scrolling down, we have the main populations that receive care. On the one hand, children and adolescents. Secondly, on all people with dependence needs, not all people, but just those who are in need of some sort of support and care, and people with disability. And finally, scrolling even down, we have the actors that provide the care. On the one corner, households. Secondly, the state or the government, as it is called in the US. The private sector and the community. All civil society organizations or community-based organizations that are, at least in the global south, very strong and very involved in providing care. Then we go to the data. I'm sorry if my internet is a little bit slow, but Are you seeing the data now?
Yes, perfectly.
Good. So in the second screen, we have all the indicators organized around this. That is what we call the diamond of the care. And you see that we have the 4 vertices of all the actors that provide the care and inside the populations. I'm not going to click now in order to use wise the time, but I'm going to show you very fastly how many indicators and how they are organized. We see that the first part deals with what we call contextual indicators. These are the indicators that provide the audience an idea about the current and the potential demand of care. You see here that we have year 2024. So these are projections about how much population will be needing care by this year. And we have all the system organized by other 3 very significant variables that are the geographical location of the population. We have our city of Buenos Aires divided into 3 main zones: the northern part, the central part, and the southern part. And this is extremely significant for policy making purposes, because you, as a policymaker or even as a researcher, with this information, you can see where this population resides, where do they live, and you can match on where the services are provided, and you can analyze where the main gaps remain. So basically, in the first part, as I mentioned, we have a lot of indicators, many indicators that describe the populations who are in need of care. And secondly, we have indicators about the supply, organized among the vertices of the pyramid: the government, the households, the private sector, and community-based organization. And as you can see fastly from my scrolling in the screen, we have a lot of indicators for the government part, for the state, but very few indicators, only 3 for community-based organization. And this is also providing some information on what my former colleagues were mentioning about the scarcity of data. Most of the data for the government, for the indicators that have to do with the public provision of care services, come from either administrative records that the city of Buenos Aires collects, or from surveys and censuses that we at the Statistics Bureau carry out. But in the case of community and civil society organizations, we have been struggling in gathering and collecting this data, because this data sometimes is not available and other times is not well registered, well collected, and with the rigorosity needed to be published as official information. And finally, we see the indicators that have to do with the satisfied demand, with the effective demand. So these are the people who are effectively receiving some sort of care service, either from the government, from the households, and here we make a lot of use of the time use survey, and from the private sector, and also from the community. And here again, we only have 1 indicator, and it's an indicator that is collected by us, by the Statistics Bureau. So let me show you some examples on how and what this data shows. For example, if we go to this indicator that has to do with the quantity of no, let me show you. Sorry, I got confused. Let me show you this one. Oh, sorry. No, this is not. Just a second. Let me show you this one. That has with the graph already. This shows you the quantity of services, the units that provide care for children of age between 0 and 3 years old, what we call the initial level in Spanish. And it is organized, the information by geographical area, as I mentioned. And as you can see here, I'm not so sure if you can see this as well as I'm watching that in my screen. For every year, there is a huge difference between the services provided by the public sector, the sector estatal, and the services provided by the private sector in the southern part of the city of Buenos Aires, which is the poorest part of the country, of the city. You see here, we have a very short bar, and here we have a very large bar. So here you see a difference in who is providing the care service, with a stronger presence of the government in the southern part. If we go to the indicator and press here, I'm sorry, the internet is not so good. Here it is. We see this in a table. And here is one of the good features of this portal, that all the data is reusable. Considering the first or the second slide that my colleague from Data Organization was showing, all this data can be downloadable, as you see here, and reused by anyone who wants it. And here, the other thing that this chart is showing us is that the whole number of facilities has not grown significantly from 2006 to 2020. So here there is a message for public policymakers on where to invest. If we go up to this part of the indicators of context and see where do people with of young ages live in this year, you see, we go here to households with presence of children. It's taking some time. We press in this part of the portal to see the information by geographic area, by zona. We will see that in the southern part, there is the majority of people, of households with children of a young age, from 0 to 5. So here we have, with this portal, another policy message, that is, there is a correspondence between where the government is investing and where those families, these households with young people living. So these are some examples that to show you how this could be useful. But here are the.
We are on time, Marisa.
Sorry. It took more time than I thought, because I really enjoy showing and using what we are seeing. I said that I have like a couple of questions to answer. I talk about how did we build the system partially, and how we expect to be used. And the truth is that, as Shaida and Megan were mentioning, sometimes we produce a lot of data, but if data is not used, is not consumed, then I think that the whole investment has not been worth. And the truth is that we want this portal to be used more. And for that, I think that we have a couple of things to do. First is to disseminate. This is why I took a lot of time like showing and going around, because we want everybody to know how the beauty that this has, all the information that it has, but also to educate on how to use it. Because sometimes all these conversations are among people who have some sort of knowledge, and I guess that it's not so difficult, but we have to make time within our agendas to go and show it and to explain it and to convince policymakers that before making any new law, making any new project, there is data there that could help them a lot to guide their decisions.
Thank you, Marisa. This is really inspiring project for all the world, because I think that it's unique, and hopefully next year when we will meet again in this event, we have more local governments showing information about how care is distributed in cities. So we have around, I think that 10 minutes until we have to wrap up. I have a question here for all of you, but I want to invite all the participants that are watching the session in the website, that if you want to ask something or to share your ideas or experience with the panelists, please go ahead. I have one questions, and if you Marisa, Sheida, or Megan have questions, of course, let us know. But my question is about the thing that we mentioned in all of the presentation. I think, how can we bridge the gap between the process of publishing information and actually seeing an impact on transforming gender relations? I think that all of you trying to talk about that, but we have 7 minutes. So I want to know, what do you think about that? How we can bridge that gap in publishing data and using data to really to have really change in the gender relations. So I don't know, anyone wanted to jump in to address this?
I'd be happy to take very quick, couple of quick points on how do we bridge that gap. I mean, that gap is quite a lot. You know, part of it, and the causes of that gap, part of it is because of the data literacy in many countries is low. So even if people have demand for data, but they really don't know how to use that data. So building data literacy is tremendously important. The other one is to bridge that gap is really what we were just talking about in many of our presentations, that the data producers and the people who are governing data have a responsibility to make that data accessible and usable. And also people, researchers and users, and high-profile users like Megan from CGD, to speak up about the importance of data and that countries and agencies need to invest in data. So that feedback loop from the users to producers is tremendously important. The final thing is that we have to wake up our politicians. They need to invest in evidence, in data, and not only just invest in it, but show, be a sort of a champion and show the way for using the data for evidence-based policy and decision-making. So politicians have a very big, and parliamentarians and decision makers have a big role in breaking this, bridging this gap between data production and use and impact. Thank you.
I would just very much echo Sheida's last point, and in doing so, applaud Marisa and team, because I think your ideal world is one in which a team sitting within a local or national government says, we're going to take this upon ourselves, right? To create this tool, to populate it, to go out and do these surveys, survey your own administrative databases to populate it, and then use it to inform your decision-making looking forward. We don't live in that world in most national and subnational contexts, right? Especially on this issue of care. I mean, you are so far ahead of your counterparts. And so that's where I think in bridging the gap, we need to look to think tanks, we need to look to advocacy organizations, especially those who are rooted in local contexts and are able to push their governments in the direction that Marisa and team have already jumped on. So it's harnessing the data that's out there and examples like the portal, and pushing and making it clear that there is sort of outside will and demand from citizens for this data to be collected and used and published.
Well, I cannot add more because they have said almost everything and repeat part of my presentation also. And thank you very much, Megan, for your kind words. Still, I believe that it's not so easy. Sometimes you have everything, but then there are other obstacles that come across, and there are always, as you mentioned, when you compare the amount of money that the World Bank or the donors in general were investing on childcare relative to oil and gas, and still these other decisions are sometimes not very well prioritized, even if the data is showing that that is worth investing on that. So I guess that what we have another way to bridge that gap is to make these coalitions of like reformist actors stronger and try to work all together and with all our resources towards the same aim. Sometimes in our own game of like competing about who is doing this more fancy or better, we do not cooperate, and these are missed opportunities to really promote the change.
Thank you, Marisa. Thank you, Sheila, and thank you, Megan. I think that work collectively is the answer. Of course, is to challenges and difficult to work on it and to try to work with open data when we have a lot of problems to solve. But I think that the inequalities in the gender inequalities is something that governments need to solve now with information and with the collaboration with bilateral organizations, international institutions, with the advocacy of the civil society organizations, with the work with the community organization that work too close with the women that suffer this type of problems. So I don't know if you have more questions in the chat. I think we don't have any questions, but I don't know if Marisa or Megan or Sheila want to share with us super quick highlight of possible solution to try and address the gender pay equity in the current economy. We have 1 minute left. Sorry. Can you share one sentence to close the session, and then I will close it.
My one sentence would be that we really need to invest in building foundational data systems in countries and focus really on countries, building foundational data systems, which includes civil registration system, vital statistics, census, surveys, and really build a sort of look at the full system approach rather than try to pick and choose and do piecemeal approach. For gender equality, we need really a foundational data system.
I'd say that relates to the donor financing side that I presented on earlier. We need improved kind of transparency and clarity around what is being financed and what impact it's having. And at national and subnational level, I am now encouraged to make sure that Marisa, the portal, is a model for other country and city governments, because I do think the mapping of the market and an understanding of the baseline is where we need to proceed from.
Well, I think that we are out of time, but as a producer of data, I think that our responsibility is to disseminate it and to educate and to convince that this data is the new oil for policymaking.
Thank you so much for this interesting and inspiring discussions. I'm very excited to continue this conversation in social networks, on a meeting and in a coffee. Thank you so much for RightsCon for hosting this for us. Hopefully, all the participants that are watching this session be able to access to the recording and the slide deck through the website itself. Also, Marisa and Megan share in the chat the links of the project and the project and record that they shared during the session. Thank you so much, Sheila, Marisa, and Megan. It was a pleasure to hear of you. and hope everyone have a nice afternoon, night, or morning. I don't know. Thank you so much.
Thank you. Thank you.
Bye bye.
Thank you, Mercedes. Bye, everyone.
Bye.
Bye.
Care Economy Policy Specialist with UN Women. Welcome to the Summit of the Future virtual side event, Caring for the Future, Data and Evidence to Increase Investments in Just, Equitable and Sustainable Care Economies and Societies. This event is proudly co-convened by UN Women, the ILO and the Swiss Agency for Development and Cooperation, SDC, with the support of our good friends at the Global Alliance for Care. Before we begin, some quick housekeeping. If we can jump to the next slide. Thank you. Interpretation is available today in English, French, and Spanish. You can activate it using the globe icon at the bottom of your screen. The event today will also be recorded, and please feel free to use the Q&A tab to post any questions. We'll do our best to answer them as we go and in the Q&A at the end. And now to the next slide. Thank you. An overview of the format today. We have a really fantastic agenda. Following our opening remarks is our first segment focusing on a UN Women ILO policy tool to estimate the social and economic returns of public investments in care services. Our next segment will be on data to advance women's economic empowerment, zooming in on the Asia and Pacific region. We'll then have a short Q&A session before closing for our closing remarks. And our moderator today is Raquel Coelho, Policy Advisor on Macroeconomics and Care at UN Women. With that, let us start with our opening remarks. We are very delighted to have with us Jemima Nurjuki, Chief of Economic Empowerment at UN Women, followed by Una Gemsch, Policy Advisor and Focal Point for UN Women and the Security Council at SDC. Jemima, over to you to open for us. Thank you.
Thank you very much, Amber. Good morning, good afternoon, good evening to everyone. Thank you so much for being here for this important session. Today, we are addressing a critical but often overlooked issue, the undervaluation and unequal distribution of care work. This is not just a gap in our systems, it is a major driver of gender inequality. We know globally, women carry out nearly 3 times more unpaid care work than men. And this imbalance is not only unfair to women, but is also a significant barrier to social and economic prosperity. Prioritizing and investing in quality, affordable, and accessible care services and infrastructure would free up women's time, promote fairer care responsibilities, distribution, and generate decent low-carbon jobs. This shift would lead to empowerment of women and break cycles of poverty and uplift entire communities. Recognizing this, UN Women has placed transforming care at the heart of its economic empowerment strategy, with the Gender Equality Accelerator on transforming care systems as one of its 3 main pillars. If you have not seen our strategy, I would encourage you to please have a read, and I hope you will be inspired by the priorities that we are pushing forward to transform care systems. It is also a priority of our Beijing +30 action agenda because we believe it is vital to achieving multiple sustainable goals. Together with our partners, UN Women is committed to driving a comprehensive, society-wide approach to addressing care inequalities. Our Transforming Care initiative aims to benefit 300 million women and girls around the world freeing up 1 billion hours of unpaid care work, and supporting the creation of 40 million low-carbon jobs. Our efforts are driven by our triple mandate. Through our normative mandate, we support member states in implementing key resolutions, including those on the International Day of Care and Support, the Human Rights Council resolution on the centrality of care and support from a human rights perspective, and the ECOSOC's recent resolution on promoting care and support systems for social development. Through our coordination mandate on behalf of the UN Deputy Secretary General, UN Women led the development of the UN system-wide policy guidance on transforming care systems in collaboration with our UN sister agencies ILO, UNDP, Office of the Commissioner on Human Rights, and ECLAC. And again, if you have not seen this policy guidance, please have a look at it from our website. It really provides us with policy entry points for transforming care using the 5R framework. And through our operational mandate, we're building from 14 years of experience working in 34 countries across 6 regions, supporting care-related data collection, policy development, legislative frameworks, cost analysis, and financing strategies, to name a few. I would like to especially recognize our collaboration with the Swiss Agency for Development Cooperation, SDC, and it is so great, Una, to have you with us this morning, and the International Labour Organization, ILO. Together, we implemented a joint program that led to the development of a care costing tool and country studies, which we will present today. This tool has supported over 20 countries to identify gaps in care provision, estimate necessary investments, and assess the benefits across policy areas. And I have to say, it is a tool that has really enabled governments and stakeholders not to just see care as a cost, but an investment that is worth putting resources in. Today, we are honored to have representatives from Morocco and Nepal who will share how these assessments have provided valuable insights for policymakers. I also want to recognize the work of our country and regional offices in grounding these global efforts. Today, the UN Women Asia and Pacific Regional Office will present a report that highlights the critical role of gender data in driving forward this agenda. Finally, I also want to recognize the multiple stakeholders involved in this work, from civil society organizations, employment and domestic workers organizations, philanthropies, and the private sector, many of whom are members of the Global Alliance for Care that we co-convene with the government of Mexico. And it's also really exciting to see the Global Alliance for Care Secretariat here, represented by the head of the Secretariat, Ana Moreno. Special thanks to you, Anna, and the Secretariat for fostering these vital alliances and collaborative efforts. Transforming care systems is not just a choice, it is a necessity and a priority to build a more just, equal, and prosperous world for all. So let us not just speak about the need for change, let us commit to being the architects of that change. Thank you so much, and I really look forward to hearing from our panelists today on how we can continue driving this agenda forward. Thank you.
Thank you, Jemima, and over to you, Una. Thank you.
Good morning, good afternoon, and good evening. I'm sure there's participants from all over the world joining us here virtually. Thank you so much for inviting us as Switzerland to speak at this event. And thank you very much to Jemima for her insightful introductory remarks. I don't know how much else I can add. As Switzerland, we're obviously very delighted to be here today and to share some of the remarkable outcomes of the joint program between UN Women and ILO, which was financially supported by the Swiss Agency for Development and Cooperation, or short SDC. It's very gratifying to witness how the results and tools from these programs have been effectively scaled up to benefit other countries, and how the seeds sown by this program are now blossoming into all sorts of different flowers and generating impact beyond what we had originally envisioned. The impact on institutional level and traction this work has had on especially UN system-wide level are impressive. Jemima has already mentioned a lot of this. She's mentioned that insights and lessons from the joint program, along with other care initiatives, have informed a UN system-wide policy guidance on transforming care systems. And this work has also shaped the care component of the Global Accelerator on Jobs and Social Protection for Just Transitions, led by the ILO. And additionally, it is encouraging to see how such programs have influenced agencies' strategies, including UN Women's Economic Empowerment Strategy and the Gender Equality Accelerator on transforming the care economy. As highlighted in the final report of the joint program, it has had substantial impact also at country level. I would like to highlight two. In Morocco, the program has contributed to the development of the country's last two national gender reports, which were annexed to the draft budget laws, thereby incorporating care considerations into broader policy planning. In Nepal, the program's success led to the establishment of the National Care Working Group by the National Planning Commission, a notable advancement in addressing care and gender equality issues. We really look forward to hearing more about all countries' experiences with the tools developed through this joint program. And we really hope that these insights will offer valuable lessons for other countries on the most effective ways to implement and scale up such initiatives in diverse contexts. We are really proud that the program successfully demonstrated how policy tools that have been developed at global level can be successfully adapted and applied to different country contexts, and through this, scale their reach immensely. We are pleased that this approach has been effectively carried forward in regional programs by both UN Women and ILO, demonstrating its continued effectiveness. We would obviously be amiss not to mention the rather challenging circumstances at the start of the joint program. The program was designed before the COVID-19 pandemic hit. So the very first thing the UN Women and ILO team had to do was to adapt the program to the drastically different context. And they did this in a true effort of teamwork. And based on the response the program received from the UN system and participating countries, it clearly showed that UN Women and ILO hit the nerve of the time with their comprehensive and integrated approach. Throughout the lifespan of the joint program and beyond, the collaboration between UN Women and ILO has been exemplary. The agencies have truly come together, overcoming many administrative hurdles in the beginning, with a united and common goal to advance gender equality and women's empowerment. It was really wonderful to witness the power of true partnership. In conclusion, we would like to express our appreciation for the ongoing collaboration and dedication of all partners involved. The results achieved through this joint program are a testament to the effectiveness of working together to address complex global challenges and to create positive impact for women and girls worldwide. Thank you very much.
Thank you so much, Una and Jemima, for setting the scene for us. We will now dive into the substance. And here I will hand over to our moderator, Raquel Coelho, to take us through the session today. Thank you, Raquel.
Thank you, Amber, and thank you, Jemima, Una, for this very inspiring introduction. So now we are gonna turn to this first segment of the session. From cost to investments, a tool for estimating the economy and social returns of public investments. in which we want to dive and to deep dive into how we created and how we came up in NOIGF joint efforts with ILO and with colleagues from institutional academia like IPEC on this tool, but particularly what was the purpose of this tool. So we will have in this panel Valeria Esquivel, who is our partner in ILO. She's the employment policies and gender specialist. And then we will also have İpek Karakan, who is the professor of economics at Istanbul Technical University. We know that we know that policymakers have increasingly recognized the importance of care in the policy agendas. They have particularly recognized the importance of investment in care. This has come up very strongly in some of the resolutions that Jemima mentioned, but I also want to highlight this has come up very strongly in the Pact of the Future that was adopted yesterday here in the frameworks of the General Assembly, which is calling for investments to close the social and gender gaps and to particularly invest in care. So we're at a moment of celebration, at a moment where this is clear in the agenda, but we have also acknowledged the challenges that countries face when they want to address how to increase and how to design its fiscal policies to cover these financial gaps. So this is why UN Women and ILO, with the support of SDC in this joint program, came up with this policy tool. It's a policy tool that is designed to support policymakers to make the case for investments in care services, but also generating information to answer 3 practical questions. The first question is, what are the current gaps in our care services? We look at the supply, what is the supply existing, but what is also the demand, and we measure the gaps. Then what is the investment needed that takes to close that gap? We don't like we call it costing, but we know we are costing for investments. So we need to understand, to close the gaps, what are the investments we need to put in place. And then, and most important, to convince some of our financial partners in the governments, it's also to come up with the economic and social returns. So these investments have return, and IPEC will go very deeply into that, so I will not extend myself, but it's important also to showcase on how this investment can create also wealth and prosperity to the countries. With the support of the SDC, then, we support the joint program, and we support also the implementation, not of the development of the tool, but also the implementation at country level, applying it in countries like Argentina, Egypt, Ethiopia, Morocco, and Nepal. Some of them are here to present. We are very lucky also to have the government of Morocco and Nepal to present. And they will speak themselves about the findings, but just highlight some of the overall key results of the applications, which is also, by the way, included in a report that compiles the results of the 5 countries' experiences. I want to highlight 3 main takeaways. The first one is that in all the cases, care investments contribute not only to provide quality care, but also job generation of major magnitude. It is really an engine to create jobs and to create, has the potential to create decent jobs, which is most important. In Ethiopia, employment creation potential was estimated over 6 million of jobs. Almost 2/3 were foreseen to be provided by women. Also, another second main takeaway is the substantial job generation, which means substantial earnings generation with a positive implication in tax revenue. Part of this revenue, part of this investment is recovered by tax revenue, and so allowing self-financial financing of these potential investments. For example, to give another example of a country which is not here, in Egypt, the analysis showed that the expansion of childcare services costing around 4.5% of the GDP has the potential to generate revenues corresponding to the 91% of the total cost. So the actual net gap of investment is of 9% of the total cost. So in total, this policy has really helped us to move the conversation, to move the needle politically, because it allows policymakers to both quantify the required investment, but also to see the multiplier effects of these investments into the employment, the social policy outcomes, the expansion of fiscal space. The evidence generated from this tool has been critical in shifting the perceptions of expenditure of care services from a cost to an investment lens, which is of course important when making the case to ministries of finance, as I said, or other economic actors as well. So let's dive in. And in this first part, as I said, we will be presenting the overall framework of the tool. And for that, I want to first introduce our joint program counterpart, Valeria Esquivel from the ILO, which is the Employment Policies and Gender Specialist. And she will expand on the link between public investments in care and the decent job creation. Valeria, over to you.
Yes, I need to, yeah, okay. So let me try to share my screen. Are you seeing it and correctly in presentation mode? I hope.
Yes, we see it.
Okay, excellent. So thank you very much, colleagues. It's so good to see those who have been working on this so hard for so long, and Una, who has supported the joint program. I will share after I end my presentation the link of the program, because it also contains all the reports that we are going to mention. So I'm positioned here between Raquel and Ipek, who will focus on the results. So what I wanted to place is to place the care component of this joint program within what we call an integrated framework. Let's see if I can move this. Yes, as Una mentioned, the joint program was put in place and started with the pandemic, and so we thought that we needed to counter the deleterious effects of the crisis on women, and for that we needed the macro, the employment, and the care angles. So we designed one tool for each of these dimensions, and we've kept working on these dimensions in the post-COVID and current times. So these three tools have served the purpose at the time, but also continue to guide our work. And what we have done with the joint program is creating what we think it's a successful model of intervention that brought UN Women and ILO together, as Una and Raquel emphasized, to work in an integrated way in three interrelated and mutually reinforcing outcomes. The macroeconomic policies, which support employment creation, but also are key for financing investments in care. The costing of investments in the care economy and the identification of positive employment and fiscal revenue impacts of these investments, again, as Raquel mentioned, emphasizing that decent working conditions in care sectors are a prerequisite for good quality care. So we didn't reproduce in our thinking and in our models the current working conditions of care workers, but in the good working conditions that they should have. And one thing I missed to say in my previous slide is that the guide that IPEC worked together with us in putting together is a continuation of the ILO 2018 work that we did in the care report, care work, and care jobs for the future of decent work. So I come back to this. So first the macro, second the care, third the sectoral and labor market policies that focus on creating decent jobs for women. And it is an integrated approach because it doesn't take investments in care in isolation and reinforces the demand side case for investments in care. And not only the supply side that normally is put forward in the sense in making the case for these services to allow or to remove some of the barriers women face in entering the labor force, but on the demand side, on the idea of creating jobs and decent jobs, in particular for women, which is something that is very important for developing countries, and it was particularly important at the recovery phase of the or after COVID. So there are three consolidated reports of the work we've done. Certainly, IPEC is going to talk about the care one, but let me just highlight a few achievements on this integrated approach, and our colleagues from Nepal, I'm sure they are going to emphasize on them. But for example, in the case of Argentina, the joint program provided the economic case for investments in care services in 2 provinces after we had done the work at the country level, and all these studies budgeted also for the hard infrastructure required in hospitals, kindergartens, and schools that then influence gender budgeting at the macro level. And in the case of Nepal, the joint program validated the feasibility of investments in care services for its inclusion in the work in the global accelerator. So again, other results are also available. I will copy the link. I'll stop here to pass the floor to IPEC. Thank you very much. And
Thank you, Valeria, for this introduction and framing and reinforcing the importance of these tools, but also the way we make them in a broader context. So now I'll pass the floor to Professor IPEC Ikarakan. She's professor of macroeconomics at Istanbul Technical University, and she's the former president of the International Association of Feminist Economics. IPEC help and work in the development of this tool. And then we would like to hear from you, IPEC. First of all, welcome. And then we would like to hear from you some of the highlights and key features and applications of the policy tool in generating evidence to inform the care economy investments. So over to you, IPEC.
Okay, thank you, Raquel. Hello, everyone. It's wonderful to see that we have over 200 participants with a whole bunch of colleagues and friends that I see amongst them, and also some new people. I think it may be one of the largest gatherings that we presented this tool to, and the findings from this tool. So it's a pleasure for me to be part of this webinar. So Raquel and Valeria have already explained some of the content of the tool, and I think you will help me to move down on the slides. So if we can start moving. Yes, so I will try to provide with some of the things that they didn't say. And I'm sorry if there's some repetition, but given that we have limited time, I'll try to cover the parts, the content of the tool and the implementation of the tool in 5 countries to the extent possible. So the tool, basically, as Raquel has already mentioned, provides a methodology to identify the coverage gaps or care deficits, as we call them, in provisioning of social care services or in access to care services, to estimate the costs of eliminating those care deficits, in other words, the cost of required expenditures and investments, and to assess the various economic returns to such investments. So in doing so, and I will explain what comes underneath each step in a moment, but overall, in doing this, in providing such a methodology and promoting the implementation of this methodology with national level data, the tool, in fact, aims to help policymakers and advocates to assess a rationale for increased public spending on care services expansion in view of its particularly economic returns beyond the very well-known and acknowledged social returns that come from access to quality care services. And in doing so, it also basically provides, through particularly identification of coverage gaps and the estimation of costs, it provides a policy roadmap for starting to develop a program for investments in care services. The next slide, please. So what are social care services? What are we talking about? Actually, it's, a comprehensive definition would bring in a lot of sectors. But within the context of this tool, we stayed within the core education services, including early childhood care and preschool education, the GAC, and primary and secondary education services. And under healthcare, we covered ill patient care, or what we call short-term healthcare services, and long-term care services for the elderly, people with disabilities, or chronic illness. What kind of economic returns? And you will see, if you can please move to the next slide, and you will see in parentheses that we also have economic and social returns. But I should remind you that while the social returns of access to quality care services are multiple and cover a wide range from meeting the care needs of particular population groups that are dependent on care, such as children, elderly, ill, and long-term ill, this tool has a particular focus on economic returns because it tries to set up a conversation, a communication with the people who are in charge of financing such investments. So from a very economic perspective, a standard conventional economic perspective, we divide this chart, this figure that you see, looks at the returns to investment in social care services expansion from supply side and demand side. And on the supply side, one of the things that we talk the most about, particularly as advocates for gender equality in the economy, is that access to social care services decreases the time constraints on women's time as imposed by the conventional gender division of labor, and decreases their time poverty and improves the work-life balance environment. And through that, it improves women's labor supply and helps to decrease the gender gaps in labor force participation. There are other supply side effects, such as how investing, let's stay with the figure, please. Such as how access to early childhood education, for instance, by all children, enhances human capital, helps to decrease socioeconomic inequalities later in life. And through the enhancement of human capital, it also increases productivity and supply-led growth. The focus of this policy tool, however, is on the demand side effects. So it has a more Keynesian perspective, so to speak. And particularly when we say the labor demand side effects, the focus is on how investments in social care has a huge potential for new employment creation, particularly for women's employment, but not only for women's, both for women's and men's, because the care services sector, given its labor-intensive nature, is one of the sectors with the highest, what we call, employment multipliers. So through that substantial jobs generation potential, it helps to decrease unemployment, increase employment, and generate wage incomes. And through that, it also has the potential to decrease poverty, income poverty, and time poverty, and also stimulate growth through the demand side. Next slide, please. In putting the focus on this demand side, what we are doing through an application of this tool is addressing a question of fiscal allocation. Investing in social care infrastructure requires large amounts of public spending and allocation of public resources, as I will share at the end through some findings of the country study. So the policy tool basically proposes an analytical framework for policymakers, particularly on the finance side, on how to explore a short-run demand-side economic rationale for increasing fiscal spending on care services expansion, with this focus on the demand side, on new employment creation, but also gender distribution of this new employment creation and the impact on the gender employment gap, and through some extended versions, also looking at returns through earnings, labor earnings generation, and the impact on poverty. And a lot of the studies, and what this is something that we recommend in the policy tool as well, compares the economic returns estimation with in a comparative framework against other lines of spending. And the question that we ask is, if the same amount of money from the public finances, public resources, is to be spent on care services expansion versus, for instance, physical infrastructure improvement, the construction sector, or green energy, or cash transfers, what would be the comparative outcomes? So through that comparative framework, we basically try to rationalize resource allocation and public spending decisions on the basis of the kind of outcomes that we expect from these different lines of spending. And what the research shows is that where you decide to spend your money on has very serious, substantial distributional outcomes, particularly in terms of gender distribution. Next slide, please. So the pilot implementation, as Raquel and Valeria have mentioned, have been done in these 5 countries that you see on the top from the different regions. And the tool, in fact, built up on prior studies from a number of countries, again, that you see on this list. And the most extensive one was the one for the ILO report on care work and care jobs, which was published in 2018, the report that Valeria has already mentioned. Next slide, please. We assess the care coverage gaps, looking at, so these requires a number of decisions, which sectors to target, what are the appropriate policy targets, how many more potential care receivers and providers are needed to achieve these targets, which basically gives us our care coverage gap. And the question of, beyond the coverage gaps, whether there are any necessary adjustments for service quality improvements beyond the number of people to be covered or the number of service providers. The second step of the tool, the second part of the tool, looks at assessment of the cost. So basically, we cost the required magnitude of additional expenditures that is necessary to eliminate the care coverage gap that was estimated in the first step. And in doing this, we again do the necessary cost adjustments, not only for quantity, coverage gaps, coverage targets, but also for employment and service quality. And we also, in the second step, the tool provides a methodology in terms of how the researchers can place and contextualize the cost that emerges from this exercise in the country's current fiscal spending patterns. The third step is the estimation of economic returns with a focus on employment generation. And here we looked at not only direct employment generation, the number of jobs that we expect to be created in the care services sectors, but also indirect jobs in other sectors through backward linkages from which the care services sectors procures inputs. And we also estimate at this macro level the rough gender distribution of this new employment creation. Next slide, please. There are two other steps to look at economic returns. One of them is the distributional outcomes. This is a more time and resource intensive and skill intensive part. So through a micro simulation modeling, it is also possible to look at the distribution of new jobs, not only by gender, but also by household income, education, age, previous labor market status, and also estimate the distribution of this income, its impact on poverty reduction, and also its impact on gender gaps in earnings and also in time use between paid and unpaid work. The final returns has to do with estimation of macroeconomic impact through macro modeling. And one of the things that we do here is fiscal tax revenues generation and looking at the self-financing potential of the initial outlay of expenditures. And also it is possible to estimate impact on a range of other macro variables. And if you use a comparative framework, then it becomes possible to compare all these outcomes, returns to initial spending on social care expansion to spending on other lines, other sectors or other lines of spending. So the consolidated report, if we can move on to the next slide, covered 5 countries. And here you see a rough profile. The Argentina study, Argentina already had a national level study, so they implemented this time under this joint program at the province level. The other 4 countries implemented the study at the national level. And as you can see, all of them have covered early childhood education and preschool education. Some covered other sectors, as you can see, depending on national priorities. And in terms of economic returns, all the studies have looked at job creation outcomes, but they also picked and chose other economic variables to look at. Next slide, please.
Ipek, I'm gonna ask you to kind of wrap up, so we have time also to get to the country studies as well.
Yes. Okay.
I think some of the things are gonna be there also.
Yes. Okay. So I think I'm gonna leave the most of the results to the presenters from the countries, but let me say that depending on the country's starting circumstances and economic and social indicators, the care coverage gaps range from, for instance, for the early childhood care services from around 3% of population for Morocco to as high as 9% of population in Ethiopia. The magnitude of required public expenditures also range from less than 1% of GDP for the case of Nepal to 4.5% for Egypt. And the new employment creation, Raquel already covered some of them, was as high as 6 million jobs for Ethiopia, corresponding to almost 15% of current employment, ranging to around 250,000 new jobs, corresponding to 2.4% of current employment in Nepal. And so if we can please move to the very last slide. Social care services expansion can be explored as an effective policy strategy for inclusive and sustainable economies through its potential to meet these multiple policy objectives that emerge also from the demand side. And in that sense, the tool actually addresses something that was already amongst the 12 commitments of the UN Secretary General's report called Our Common Agenda, where investing in care came up under 2 of the 12 commitments, one on women's economic inclusion through investments in the care economy, and the other one about promoting decent jobs generating growth through investments in sectors with the highest employment multipliers, with the greatest potential for creating more and better jobs, such as the green, care, and digital economies. Thank you.
Thank you so much. I'm really sorry to interrupt you, Ipe. We could be hearing you for many, many times, but I think it's important now also to go to the country experiences of applying this tool. And we will do so in a dialogue, in a conversation with Ram Pujal and Loknan Dushan from Morocco, from Nepal, sorry, and with Sineb Buba from Morocco. And we're gonna try to organize this part like in a dialogue. So I will pose you 2 questions, and I want to start by the first question, which is why you consider investing in the care economy is important in the context of your countries, in the context of Nepal, in the context of Morocco. So please, Mr. Pujal, you have the word first.
Thank you, Raquel, distinguished expert, colleagues, and all the participants. Greeting from Nepal. I'm honored to be here, and I'm very much thankful to the organizer for inviting me in this STEAM event today. With regard to the question, I'm sharing some insights from Nepal's experience with the joint program. Firstly, care sector development provides an extraordinary opportunity for Nepal by promoting formal care services. This is not just about providing jobs. It is about fostering sustainable employment that fuels our economic engine. It also addresses the care gap from the high youth out migration and diminishing fertility trend. The care sector, which is largely feminized, can be the major generator of decent job and productive employment as envisioned in our 16th National Development Plan and also the sectoral working plans of the focal ministries. And currently, we have also initiated the Global Accelerator for Jobs and Social Protection for Just Transition, in which it is reflected. Secondly, unlocking the potential of care workforce through improved integrated care services is essential in fast-changing Nepali society and family structure. You know, about 40% of inactive women indicated unpaid care and domestic work as the barrier from entering the labor force in Nepal. Thus, by investing in early childhood care, we not only support children's development, but also contribute care workers' skill. This addresses the gender occupational segregation in key care sectors and also enhances economic prosperity. Lastly, we recognize the role of care sectors in strengthening gender-responsive social protection. Care-related services have the potential to generate more formal employment and foster entrepreneurships to address the growing care demands in Nepal. When we invest in care sector, we are not just developing immediate jobs, but also promoting human development, transforming them into the human capital for long-term and sustainable economic growth, for meeting our demand of socio-economic transformations agenda of country. In conclusion, investing in care in Nepal makes all the other possibles in the context of global economic and environmental crisis. It is all about creating jobs, empowering women, and ensuring a prosperous future for all. Thank you.
Thank you so much, Mr. Pujal, for your insights on this. And we will now move to the experience of Morocco. And please, Ms. Buba, if you could also share your thoughts on the application in your country.
Bonjour, j'espère que vous m'entendez. Alors, c'est un vrai plaisir d'être parmi vous et c'est un honneur pour moi de vous présenter ce que nous avons travaillé sur le travail sur la question de l'économie de soins à autrui. Et je tiens tout d'abord à vous expliquer le contexte de la chose, comment nous avons, je dirais, opté à travailler sur ce projet. Déjà, la première des choses, je tiens à remercier les équipes d'ONU Femmes qui ont été toujours là pour nous appuyer, pour nous aider, pour réfléchir collectivement, pour pouvoir, je dirais, défricher le terrain, explorer les voies et les leviers d'action pour pouvoir promouvoir les femmes. Je tiens à préciser que Madame Leila Arhiwi a fait un énorme travail, un excellent travail avec nous. Madame Noussaïri continue sur cette voie, qui est une personne formidable. Et je remercie aussi Madame Roufrani Lamia, qui est une ouvrière qui s'implique sur ces questions des soins à autrui, et c'est un privilège pour moi de travailler ensemble sur cette question. Donc, le pourquoi de la chose. Le point de départ, c'était malheureusement la crise de Covid. Et après, il y a eu beaucoup de crises successives, géopolitiques, climatiques, etc. Et on sait très bien que les grandes perdantes par rapport aux crises, c'est les femmes. Et ce sont les femmes, ce sont les inégalités de genre qui sont en train de s'accentuer à cause de ces crises. Donc, et pour le cas du Maroc, il y a encore une autre caractéristique qui fait que nous avons plaidé pour travailler sur ces questions. C'est qu'au Maroc, le taux d'activité des femmes est faible et ne cesse de baisser. Il ne dépasse pas 20%. Donc, c'était vraiment un environnement qui nous a poussé à travailler ensemble avec ONU Femmes sur les niches porteuses, je dirais, d'opportunités pour les femmes pour pouvoir dépasser, je dirais, cette situation qui est le manque d'accès des femmes aux opportunités économiques et surtout au marché du travail. Et comme vous le savez très bien, à l'échelle internationale, c'est confirmé comme quoi l'économie du soin à autrui est un secteur porteur d'opportunités pour les femmes. Donc, c'est ce qui nous a d'ailleurs, je dirais, motivés pour travailler sur ce grand programme. Donc, il y a déjà toutes les données parce qu'il y a aussi la question de data qui est très importante et j'insiste sur cela. C'est que toutes les études du Commissariat au plan pour le cas du Maroc, les enquêtes surtout, et aussi les études qui ont été faites aussi par notre direction, la direction des études et prévisions financières, elles attestent sur quoi? Elles attestent comme quoi sur un constat qui est très important, c'est que la décision d'accès au marché du travail, elle est intimement liée à gérer au nombre d'enfants ou bien aux enfants pris en charge par les femmes. Et encore une étude assez récente qui vient d'être publiée par le HCP en 2024. Et qu'est-ce qu'il nous montre, cette étude? Elle nous montre comme quoi que la décision des femmes de participer à la population active, elle est vraiment demeure fortement tributaire de leur capacité de concilier entre vie professionnelle et vie familiale. Et aussi, un autre constat, il émane cette fois des enquêtes du HCP. Qu'est-ce qu'ils nous disent? Ils nous disent comme quoi les ménages sans enfants affichent des taux d'activité des femmes les plus élevés, alors que ceux qui sont composés de 2 enfants moins de 15 ans enregistrent les taux les plus bas. Cela veut dire quoi? Cela nous a vraiment motivés à travailler sur cette, je dirais, dimension de l'économie de soins à autrui qui porte sur le préscolaire et la petite enfance et surtout le préscolaire, surtout le préscolaire. Le pourquoi du préscolaire, déjà, comme je l'ai signalé, c'est que nous avons ces handicaps qui empêchent les femmes de travailler, déjà de travailler et aussi de se maintenir dans le marché du travail. Et en plus, le préscolaire, il a cette capacité de pouvoir travailler sur la valorisation du capital humain et aussi sur cette question, je dirais, de renforcement de la productivité, je dirais, des travailleurs et des travailleuses qui ont des responsabilités familiales. Voilà ce qui nous a motivés à travailler sur l'économie des soins à autrui et surtout sur cette question du préscolaire et de la petite enfance. Et je ne peux pas ne pas, je dirais, évoquer les résultats du dernier travail qu'a fait la Banque mondiale sur les questions, je dirais, sur les femmes l'entreprise et le droit, qui a révélé que l'amélioration de l'accès aux services de garde d'enfants contribuerait à l'augmentation de la participation des femmes à la population active de près d'1 point de pourcentage à court terme et de 2 points de pourcentage de taux d'activité sur 5 ans. Donc, je ne pourrais pas ne pas évoquer ce quadruple, je dirais, dividende de l'investissement dans les soins autrui, surtout sur l'investissement dans le préscolaire et dans la petite enfance, qui ne peut que générer ce quadruple dividende en apportant l'appui pour renforcer la participation des femmes à la force de travail, en contribuant à l'épanouissement des capacités des enfants, ce qui est aussi très important, en créant des emplois décents, comme elle a été dit par notre collègue du Népal. Ce n'est pas question que de création d'emplois, mais c'est la durabilité de l'emploi et de la décence de l'emploi. Et aussi la question de l'amélioration de la productivité, comme vous le savez très bien, c'est une ambition que nous voulons atteindre dans toutes les économies. C'est que l'amélioration de cette productivité, et cette productivité ne peut être améliorée si on n'arrive pas à concilier entre les obligations familiales et les obligations, je dirais, professionnelles des travailleurs et des travailleuses. Voilà toute je dirais, l'utilité de travailler sur l'économie du soin autrui et surtout sur le segment, je dirais, petite enfance préscolaire, parce que comme l'a très bien expliqué Madame Ipek, il s'agit de plusieurs composantes de l'économie du soin autrui, mais notre premier travail a beaucoup plus concerné cette dimension parce que nous jugeons au Maroc, en partenariat avec ONU Femmes, que c'est une composante très importante et que ces dividendes sont énormes. Voilà pour le cas du Maroc par rapport à cette question du pourquoi l'investissement dans l'économie du soin à autrui et surtout sur dans le segment préscolaire et la petite enfance.
Merci bien, Madame Zinebouba. Et en fait, nous sommes très contents d'entendre que l'outil était très bien reçu, mais aussi très useful pour vous, et pour Népal, d'avoir des résultats concrets. And I think this also, you already mentioned some of the key points that I was going to ask you in a second round of questions, which is actually based on your experience of applying the tool, what were some of the key findings, the key results, on the application. And I would say maybe you can add some information. Why would you invite other countries to apply this tool? What would you have to say for that?
Par rapport à l'outil. Par rapport à l'outil.
Oui, and I think we can start again this round with Mr. Bujal, and then we'll go to you as well, Ms. Buba.
Thank you, Raquel, once again. It's a quite very comprehensive questions to answer, but still I will do my best to give you some insights based on our experience, how we undertook that research and got some very insightful result. You know, according to the labor force survey third, where labor force participations of Nepal stand about 26% of women as compared with the 54% of the man, and the unemployment rate of women is 4 times more than that of man, is indicated by the third labor force survey of Nepal. And this is the fact and outcomes of the research which Nepal country undertook quite a few years back. And we are approaching these existing gender disparities from care lens to turn gender barriers into opportunities for fostering a greater economic prosperity, using the care economy model as one of the deserving and the comprehensive model to be adopted in Nepal. So what we undertook 3 very comprehensive studies in the last few years and come up with some very remarkable findings. The COVID-19 pandemic has offered us a lens to see the immense potential of targeted interventions, particularly when it comes to the social protection measures. The fiscal analysis of this study that we undertook through our joint programs indicated that while the government reliefs effort provided essential support, especially in the time of the unprecedented global challenges, there is a room for further enhancing gender responsive measures in social protection, especially for women in the informal sectors. The tailored program that account for the unique needs can mitigate the impact of future crises and ensure gender inclusive coverage. Similarly, the study of sectoral gender employment highlights the potentials for job creations for women in agriculture, infrastructure, service sectors, tourism, and even public and other priority sectors. It has emphasized the need for labor regulations to ensure decent and rewarding jobs and the need of gender responsive sectoral and industrial policies to address gender occupational segregation in Nepal. I want to highlight that as women farmers are working in the vulnerable conditions due to the climate change, or targeted support through agriculture stimulus packages and enhancing across the financial resources can significantly boost the national economic growth that we achieved through our studies, which we undertook earlier. Moreover, extending continued support to women-led and operated care services and hospitality will create a new opportunities for employment and robust economic expansion. With regard to the care assessment that you raised right now, which introduced an innovative methodology to help align national vision with the real and tangible outcome, we learned that by investing to meet Nepal's care coverage gaps in education and health as for SDG targets, out of total of 1.3 million direct and indirect estimated jobs, 60% of which will be fulfilled by the women. This strengthens the aggregate demands across the entire economy, while simultaneously improving long-term social well-being, gender equality, and economic prosperity in the nation. This process has demonstrated that the care work is not just a social responsibility, but also a very powerful accelerator of the national goals as well as the SDG 2030. More importantly, the multiplier of the care work extends beyond immediate employment, contributing to social protection and long-term economic growth in Nepal. To conclude, I want to highlight that the government of Nepal is very much committed to advance the care sector by generating the required evidences, data, and informations, which is also envisioned through the 16th National Development Plan, immediately approved, recently approved National Integrated Social Protection Frameworks, and also the Integrated National Employment Framework that we already developed and it is now in implementation. The data that which we are collecting and producing very soon, for example, NLSS4 mix also will give us a clear picture about what will be happening in futures and how we can make linked with our existing programs. Formation of care working group, which is leading the process of developing the care roadmap and care policy as for 5R framework 6 to promote decent care work for women with the overall objective of increasing female labor force participation from existing 26% to 35% in next 5 years. These initiatives are not just policy choices. They represent a transformative strategy for job creation, women empowerment, economic resilience, and also for ensuring the human rights is guaranteed by the Constitution's 2050 and also guaranteed by the ILO charters. I hope we can all work together to implement gender-sensitive policies that align with our national, regional, and global vision, ensuring that all members of our society can thrive. Thank you.
Thank you so much, Mr. Pujal. We're so happy to see as well how the specific implementation of the tool has led to concrete results. And, this roadmap it's really a great example of that. So congratulations for that and for the Nepal efforts. We want to also hear now again from you, from Ms. Boba, on the case of Morocco. Based on your experience, what do you think the application of the tool brought? What are the key findings? Why should others engage in this process as well?
Merci à vous. Alors, déjà, comme je l'ai signalé, nous avons déjà contextualisé les atouts de cet outil. Pour nous, cet outil était innovant pour pouvoir concilier la problématique à laquelle nous faisons face au Maroc, c'est la question de la faiblesse de l'activité des femmes. Et c'est une faiblesse qui risque de s'accentuer au regard du contexte de crise, comme l'a été expliqué, parce que tous les résultats qui ont émané de cet outil et sur les effets de la crise, sur l'égalité de genre et sur la question des soins à autrui, ils ont été publiés dans le rapport sur le budget genre qui accompagne annuellement la présentation du projet de loi de finances. Donc, nous, le contexte et l'utilité de l'outil, il était assez clair par rapport à ce dont nous avons besoin en termes je dirais, de recherche, de levier d'action ou bien d'opportunités pour les femmes, pour que les femmes accèdent davantage à l'emploi. Donc, une fois l'outil il a été assez, je dirais, compris, nous avons opté, comme je l'ai dit, pour la dimension préscolaire et petite enfance. Et je tiens à préciser que nous avons travaillé sur la généralisation du préscolaire. Pourquoi? Parce que déjà le Maroc dispose d'un programme national de généralisation de développement du préscolaire qui a été dont l'objectif est la généralisation du préscolaire pour les enfants âgés de 4 à 5 ans à l'horizon 2028. Et c'est un programme, je dirais, qui a été mis en place en réponse aux orientations royales. Et je tiens à préciser certains chiffres. Comme je l'ai toujours dit, les chiffres sont très, très importants parce que ce sont les constats factuels qui nous ont confortés de telle manière à continuer de travailler sur cette question et à vouloir expérimenter cet outil, comme l'a été expliqué par Madame Ipek, qui est fort utile. Donc, je tiens juste à préciser comme quoi, depuis le lancement de ce programme jusqu'à l'année scolaire 2023-2024, le taux de préscolarisation des filles, déjà, il est passé de 45,3% à 78, plutôt de 41,6 à 80%. Donc, nous avons pu gagner 38 points de pourcentage juste en termes d'accès déjà des filles au préscolaire. Déjà, nous sommes en train de préparer une bonne relève par rapport à la question d'accès, d'éducation, d'accès à l'éducation et de valorisation du capital humain. Et aussi un constat qui est très important, c'est que les emplois créés dans le préscolaire sont à dominance féminine. Nous avons un taux d'emploi des femmes dans le préscolaire qui approche de 90%. Donc, tous les ingrédients sont là pour dire comme quoi l'application de cet outil sur la dimension préscolaire, elle est très importante. C'est ce que nous avons fait. Nous avons appliqué l'outil en s'alignant sur les cibles du programme national pour la généralisation du préscolaire avec tous les modèles et la simulation que Madame Ipek a eu le plaisir de nous expliquer. C'est un outil extraordinaire. Je ne cesserai de remercier et Madame Ipek et les équipes de les femmes de pouvoir nous imprégner dans ces outils qui sont très importants pour l'action publique. Donc, les résultats qui ont émané de l'application de cet outil, ils sont très importants. Pourquoi? Parce qu'il y a déjà juste le fait de pouvoir généraliser ou bien d'atteindre les cibles d'un programme qui existe déjà, ça devrait normalement nous permettre de créer jusqu'à presque 50 000 emplois. Ça veut dire avec un programme qui existe déjà, ça pourrait nous permettre de réaliser création de 50 000 emplois pour les femmes. Et la caractéristique, c'est que ces emplois sont décents. Comme je l'ai expliqué, je tiens à expliquer, parce que pour le cas du Maroc et pour plusieurs pays, nous ne sommes pas les seuls, c'est que beaucoup, la part de l'emploi, je dirais, non rémunéré, elle reste quand même importante pour nous, le Maroc. C'est beaucoup plus l'emploi des aides familiales qui est beaucoup plus dominant dans le milieu rural qui domine. Donc, pouvoir créer de l'emploi et de l'emploi aussi décent, c'est vraiment une aubaine, c'est une solution, ce qui fait que ça veut dire que déjà, pouvoir atteindre les cibles du programme national pour la généralisation du préscolaire nous permettrait d'apporter des solutions et des solutions pertinentes à cette question de, je dirais, de création d'emplois des femmes. Donc, ce qui nous amène à dire comme quoi le préscolaire, elle constitue un levier d'action qui devrait être davantage, je dirais, pris en charge et je dirais comme quoi en essayant de vraiment d'y travailler efficacement parce que cela permettrait d'avoir, comme je l'ai déjà dit, explorer les 4 dividendes qui sont le maintien dans le marché de l'emploi, de la création de l'emploi, la valorisation du capital humain et aussi le renforcement de la productivité. Voilà, et je vous remercie.
Thank you so much, Ms. Buba, and also thrilled to hear what policy measures concretely this policy to open to you, and particularly enhancing early childhood education and the creation of employment that will mainly benefit women in this regard as well. So congratulations as well, and we look forward to see and to hear from you in other spaces on how this advances. But now we're gonna turn to a second moment in this event, which is also because many of you reflected in your studies and in your country cases the importance of having good quality data. And also IPEC presented on this when she presented the tool. So we have with us a whole region, the Asia Pacific region, which just launched a specific report on how to advance with data and evidence this agenda on women's economic empowerment and on enhancing care. So for that, we're going to turn to a third session, and I want to give the floor to first Christine Arab, who is the Regional Director of UN Women Asia Pacific. And then we will present Cecilia Tinoni, which is also our statistics specialist at that office, will also present the main findings of the report. I also want to let you know that we are taking notes of the questions, and at the end of the session, as far as the time allows, we will try to address some of these questions with all the panelists. So please keep on putting your questions here, and I ask, if possible as well, to all other precedent panelists to stay with us to address some of those. So Christine, of course, the floor is yours.
Thank you so much, Raquel, and thank you, everyone. Can you hear me? Is it fine? Yes, great. It's been a real pleasure also because prior to becoming the regional director, I was the representative in Egypt, and the use of the tools was extremely helpful in helping the ministers we worked with in probing their own fiscal space and some very difficult internal budget discussions. So it's very good to also hear what everyone is doing. I'm really pleased. Good evening to some of you. For us, it's the evening. Good morning and good afternoon. I'm pleased to share with you the latest report that we've produced. It's Caring Societies, Inclusive and Green Economies in Asia and the Pacific, unveiling data to advance women's economic empowerment beyond GDP. It's been published at a time when the Asia-Pacific region is grappling with widening inequalities, a significant impact of climate change. We are the most disaster-prone region in the world, and a persistent digital gender divide. But we're also dealing with significant demographic changes in Asia and the Pacific, which is directly impacting the care economy. And this publication was deliberately done so as to be relevant to the Beyond GDP initiative that we are increasingly hearing about within the UN. Today, GDP alone fails to capture the often unpaid care work performed by women and girls, the well-being, equity, environmental sustainability, and to ensure a truly inclusive economy and prosperous societies. In this report, we try to show the metrics that can be used to assess progress. It underscores the urgent need to move beyond traditional economic indicators and to ground our understanding of progress in evidence that looks at human welfare, the health of the planet, and inclusive economic participation. As our discussants today have outlined, the report emphasizes the centrality of care economy and as how invisible it is and an undervalued sector. But this is not just a matter of fairness. It's also, as the report shows, an economic imperative. The report underlines the enormous untapped potential of the care economy, arguing that if recognized and invested in, it could be a game changer of growth and sustainability for countries. Investing in the care economy is also a necessity in view of the changing demographics that I mentioned to you. These investments have the potential to yield benefits to women's economic empowerment as a key enabler for resilient and thriving lives. But the report tries to highlight investing in care systems, how it can generate jobs, boost productivity, and create the social infrastructure necessary for economies to thrive. Another critical aspect of the report is its recognition of the intersection of gender and climate action. And as I said earlier, the Asia-Pacific region is the most disaster-prone region in the world. So we have made a very studied effort to fold in the degree to which climate resilience and sustainability is impacted by investments in the care economy. Empowering women through climate-smart agriculture, renewable energy initiatives, and community-based conservation efforts can create more resilient economies, and gender-responsive climate action is necessary for achieving sustainable development, empowering women. Perhaps the most powerful message of this report is the call to move beyond GDP and rethink our economic models. It underscores that GDP growth neglects the well-being of people and the planet, or exacerbates inequality, is not sustainable and is not real progress. By embracing beyond the GDP framework and the data it provides, we can get better measures of societal progress by including gender indicators, environmental health metrics, and the value of unpaid care work. It is in this regard that the report is contributing to a bold new initiative that we've launched through the support and partnership of the Government of Australia Department of Foreign Affairs and Trade, the UN Women Gender Action Lab. It's an innovation lab that is set up for our private sector partners across the region. The Gender Action Lab seeks to mobilize deeper action and leverage and expand the innovation capabilities of the private sector, as they are going to be the ones to change the game, as we say, for women's overall economic empowerment and for the care economy overall. Starting with implementation in 4 ASEAN countries, the Gender Action Lab is envisioned to grow to a long-term, multi-stakeholder, multi-donor platform across all of Asia and the Pacific. I'd like to recognize the hard and good work put into this report by our partners and by the UN Women Care experts and led by Katja Freewald. And as my colleague Cecilia Tinian will outline now, the report is more than just data. It's really a call to action, and we've tried to provide the evidence to do that. So thank you very much, and I hand over back to you, Raquel, for Cecilia's intervention.
Yes, thank you, Christine. And yeah, I think the report couldn't come at a greater moment. In the Pact of the Future just adopted today, there is a specific call to precisely come up with new measures that complement GDP from the perspective you just put here, which is not really being reflected in this measure. So we are certain that the outcomes of the report will feed into that conversation, and it comes at a perfect moment. So now let's hear about the report. Let's hear about it with our colleague Cecilia Tinoni, who led this effort at the Asia Pacific Regional Office. So Cecilia, the floor is yours.
Thank you so much, Raquel and Christine. I'm just gonna share my screen. Give me just 1 second, please. Can you see me and hear me and see the slide?
We see you. The slides are not on full screen.
Give me 1 second, please. Now?
Now they are okay.
Okay, super. Thank you so much. I'm also turning off my video because it's raining season in Thailand. Indeed, have a very good morning, good afternoon, and good evening from Bangkok, Thailand. Today, I'm delighted to present for the very first time our very recently released report, Caring Societies, Inclusive and Green Economies in Asia and the Pacific. Our report is driven by a simple yet disturbing fact, which is that our economic model, the current economic model, has actually failed women and girls in the region. When we look at the Asian Pacific region economic growth, we see that the region has experienced sustained economic growth since 2000, surpassing the global average. Countries in the region have also witnessed significant improvement in access to health and education, yet there are still gender gaps at play in the Human Development Index. And indeed, economic growth and improved social conditions did not translate into the empowerment of all women and girls. One of the reasons is that labor markets are still severely gendered. Over the last 30 years, the gender gap in the labor force participation rate declined merely by 2%. When we look at country-level data, we see that no country in Asia and the Pacific has achieved gender equality in the labor force. On the contrary, there is a systematic bias, as you can see clearly from the graph, with women at a disadvantage. When we look at status in employment, for those women that actually manage to participate in the labor market, we see that more women compared to men are in vulnerable employment, are either contributing family workers or own account workers. Less women compared to men are business owners, and less women than men have an opportunity for leadership. In the last decades, there has been slow progress in the region in terms of legal frameworks that promote, enforce, and monitor gender equality in employment. Out of 16 countries with data available, we see that 9 countries are still far or very far from achieving the target. This is happening despite the fact that gender equality and women's empowerment is an intrinsic goal in the 2030 Agenda for Sustainable Development, but is also a key accelerator for achieving all SDGs. And this is because women and girls play a vital and diverse role across all the 3 pillars of the Sustainable Development Agenda: economic pillar, social pillar, and environmental pillar. So the Summit of the Future and the Beyond GDP initiative actually allow us to leverage a key framework to advance evidence-informed decision-making for women's and girls' economic rights and empowerment. So our report has 3 key objectives. First of all, to identify a set of relevant indicators from a women economic empowerment perspective, and this data mapping has been guided by the UN Women Economic Empowerment Strategy that Jemima has mentioned in her opening remarks. Based on this mapping, to advance a proposal on Beyond GDP from a WE lens, but most importantly, to also empower countries and national stakeholders with some evidence and data to enhance informed decision-making in areas that have a transformative potential to foster overall progress, not only toward SDG 5, but toward all SDGs. In the report, there are 3, these transformative areas are 3 key UN Women Gender Equality accelerators, namely transforming care systems, women and the world of work, and gender-responsive climate action. And the ultimate aim of the report is really to build consensus around a women's economic empowerment transformative agenda that leverages the production and use of gender data, more specifically official statistics, as pathways to action now as well as for the future. Very briefly on the methodology, as I was mentioning, the scope of the report is official statistics. We have leveraged international data sources that are publicly available, such as the SDG Global Database, UN Women Data Hub, UN Data Gender Data Hub, World Bank, ILOStat. And to this wealth of gender indicators, we apply 2 selection criteria. One, the extent to which the objective of the indicator was speaking either explicitly or implicitly to realizing the economic rights and autonomy of women and girls. And secondly, whether the indicator was using a gender lens to dismantle structural inequalities in economic systems. This led us to identify an indicator framework of 206 indicators that include the 54 gender-specific SDGs indicator as identified by UN Women in 2018, as well as indicators under the minimum set of gender indicators aligned with the Beijing Declaration and Platform for Action. To this indicator framework, we apply a geographical lens for the Asian-Pacific region for 49 countries, and we refine the list as per data availability for those countries, as well as availability of sex-aggregated data. And this list resulted in 77 indicators that are relevant from a women economic empowerment perspective. Data was retrieved as of July 2024, so the report includes the latest gender data available, and all estimates refer to the latest available year. One major limitation that we faced was that different data sources adopted different sub-regional groupings, and this obviously led to challenges in data comparability and sub-regional analysis. To analyze this wealth of gender data available in the GA, the Gender Equality Accelerator on care, we adopted the Transforming Care System approach. This approach considers not only the supply and the demand of care services in the care economy, but also includes the policy and the normative space, as well as labor rights that affect women's life cycle. It does also include a strong focus on social norms, especially discriminatory social norms that translate assigned reproductive roles into gender labor market. This approach calls for enhancing evidence-informed decision-making, and indeed, valuing and recognizing care work in official statistics can trigger, as we just heard, decisive policy action. However, the extent to which policies and programs are gender transformative really depends on their capacity to address the critical element of economic empowerment simultaneously. So Transforming Care Systems calls to tackle the power and decision-making that women have, for instance, about their reproductive lives, ensuring equal rights and granting women control over resources, but also altering the social, economic, and institutional context in which women operate. So the indicator framework for Asian Pacific for the Gender Equality Accelerator on Transforming Care System does adapt and adopt also this framework and classifies indicators accordingly for the three domains of change: power, resources, and systems that policies are asked to address simultaneously. But it also includes an indicator on the inequality of opportunities and inequality of outcomes, indicating also the potential progress of or lack therein when the domains of change are not actually addressed. Just to showcase some of the results, the report is actually very rich in terms of gender indicators. I'm just going to provide here a quick snapshot. When we look at the power and agency and autonomy in decision-making over reproductive rights of women and girls in the region, we know there has been an improvement in, for instance, the legal minimum age of marriage. However, child marriage is still a practice across countries, as you can see from the graph. And this is due both because of economic reasoning and economic motivation, but also about social expectation around family formation that really reinforce restrictive roles for women and really negatively affect their economic opportunities. Time is the most precious resources that we all have. We all have 24 hours in a day. It's very democratic resources and is central in any approach to transforming care systems. As you see in the graphs, the proportion of time spent on unpaid domestic and care work by sex and type in the latest year, women spend more time on the unpaid provision of care services, both direct and indirect, compared to men. And when this is added to other productive activities, such as, for instance, employment, we see that women are really the one affected by other deprivations, such as, for instance, time poverty. Systems in Asia Pacific are gender blind. Out of 34 countries with available data, we see that in 15 countries, laws do not prohibit the dismissal of pregnant workers. Out of these 34 countries, in 26 countries, the period of absence due to childcare are not accounted in pension benefit. Most importantly, we see that there is a gap, a gender gap between the length of maternity leave and the length of paternity leave. So we're really calling policy measures to be both care enabling and gender equalizing as foundational for comprehensive care systems. When these three domains of change are not addressed simultaneously, we clearly see that women are affected by inequality of opportunities in the labor market. We have aggregated and estimated at the regional level that 65%, for instance, of women is the highest labor force participation among women between 25 and 54 years old. And these women do not have any child care responsibilities, especially for children in preschool age, so 6 years old. Whereas the lowest, 49%, is for women who are actually married and have children below 6 years of age. This is happening despite the fact that women's true labor force surveys tell us they are actually willing to work more hours, they're looking for jobs, they're available to work, but the opportunities in the market are severely limited for them. Inequality of opportunities prevent women from realizing their full potential in the economy and beyond. When we look at the inequality of outcomes in the economy, we see that women, more women than men, work in care employment. And this is surely reflecting also gender social norms regarding reproductive roles assigned to women. We also see that there is occupational segregation with more women being, for instance, nurses or domestic workers, and more men being, for instance, doctors. There is also, in most countries with available data for our region, a gender pay gap in the economy with women at a disadvantage. Overall, there is a lack of decent care work in the region, with 63% of women being in informal employment. So transforming care system really calls for investment. When we look at the number of countries with system in place to track and make public allocation for gender equality and women's empowerment, only 9 countries out of 26 with available data satisfied and this criteria, meaning they have system in place. This is a necessity to be changed, because when we look at the population structure in the region, we see, for instance, that there are less women than men, and there are more women in old age group. The demand on women for unpaid care services is deemed actually to increase in the next decades. And when we listen to women through gender data, we hear from them that actually they're worried that they don't have enough money for old age, especially in South Asia, with 64% of women being very worried about, for instance, not having a pension and not having enough monetary resources for old age, compared to 55% of men in South Asia. Indeed, when we look at the projection for the dependency ratio, we see that there are demographic shifts at play. However, we see that the two different subregions are facing different demographic shifts. In East Asia and the Pacific, population projection apologies, may imply rising health care due to old age care needs and pension costs. Whereas in South Asia, challenges may lie in creating enough jobs to support a growing workforce. So how GDP can help us really informing actions toward transforming care system with this comprehensive lens? Well, first of all, GDP has many limitations from a gender lens. The informal and digital economy are theoretically included in GDP. However, in less mature national statistical system, these are not reflected due to data gaps or lack of quality, and this underestimates the contribution of women affecting gender transformative policymaking in employment, social protection, and economic planning. GDP does not also subtract the cost associated with environmental degradation, pollution, or depletion of natural resources, which can lead to an overestimation of economic welfare. These two components and limitations are actually related to measurement, to practical measurement challenges that are actually being discussed and tackled within the United Nations statistical system through the revision of the system of national account, for instance, or the system of environmental accounting. What is really worrisome from a feminist perspective is that GDP does not assess how well an economy empowers women, nor distributional justice. We know already that GDP does exclude unpaid domestic and care work due to challenges in identifying market wages. And we know that GDP overlooks important issues, such as the extent to which systems are gender blind. However, this system play a critical role in shaping the economic environment in which production and investment occur. So the Beyond GDP initiative and agenda calls for identifying a very small set of indicators between 10 and 20 that are concise, well-established, widely accepted, and comparable. Most importantly, I also want to underline that the Beyond GDP agenda does not want to complement only GDP, but also the existing SDG indicators framework, meaning that there is a renewed commitment toward existing SDGs. The call is for complementing with a small set of indicators the existing SDG framework. Because the policy objective is slightly changing, meaning that we're looking at prosperity, we're looking at the well-being of people and the health of the planet. So this report advances a short proposal on identifying metrics that are critical for advancing women economic empowerment to inform action toward inclusive economies as well as sustainability. The first dimension regards supervisory care and direct volunteer work. These are unpaid forms of work, are productive from an economic perspective. They're not included in GDP, they're not included in the SDG indicator framework. Supervisory care refers to the unpaid on-call time that caregivers spend by being in proximity to care dependent should the need for unpaid care services arise. Additional, it would be beneficial to incorporate metrics that assess the ethical standards within the production and consumption value chain, including the business adherence to human rights and women's empowerment principles, as well as green jobs. These metrics should encompass also the use of innovative technologies to promote a more ethically driven care economy, which holds particular relevance in contexts where informal employment is prevalent. Promoting the game.
Cecilia, I really need
Yes.
to mention that we need to wrap up the presentation, so we have some time to address some of the questions posed in the group.
Sure. So let me just please finish with a very short video that summarizes the main messages. This was actually the last slide, and thank you so much for your attention.
Thank you for all the content. Fantastic. Really enlightening, and congratulations for this report, which, as I said, it comes at a very timely moment to influence the construction of Beyond GDP. So we had Amber Park, we have been collecting some of the questions. My suggestion here is to turn it to her to get some of these questions loud and then give all the panelists of the sessions the opportunity to take one, let's say, to give final comments and remarks to respond them. So go ahead, Amber.
Thank you so much, Raquel, and thank you everyone for putting your comments and questions and reflections into the Q&A box. We've had lots coming through, as I said, a mix of comments, questions, and reflections. We've done our best to answer some of them live so that we make the most out of our time. We have about 10 minutes, so I'm going to choose just a couple that I think would be useful to share in this discussion time together. So let me just read out the ones that we'll ask, and then I'll point to which panelist we would like to hear from. So for some clarifications around the use and applications of the tool, we had two questions, really thoughtful questions coming through actually around how to ensure that this policy tool doesn't result in increasing occupational segregation in regards to care jobs and women in those care jobs. I'm going to ask Ipek to answer that question for us. She has put a really great question in, answer into the chat, but Ipek, I'll ask you to speak to that when we move to you. We also have a question for our country representatives. Dr. Puyal from Nepal, what are the social protection measures that Nepal has taken towards supporting women in the care economy? And Madame Bouba from Morocco, there was a question to ask about what is the timeline needed to see some of these gains? Again, really great question, reflecting on the fact that it obviously takes time to see the gains from these policy changes. We then also had a question related to our final presentation, final segment on the Asia Pacific report on Beyond GDP. And a more practical question around the upcoming process around developing indicators that complement and go beyond GDP, asking whether UN Women and ILO and others are taking part in these consultations and high-level discussions. So Raquel, I will ask that one of you. Of course, colleagues, Christine and Cecilia, please also feel free to complement. I'm going to keep it there so we've got time to hear from our panelists. Ipek, if we can start with you, and then we'll move to Dr. Puyal, Madame Bouba, and then Raquel for you finally. Thank you.
Yes, thank you for that important question on occupational segregation and whether investing in care serves in a way to increase through employment generation for women, serves to increase gender segregation of jobs. Well, the reason that we get the result from these simulations that employment creation is relatively more to women's favor than to the favor of men's employment is in fact due to the statistical fact that care sectors are more dominantly populated by women workers. At the same time, however, the more we expand care employment in a labor market, when there are increasingly more care jobs in the labor market to meet that enormous demand for care services of various population segments, what we observe is that the higher the probability that men will be selected into an expanding care services sector. At the same time, any care services expansion plan should be accompanied by specific policy and program measures to ensure that it does not increase gender occupational segregation. And I should also mention, I think Valeria added an answer also to follow from mine, where she reminds us that in making this demand side argument for placing the investments in care within a wider macroeconomic and sectoral framework as the other two policy tools do. In fact, we are working to address sectoral segregation through multiple channels. I think this is it for the time being.
Who wants to go next? Dr. Pujal, if you want to come up on the specific question on Nepal.
Okay, thank you very much for this opportunity. And the question raised here is really wonderful, and it needs or requires a very comprehensive answer, but I'll try my best to give you some logics and some evidences based on our practice and how we linked those all issues into the integrated national social protection frameworks, which already approved from the cabinet in Nepal. First of all, that measures, you are just talking about what are the measures of social protections to link with the women care walks or care walks in Nepal. Basically, we have more than 87 schemes of social protection in Nepal, and we now redesign them, and we formulated in different groups based on the nature of social protection existing in Nepal, and also based on the budgets and resources that we allocate from the government and from other sectors. So now, government's major focus is to is to make a very perfect interventions to ensure the constitutional rights of the women, children's, old age peoples, and all. That should also linked with the care work and care economy. While people work at home or at their relatives' houses or somewhere in the motive of contributions to the people or in the motive of the cultural motivations, these are to be translated into the monetary unit, and it is quite hard right now. But what we did was we just started linking the social protections schemes into the production base or productive social protection initiatives in our framework. And next one, we also developed one special, the interventions about contribution-based social protection as well. And next one, making our social protections universals and based on the philosophy of the universalism. The expansion of social protection is a basic need, but the required budget and the financial resources to make it ensure is very limited with us. So we just made some room for involving all those right-based social protection scheme into the need base. And while talking that need base, I think that care economy and care work related interventions and works, as well as the activities which have been in practice in Nepal, are to be now transferred or diverted into a kind of the self-employment related works or entrepreneurship related works, and based on the expertise, skills, and the health conditions of the people, those who are in the care works. So 16th periodic plan has envisioned, which I already also spoken about, the skilled, healthy manpower or human capital formations to make it sure for generating more jobs, more decent job and productive employment in Nepal. So for all those,
we need to close as to give floor to others to respond as well. So thank you for your.
It's finished. To do those all things, the policy is very important. So we made a kind of institutional reforms in a country. As country is now experiencing the 3 tiers of government, and constitutional rights of all governments are now under definitions, and they are also in the implementation. So data generation work is rapidly ongoing, and now we have a provision to make sure of all those formal works into the contribution-based social protections frameworks in a job market. So next one, in 16th plan, we also envisions about bringing all those informal sectors work into our account. And finally, we are thinking of about redefining the system of national accounts also into making the contributions of all care works into the monetary unit. That will be a kind of a practice, and I think globally also we can come up with that agenda. And from our experience and from our good learning,
Thank you, Dr.
the other
Hu.
peoples also
I'm
can
sorry
replicate it.
to
We are
have
doing
to
our
cut
best.
you.
Thank you very much.
Yeah, sorry to have to cut you, but otherwise we will not have time to other speakers to comment as well. So very fast, I want to turn the word also to Ms. Buba on reactions on the questions.
Merci beaucoup. Je crois comprendre que la question qui m'a été posée, c'est par rapport au timeline. Ça veut dire combien de temps cela peut prendre pour pouvoir atteindre les cibles que nous avons évoquées en termes de création d'emplois des femmes. Je voulais juste ici rappeler par rapport à la méthodologie, comment nous l'avons appliquée pour pouvoir avoir ces résultats. C'est que nous avons pris comme année de base l'année 2019, pas l'année 2020, parce que comme vous le savez, l'année 2020, c'est une année exceptionnelle avec l'avènement du Covid. Donc, il y avait eu quelques, je dirais, des données qui ne sont pas aussi fiables, qui ne traduisent pas vraiment la réalité dans la continuité et les moyennes enregistrées. Donc, nous avons pris comme année de base l'année 2019 et pour atteindre les 100% de généralisation du préscolaire comme étant une exigence pour pouvoir avoir pour avoir, je dirais, atteindre tout les 50 000 emplois des femmes, c'est par rapport à un horizon vers 2027-2028 qui est l'horizon qui a été fixé pour atteindre les 100% de la généralisation du préscolaire. Mais cela signifie comme quoi il y a aussi la prise en compte de tout l'environnement par rapport à ce qui se fait, par rapport à l'implication de toutes les parties prenantes. Je tiens juste à vous informer qu'il y a tout un travail qui se fait actuellement pour pouvoir accélérer l'atteinte de ces objectifs avec l'implication de la société civile. Le ministère de l'Éducation nationale et de préscolaire, il travaille avec la Fondation nationale du préscolaire qui fait un travail extraordinaire par rapport à un programme de formation des éducateurs et surtout des éducatrices pour pouvoir les former afin de travailler dans le préscolaire à l'échelle nationale et aussi le milieu rural. Donc, juste pour vous dire que en termes théoriques, en exploitant, je dirais, l'outil, c'est beaucoup plus à l'horizon, en partant des données 2019, c'est à l'horizon 2027. Mais on peut atteindre ce chiffre même avant parce qu'il y a tout un travail qui se fait actuellement grâce aussi au fait que nous avons pu, c'est grâce à l'implication de toutes les parties prenantes appuyées par ONU Femmes et aussi à l'implication du ministère de l'Économie et des Finances et notre direction de pouvoir donner chiffres à l'appui, l'apport, je dirais, de généralisation du préscolaire. Donc, il y a une dynamique qui s'accélère. Il y a aussi tout un travail qui se fait actuellement au Maroc parce que tout le monde maintenant et les pouvoirs publics en premier sont conscients de cette question de la baisse de l'activité de femmes. Il y a tout un travail qui se fait pour pouvoir gérer et travailler sur le préscolaire, l'accélérer et en même temps sur la question aussi du garde d'enfants. La note d'orientation générale, je dirais, qui a accompagné du chef de gouvernement, qui a accompagné la préparation du projet de loi de finances. Il a beaucoup travaillé, il a beaucoup rappelé ces questions tout en mentionnant l'intérêt je dirais, de la question de la prise en charge des enfants et des petits-enfants pour pouvoir libérer le temps aux femmes pour pouvoir accéder, sinon être retenu dans le marché du travail. Voilà ce que je voulais vous dire. Merci.
Thank you, Ms. Buba. I don't want to take too much time because I want to go to the opening remarks, but just to provide some information on the process of Beyond GDP, as stated in the Pact to the Future. There is a high-level expert group that is going to be convened to define and to discuss on these new metrics. It's headed by the United Nations Conference on Trade and Development, but it's also co-convened with other UN agencies, DESA and UNDP. And from our side, and also Valeria, you can also speak on ILO sides. We are also already in discussions with colleagues to first ensure that within this high-level expert group, we have feminist economists. Let's not forget that feminist economists had already challenged the concept of the GDP as not a good measure of what the economic contributions are. And this has been done for more than 30 years in feminist economies. So make sure experts include feminist economies, that measures bring indicators such as the one Asia compiled in such a comprehensive manner and are part of these measures. And most important, how are we going to come up with these new measures to become part of the mainstream decision-making processes where financial institutions, country institutions are also using GDP as main reference for, for many of the decision-making. So this is part of the process and how we foresee to go through that. I don't know, Valeria, you want to add anything? Okay.
Cecilia wanted.
Okay, so
yeah, just very briefly, yes. So the Beyond GDP actually calls for metrics that are already existing. So it's not about new metrics. It's about really leveraging existing gender data. So a mapping is necessarily the first step. But as you rightly said, Raquel, is indeed critical that the gender and the feminist economist perspective is included in the Beyond GDP perspective, and that's what the report advocates. But most importantly, we have been already collaborating very closely with the ILO statistics within the group of the revision on statistical guidance on time use, and there has been actually some work, a lot of work done on supervisory care has been already adopted by the United Nations. And increasingly, countries will be including and producing data and statistics on supervisory care, which is really what policies and care policies are trying to diminish the time constraint on women when they do provide unpaid care services. And this is already been included in the task force on well-being of the revision of the SNA. So to a certain extent, it's already part of the Beyond GDP and already reflect very indeed historical concerns of feminist economists. Thank you so much.
Excellent, excellent, great point, Cecilia, as well. So without further ado, thanking you all panelists for such a wonderful and comprehensive journey on going from, from the framework to the tools and then the data and evidence to influence actually these global but local processes as well. I want to pass the floor to our two colleagues, Ana Moreno, who is the Technical Secretary of the Global Alliance of Care. This and many other of the activities we have gone through during this General Assembly period have been supported with the Global Alliance. So, and then we will also turn into Sakti Daktagupta, which is the ILO Director, Condition of Work and Equality Department. I will first start with Anna, and then Sukti, you can take the floor right after. Thank you, Anna, and welcome.
Thank you, Raquel. I hope you can hear me, all of you. And thank you first of all, to all the panelists and all the teams behind the rigorous and in-depth presentations that we have seen and all the policy unit report. I echo, in fact, all the participants' comments that they have been just praising to this inspiring and solid content and event. So thank you very much. I will try to be brief because, as you can imagine, I cannot even try to conclude with remarks after having heard such a rich presentation. So thank you to UN Women, thank you to ILO, thank you to the Swiss Agency for Development and Cooperation for convening the event. And I will also like to say that during these days in the General Assembly and with the Summit of the Future, as Raquel was mentioning, we have heard a lot about the need of data and evidence to keep pushing for care as an investment and not as an expense. The cost of inaction in care systems, that there have been a lot of conversations among the members of the Global Alliance for Care, but also among other actors during these events. And I think the policy unit that you just have, the policy tool that you have just presented, as well as the report, are going to give us a lot of tools and a lot of food for thought in how to present care at the center of the development agenda and to bring the care at those discussions of the development agenda, including, by the way, what they mentioned that Raquel did to the GDP, beyond GDP comments in the and paragraphs in the Pact for the Future. I would like, again, to also mention the efforts of the UN Women Asia Pacific Office, not only with the report, but also to bring more actors and more member states and more stakeholders to the fight to recognize care as a need and as work and as a right. So thank you so much. And I will just pass the floor to Sukhdeep, if I may, because I think we are just 1 minute behind the original schedule supposed to close. But please just keep working together, and looking forward to the next event. And thank you again for all the efforts and for everything that you are doing. Thank you.
Okay, so let me jump in straight away because there's very little time. First of all, good morning, good afternoon, good evening to everyone. And it was a real pleasure listening to this webinar. I learned a lot. And thanks a lot to UN Women for the excellent collaboration on the joint program, and also to SDC and UNA for enabling this. Now, I also wanted to say a couple of words because the topic of this discussion today on data and investment in the care economy aligns very well with the recent resolution that was adopted at the International Labour Conference in June of this year by workers, employers, and governments, and which was really historic in many senses. And I would like to focus on a few very key issues in the resolution that has relevance for the discussion we had today. First and foremost, we are focusing on investment in the care economy, and I would like to say that the resolution asked governments, workers, and employers to start or to have urgent action to ensure jobs in the care economy and decent jobs in the care economy. And it also asserted very importantly that just as labor is not a commodity, labor in the care economy is not a commodity. And I wanted to underline this because while it is important to have jobs in the care economy, and indeed the care economy could be the center of jobs for the future. Many studies show, including studies by the ILO, UN Women, EPEC's work. But it's also important to invest in decent work. And there it is important to have fundamental principles and rights at work, freedom from discrimination, from violence and harassment, safe working conditions, etc., etc. And because it's only through that you can really empower the workers in the care economy, many of whom are women, to really have this transformative agenda for gender equality. A couple of words also on data, because even though there was a lot of discussion on data in the context of beyond GDP, I would like to say that as of now, we don't really have an internationally agreed statistical definition on the care economy. And in the last International Conference of Labor Statisticians, we were asked to prepare a new statistical standard, which will be presented to the ICLS in 2028. And it will really help in advancing the discussion on care because there'll be harmonized data. And it will also enhance the discussion in the context of beyond GDP. And finally, in terms of advancing decent work in the care economy, the resolution notes that governments have primary responsibility, but also does the private sector, the social and solidarity economy, the community, if we are to meet the care needs of all. And that care has to be mainstreamed into all public policies, macroeconomic policies, employment, skills, labor protection, social protection, environmental policies, etc. And that there has to be adequate financing for care through creating a fiscal space. But one more point I would like to highlight, and that is that in the context of workers with care responsibilities, the resolution recognizes the importance of maternity protection, of care, long-term care policies, paternity leave, parental leave, and has also asked the ILO to see if there are normative gaps in this respect, which need to be filled to actually advance the agenda of gender equality. So finally, I mean, because of the lack of time, let me try to bring all this together. The resolution gives us some path-breaking avenues to work on, which the ILO will be pursuing. But again, it has to be done in the context of South-South cooperation, which was recognized very strongly in the resolution, and with the partners in the context of the Global Accelerator, but also with UN Women and other organizations, because we have to push more to make the case for investment in the care economy and to create the fiscal space. Because also, and I would like to end with this, the conclusions, the resolution of in June 2024 highlighted that care work is essential for all other work, and that care is essential to further the agenda on social and economic development. So thank you all. Thanks for an excellent discussion. And over to you.
Thank you, Sukti, thank you, Anna, and thank you all the panelists, but also the institution that supported the technical teams, as well as all the people that join us. Being a challenging agenda within the United Nations General Assembly, we had a lot of really good discussions in the chat. So thank you all for joining us here, and we keep on moving the conversation ahead. So we'll see you in another meeting. Thank you so much.
Olá, sou Leandra Dal Ponte, deputada federal e secretária de Estado da Mulher, Igualdade Racial e Pessoas Idosas do Estado do Paraná. É uma alegria fazer parte de uma mobilização global, neste Dia Internacional do Cuidado e do Apoio, celebrado no dia 29 de outubro, e foi nesta data, em 2019, que apresentei no Congresso Nacional Brasileiro o projeto de lei que institui a Política Nacional do Cuidado aqui no Brasil. Atualmente, esta pauta tem conquistado espaço na construção das políticas públicas, mas ainda há muito que avançar. É preciso estabelecer políticas de Estado duradouras, construir ações, projetos, programas e benefícios, além de rever práticas culturais e estrutura legal, para que haja o devido reconhecimento, valorização e distribuição do cuidado. No Brasil, pelo menos 2,5 milhões de mulheres jovens não podem ingressar no mercado de trabalho remunerado, porque têm que cuidar dos afazeres domésticos, dos filhos ou de outro parente. Este número reflete apenas a realidade das mulheres jovens com até 29 anos de idade. As mulheres aqui no Brasil também gastam o dobro do tempo em trabalhos domésticos e cuidados. Quando comparado aos homens, há uma prática cultural que as identifica erroneamente como mais aptas para o cuidado, deixando as mulheres sobrecarregadas. Este cenário se agrava para as mulheres negras, que são a maioria, que oferecem esse trabalho de cuidado profissional e que muitas vezes é mal remunerado. No entanto, uma nova realidade demográfica está em curso. O envelhecimento populacional e a mudança nas estruturas familiares nos colocam diante do que tem sido chamado de crise dos cuidados. A população idosa vai exigir mais cuidados e apoio. Mas, por outro lado, as famílias não estão mais compostas por um número elevado de filhos, que historicamente respondiam por essa demanda. No Paraná, as pessoas idosas representam mais de 16% da população. E a tendência é que, em 2040, 1/4 dos paranaenses tenham mais de 60 anos. Já em 2030, haverá muito mais pessoas idosas do que crianças com menos de 14 anos aqui no estado. O Paraná tem sido precursor na proposição de políticas de cuidado no Brasil e reconhecido como um importante agente de transformação de políticas públicas inovadoras. O governo do estado mandou para a Assembleia Legislativa do Paraná e já está em discussão o programa Paraná Amigo da Pessoa Idosa, que irá organizar as estratégias para a efetivação e ampliação das políticas voltadas para as pessoas idosas, além de trazer um olhar atento aos seus cuidadores. O programa cria o Cadastro Estadual do Cuidador, além de prever benefícios financeiros para os cuidadores familiares, bem como estratégias de acesso à renda e permanência por mais tempo no mercado de trabalho das pessoas idosas. Ampliaremos a rede de atendimento para essa população, com foco no envelhecimento ativo, com saúde e manutenção dos vínculos familiares e sociais. O governo do estado do Paraná está atento aos novos desafios e foi o primeiro estado aqui do Brasil a ingressar recentemente na Aliança Global pelo Cuidado, que é uma importante plataforma para avançarmos com a agenda do cuidado a nível nacional e internacional, além de promover a troca de experiências e fortalecer as iniciativas locais. O nosso programa Paraná Amigo das Pessoas Idosas é mais do que uma medida administrativa, é uma visão estratégica do governo do estado do Paraná que está preparando o nosso estado para o futuro, para que aqui no nosso estado o envelhecimento seja sinônimo de respeito, dignidade e qualidade de vida. Muito obrigada, um orgulho hoje, no Dia Internacional do Cuidado, estar junto com vocês.
Saludos desde la Confederación Sindical Internacional, organización que representa más de 191 millones de trabajadores y trabajadoras en 169 países y territorios y que cuenta con 340 organizaciones afiliadas nacionales. Tenemos una histórica resolución sobre el trabajo decente y la economía del cuidado. Esta resolución fue adoptada en la Conferencia Internacional del Trabajo el pasado mes de junio, entre los gobiernos, empleadores y trabajadores. Y esta resolución reconoce, primero, que el cuidado es esencial para el bienestar humano, social, económico y ambiental, y para el desarrollo sostenible. El trabajo del cuidado, remunerado o no remunerado, es esencial para realizar cualquier otro tipo de trabajo, pero también reconoce que el trabajo decente para los trabajadores y las trabajadoras del cuidado contribuye a asegurar cuidados de calidad, la concentración y la retención de trabajadores, y la promoción de la igualdad de género. También contrarresta la escasez de personal y fomenta sociedades y economías resilientes. Es necesario adoptar medidas urgentes para lograr que el trabajo decente en la economía del cuidado sea una realidad, pero también promover que el trabajo decente sea garantizado y que se pueda tener acceso al cuidado para todos y todas. Lo que es importantísimo resaltar en esta resolución es que prescribe las acciones y medidas que los gobiernos, empleadores y trabajadores y sus organizaciones necesitan tomar, así como los principios rectores claves que todos y todas debemos tener en cuenta al tomar estas medidas. Y hay que asegurar que todas nuestras acciones deberían impulsar un enfoque del cuidado basado en los derechos y que también deben estar fundamentadas en las normas internacionales del trabajo, en el diálogo social y guiarse por el marco de las R5 para que el trabajo de los cuidados sea decente. La resolución reafirma el papel del liderazgo mundial de la OIT para hacer avanzar la agenda del cuidado a nivel mundial, regional y nacional. Y este 29 de octubre, Día Internacional de los Cuidados y el Apoyo, un día que fue iniciado por nuestro movimiento sindical internacional en 2019 y que fue reconocido el año pasado por las Naciones Unidas, reafirmamos nuestro compromiso para seguir la implementación de esta resolución en todas las partes del mundo y llamamos a los gobiernos, a reconocer los cuidados como un derecho humano, como el derecho a prestar y recibir cuidados y a autocuidarse y que sea también un bien público. Este reconocimiento significa que los gobiernos deben tomar acciones y medidas según las prescritas en la resolución para fomentar mayores inversiones públicas en los servicios del cuidado y apoyo de calidad. La adopción de estas políticas relativas al cuidado, el trabajo decente para todos y todas las trabajadoras son muy importantes en este contexto. Así que vamos a luchar por avanzar y reafirmar nuestro compromiso con estas resoluciones y así poder tener un mundo cada vez más justo en igualdad de género y con el respeto a los cuidados. Muchas gracias.
Yes, so this will be for your moderation to stand here. So Edie will stay on the podium. On the podium, on the bench. We'll try to get a nice as well.
Okay. So I'll sit in the meantime.
Up to you. Up to you. I mean, I think Raquel envisioned that you.
No, I don't welcome people.
You will introduce. You'll say thank you. First question. So you'll say.
So I meant to introduce Edie.
No, that's the first panel, and we have Rena, who's our MC.
It's the first panel.
Yeah, so there's going to be a first.
Okay, I had the sense that this was the first panel. Maybe I misunderstood.
Event for UN women.
Oh, Rena is the.
Yeah, so
okay.
Rena's going to do the MCing.
Okay, from here. Good morning, everybody. My name's Rena Ninen. I'm going to be your master of ceremony today. We want to begin, if you don't mind, with a photo. We'd love for you guys, actually, if you don't mind, as you're taking your chair, to stand up. Good to see you, Father. We'll take a quick photo before we begin, and we'll begin in just a moment. All right, thank you guys so much. I am so excited to be here today for celebrating International Day of Care and Support and looking at how we can strengthen our global commitments to transforming the care system. I took the train in today from Connecticut. It was an hour drive. I spent 15 minutes trying to find out new childcare because my husband will be taking a new job here in New York City. This is an issue that affects every household, every family. So I couldn't be more thrilled to welcome our esteemed panelists and to kick it off. As I mentioned, my name is Rena Ninen, and I want to kick it off with an esteemed opening remarks from Her Excellency Sima Sami Bahaus, Undersecretary General and Executive Director for UN Women. Sima.
Thank you. Thank you very much, Rena. Good morning, everyone. Excellencies, ladies and gentlemen, dear guests, dear colleagues, I am honored to join you for this year's United Nations observance of the International Day of Care and Support. Today and every day, we recognize the skilled and the essential work of paid and unpaid care workers around the world. Care work is the backbone of our well-being and prosperity. Without it, our societies and economies would simply not function. Yet, it often remains invisible. The significance of unpaid care has been enormously undervalued and overlooked in public policy and excluded from metrics of economic progress paid care work. Meanwhile, it continues to be undervalued and underpaid. Excellencies, care work is a gender equality issue. We all know the data. Women and girls remain the default providers of this essential labor, engaging in more than 2.5 times as many hours a day in unpaid care work than men. An estimated 80% of paid domestic workers worldwide are also women, with 9 out of 10 of them working without social protection. It is women living in poverty, migrant women, women informal workers who shoulder the largest share of unpaid or underpaid care work. These numbers are not just numbers. They reflect deep structural barriers that create unequal opportunities and outcomes for women and girls in education, in employment, in leadership, and in financial security across their lives. They reflect a profound disconnect between what is essential for societies and economies to thrive and what is prioritized in policies and budgets. We know that investing in robust care politics, quality care, services, and basic time-saving care infrastructure is a triple win for individuals, for communities, and for economies. These investments can simultaneously reduce women's time and income poverty and enhance their labor market participation. Evidence shows us that investing in care can increase the number of decent care jobs, potentially creating 300 million jobs by 2035. Excellencies, today we are calling for care work to be valued as a public good, as skilled and essential work, and for quality care and support to be recognized as the basis for equal participation in society. UN Women stands committed to working with you to transform care systems and to build thriving, equitable, and sustainable economies and societies for generations of today and tomorrow. We are making great strides. Countries such as Australia, Brazil, Cape Verde, Chile, Colombia, Kenya, Panama, Uruguay, among many others, are progressing national care policies or strategies, and I applaud their efforts. UN Women is further advancing this critical work through our global initiative, Transform Care, working with our partners and allies, member states, civil society organizations, the private sector, and UN agencies to advance valuing care through comprehensive policies. The new UN system-wide policy guidance on transforming care systems, developed under the leadership of the Deputy Secretary General, Ms. Amina Mohammed, which UN Women proudly co-led with ILO, OHCHR, UNDP, and ECLAC, gives us a roadmap for getting there. So, Excellencies, let me also say that next year we will approach 30 years since the Beijing Declaration and Platform for Action. Let us leverage this opportunity, continue to build momentum, and push for stronger commitments to action to transform care systems. Let us commit to build caring, thriving, equitable, and sustainable economies and societies for today's and tomorrow's generations. I thank you.
Seema, thank you so much. 30 years since Beijing. What great points you've made today. I'd like to go next to His Excellency, Mr. Bob Ray, who's president of the Economic and Social Council, ECOSOC, as you guys know. And I also want to remind everyone, we do have translation in Spanish, French, and English. So please be aware that that is also available.
Excellencies, distinguished delegates, I'm very pleased to join you today as we observe the International Day of Care and Support. I want to commend UN Women, the ILO, and OHCHR for convening this very important discussion. Care and support, both paid and unpaid, are vital. They meet the physical, the psychological, and the emotional needs of care receivers, ensuring their dignity, their agency, and their well-being. It benefits everyone, societies, economies, families, and individuals. Unpaid care work is especially demanding for women and girls, particularly those in rural areas or in single-parent households. This precarious situation, combined with inadequate social protection, can, in fact, trap them in a cycle of poverty and further delay the achievement of gender parity. And those women that are paid for their care work are often subject to informal or underemployment. The disproportionate impacts on women and girls of the care economy are undermining their rights and their ability to build the future that they deserve. Yet we know what needs to be done. The most recent ILO resolution on decent work in the care economy establishes a common understanding of this care economy. The ILO 5R framework of decent care work, recognition, reduction, redistribution of unpaid care work, and reward and representation of workers is actually a compass to promote care and support for all. In July of this year, ECOSOC held a first-of-its-kind discussion on promoting care and support systems. The meeting built on the historic adoption of Resolution 2024-4. In that resolution, the Council emphasizes the importance of establishing care and support systems which are human rights-based, gender-responsive, and disability-inclusive and age-sensitive. And the Pact for the Future calls on member states to significantly increase investments to close the gender gap, including in the care and support economy. My dear friends and colleagues, our commitments are very clear. We have the knowledge to chart a path forward. So let our actions be inspired by those care and support workers that are working tirelessly every day to strengthen our communities. And in turn, let's support them through effective policies that safeguard their livelihoods. ECOSOC remains committed today and every day to reinvigorating our efforts and fully realizing these commitments.
All right, Mr. Ray, thank you so much for that. And without further ado, we're going to get right to our first panel where we're going to look at advancing the transformation of care systems, policy options, and entry point with Sarah Hendricks, UN Women Director of Policy Program and Intergovernmental Division. Sarah.
Thank you so much, Rena, and colleagues and excellencies. It is truly my privilege and pleasure to moderate this session as we hone in on some of the very concrete advancements at national, regional, and at global levels that governments are making to advance a transformative care policy agenda. We are really honored to have such an esteemed panel today with representatives from 6 different countries, each bringing a unique perspective and very concrete experiences that we hope we can all learn from. So let's jump into the dialogue. And I'll start first with you, Her Excellency Paula Narvaez, the Ambassador and Permanent Representative of Chile to the United Nations. Your Excellency, Chile has recently introduced a new bill. A bill, as I understand, that will establish a national care system known as Chile Cuida, if I'm not mistaken. Very good. Or in other words, Chile Cares. We would love to hear more about what this bill proposes and why you're hopeful for it to make a difference. Over to you.
Thank you so much, Sarah. And thank you, of course, Sima, for this important gathering. And also I want to thank you, my fellow panelists here, for being here today in this important matter. If, with your indulgence, I will shift into Spanish so you can use this thing. So, muchas gracias.
Thank you very much. I wish to thank the organizers of this important event, and I will address the question asked by Sarah. We believe that this is a historic occasion, this International Day of Care and Support. It is something which, as we all know, it's a new commemoration, but its meaning cannot be underestimated. In only its second year, this year has begun to change global conversations on care, increasing awareness on a concept that for a long time has been undervalued, but which is vital for the well-being of our society and for the achievement of the SDGs. For Chile, care is not merely a service or a policy. It is a human right, a pillar of dignity, and a basis of equality. The law called Chile Cuida is an initiative which is a decisive turn point in our national life, in our movement towards social justice and gender equality. Its purpose is to establish a national care system which goes beyond the delivery of services, which redefines care as a shared responsibility shared by society, changing how we value, distribute, and support care work. Some of the more significant provisions of this law establish or propose the establishment of a universal care network devised to meet the various needs of the population. It reflects the commitment to offer accessible care services of quality for all, and especially for those who have been historically excluded or marginalized. And this leads me to one of our urgent commitments, the care of older adults. Chile is proud to preside the group of friends at the United Nations. We advocate for the dignity and of the well-being of all older persons throughout the world. We want to create a robust and inclusive system, and this reflects our commitment. Older adults are essential for the fabric of our society. Through this initiative, we empower them so that they can live with dignity, also recognizing their valuable contributions to families and communities. May I also say that among older adults, there is a very high number of women. So that is a dual fact. The care person is a woman and the recipient of care work is a woman. So we need to bring dignity to both. This law goes beyond the traditional concept of providing care. It seeks to address one of the most persistent and unfair inequalities in our society, the undervaluing of unpaid care work. As Ina said in her statement, and as the president of ECOSOC also stated in his video, for a long time, care work has been invisible. It has been hidden in the homes, provided mostly by women, and is treated as if it had no economic value. But it is the backbone of our economies. It provides for everything else working. Through the law, we want to change this reality. We are all here today because someone is allowing us to be here. And that is a daily matter. So we need to recognize the importance that if the world can work, it's because there are people behind it that allow it to work. And what we want to achieve through this law in Chile is to achieve recognition from the standpoint of dignity and rights, but also from the economic standpoint. This has been recognized by the specialized agencies of the system, including UN Women, ECLAC, UN Women, ILO, all the ones who have recommended this policy. I won't continue to speak because I get emotional. Chile is interested in, we are introducing policies which offer incentives and support for men to take on care work. We are changing cultural patterns that have placed the burden of care work on the shoulders of women. Chile also emphasizes the professionalization of care work. Care workers, many of whom are women and persons in low economic situations, deserve to be treated with respect and dignity as required by their work. This law offers ways in which the workers receive training, formal recognition, and protection under labor laws. That means that this law is a transformative within those that vie for gender equality and social justice in our country. We want full participation of women in our economies through empowerment, through the support of equitable policies. We want to release the whole potential of women to contribute to the labor force, to achieve economic independence, and to fully participate in the various areas of society, including politics. Chile's efforts to promote an approach based on care work are not limited to our national borders. It was our honor to submit on behalf of the group of countries clear resolutions of the United Nations establishing this day, the International Day, as a resolution in the Social Development Committee to promote these systems as pillars. Chile wants to change care work as part of a broader movement. That is why multilateralism is so important. In celebrating today the International Day of Care and Support, we recall that our challenges are shared. They are collective. Through this law, we establish the basis for a future in which care is not viewed as a burden, but as a shared responsibility, valued, and one that has dignity. Thank you, Sarah.
Muchas gracias, Ambassador.
Thank you very much, Ambassador.
An impassioned perspective, grounded in both the case for investing in care as well as the concreteness of a government that has moved such an important policy forward. You've drawn our attention also of centering rights, dignity, and equality through national care policies. And we can't wait to hear how this transforms lives, households, societies, and the economy across Chile. Thank you, Ambassador. And now, colleagues and excellencies, let's move to another continent, looking now at Kenya, and here at what Kenya is doing in shaping its first ever national care policy. We are so delighted to be joined by His Excellency Ekitela Lokale, Ambassador and Permanent Representative of Kenya to the UN. And dear Ambassador, we are eager to hear more about Kenya and the development of its first ever national care policies. Could you share more about your experiences in the prioritization of care in your national policy agenda, as well as in the development of the policy across Kenya? The floor is yours, Ambassador.
Great. Thank you. Thank you very much. I'm honored to join everyone this morning in marking the International Day of Care and Support. This is one issue that the government and the people of Kenya are very, very passionate about, and I'm therefore very pleased to be here with you. Let me preface my intervention by restating the following fundamental points, which I'm sure most of you are familiar with. My colleague, my sister, the Ambassador of Chile, has said that, the notion of care and support is essentially a human rights issue. It's intended to, protect the dignity of those people in need of care and support. Whether you're talking about children, older persons, persons with disabilities, I think the fundamental aim of care and support is to protect the human rights of those people. Second, this point has been made as well, that caregiving is often not treated as valuable or remunerable work, which means, therefore, that both caregivers as well as the care recipients are in need of protection. A third, a majority of caregivers, by default in most jurisdictions, are women and girls. So that creates a gendered dimension of division of labor, which means, therefore, that those disadvantages that women and girls suffer then get exacerbated by virtue of being caregivers. And then finally, because we are talking about the context of SDGs, the quality of care and support that we're able to provide has a direct impact on whether or not we are going to attain SDGs. And you can talk about all the SDGs, all of them without exception. So in summary, therefore, care and support is an issue that raises a lot of policy questions on which policy responses are required. In the Kenyan experience, the process of developing our national care policy is underway. As we speak, we have a draft national care policy, in the process of formulation of which we've been able to draw a number of important observations that I'm honored to share with you this morning. First and foremost, the Constitution of Kenya, which has been billed as one of the most transformative constitutions, not just on the African continent, but across the world, makes the general rules of international law and all the treaties and conventions that Kenya is a state party to or has ratified part of our national legislation. So if you look at all the resolutions, whether resolutions of the General Assembly, resolutions of the Economic Social Council or the Human Rights Council on the issue of care and support, they talk about human rights and they reference, Universal Declaration of Human Rights, International Covenant Civil Political Rights, Economic Social, all of them. So by virtue of this provision in our Constitution, then those provisions of international human rights law then become part of our national law. Why is that important? It therefore means that as we develop any policy, including the national care policy, we have to make sure that it meets the provisions of our Constitution, of which the international human rights standards are a part. So for us in Kenya, a national care policy and the development of this as a human rights issue is not a matter of choice, but one of constitutional duty and imperative. The second observation or reflection that we are willing to share this morning is that having credible data is important as you define or determine the extent, the depth and urgency of the problem. So in the absence of data, then you're not able to define how big the problem that you're dealing with is. And I'll give 3 examples from our Kenyan experience. In 2014, the government of Kenya developed a national policy for older persons and aging. You know, it's been in place for a decade now. But because that policy was put in place in the absence of data, it was therefore difficult for the government to put in place targeted interventions that would enable us to provide care and support for older persons. So when it came to implementation of the policy, then gaps persisted. Learning from that experience, 7 years later, Kenya conducted the Kenya Time Use Survey of 2021. And this survey came up with very interesting findings. For example, it said that women and girls, you know, who are the major providers of care and support, spend 4 hours and 30 minutes every day doing domestic work, compared to their male counterparts who would spend an average of 54 minutes. So meaning, therefore, women were spending 5 times as much time on domestic care and work than their male counterparts. So if you are spending that amount of time and it's on work that is not valued, that's not remunerated, then you can see how that then impacts on the ability of women to provide for themselves, provide for their children, and to be able to achieve certain goals. And then the third example, in 2023, the National Council on Population and Development did a survey that indicated that we have about 2.7 million older persons in Kenya, and this number is growing rapidly at the rate of 41%. Meaning, as a policy maker, therefore, if you are making provision or providing for older persons, the care and support of older persons, then it means that, for a start, you have about 2.7 million, which translates to about 4.9 to 5% of our population to make provision for. And that, you know, a number is growing rapidly. So the point we are making, therefore, is, you know, in our experience, the importance of having real credible data will enable you to develop policy responses that would enable you to make targeted interventions in the area of care and support. A third, we need to redefine a way in which we view the relational nature of care and support to make sure that it's not viewed as an unpaid social work, but rather a public good that's worthy of investment. In Africa, and colleagues who work in that continent, and even most of the global south, you know, domestic work is provided by relatives. So you see that as a relational, social good by a relative that is not deserving of reward or compensation or remuneration. But I think it needs to be looked at, because the moment you see that as a public good in which governments and international organizations need to make investment, then that way you look at it differently. And, you know, just as we are developing our policy, we did, jointly with UN Women in 2022, the Kenya National Care Needs Assessment Report. And what that report revealed was that the care sector actually contributes 6.8% of the GDP of the country. So you start looking at care and support as something that actually contributes meaningfully and substantively to the national economy. And what does that do? Then it drives government to start taking it seriously. If you are told that 16% of the women that are working work in the area of domestic care and support, you know, that's quite a big proportion of your population. In conclusion, what have we drawn from all those with the draft national care policy in Kenya? In the end, we've come up with a draft national care policy that has proposed several actions, including, 1, the establishment of an integrated database for older persons, again, data. 2, establishing a cash for care benefit system. So it makes, a paradigm shift that then begins to look at care as a sector that is deserving of cash benefits. Scaling up community outreach programs, initiating private-public partnerships on provision of care, developing comprehensive regulations for the establishment and management of elderly care facilities, and creation of new jobs in the care sector, in particular geriatric care workers. In conclusion, it is imperative that we recognize the care economy as a vital driver of economic growth and social stability. By supporting caregivers, especially women, and implementing comprehensive policies, we can unlock the full potential of this sector. The government, alongside community organizations and private stakeholders, have a crucial role to play in creating an environment that values caregiving and enhances the quality of life for all people. On our part as a delegation, I would like to give the commitment of the government of Kenya to work with other member states, as well as agencies such as UN Women and others, to ensure that care and support gets the recognition that it deserves and that care and support work is actually valued. Let me end by wishing everyone a happy International Day of Care and Support. I thank you.
Thank you. Thank you. Thank you so much, Ambassador Asante Nisana, to the Ambassador Locale, who has provided us with such concreteness from Kenya, reminding us about the economic value of care. I think you mentioned 6.8% to GDP. This is astounding. And also, Ambassador, really pointing to the power of data. The power of data to lead to solid policy, highlighting the disproportionate burden of care that women carry of 4 hours and 30 minutes versus 54 minutes. I was struck by this data point, Ambassador. And thank you also, Ambassador, for reinforcing the importance of shifting the paradigm of care from a burden to a public good. And now let's build from this conversation, and we'll move on to yet another country, this time to Canada, to hear from His Excellency Michael Gort, who is the Ambassador and Deputy Permanent Representative of Canada to the United Nations. Your Excellency, Canada is one of a few countries, a growing number of countries, in fact, to have a feminist international assistance policy. And this policy includes a focus on addressing the gendered inequalities in unpaid and paid care work. Ambassador, we would be eager to hear why Canada has, in particular, prioritized funding in its international assistance for standalone programming on the care economy, and what your hopes are for the results of this type of investment. Ambassador, you have the floor.
Great. Thank you so much, Sarah. And I'm really pleased to be here today on the International Day on Care and Support, and especially with co-sponsors and friends, Brazil, Chile, Mexico, the Philippines, and Spain. And as you mentioned, Sarah, Canada is proud to have adopted a feminist international assistance policy, which for us means, and I know other colleagues here at the table have done so as well, which for us means taking an explicit feminist approach to help address global challenges, including the huge challenge that is unpaid care work issues and the disproportionate proportion of care shouldered by women and girls around the world, what we've been hearing about over the last little while. In Canada, we decided to view care and support through the lens of our Feminist International Assistance Policy, or FIAP as we call it, because we recognize that while care is essential for human well-being and sustainable economic growth, and I think, Paula, you spoke to this earlier, it is insufficiently recognized and valued. It perpetuates gender inequalities, and it also leads to lower social and economic outcomes. And it is the unequal distribution of unpaid care work and the low quality of many paid care work opportunities that infringe on the rights of women and girls. When women and girls are forced to take on this burden, they are more likely to be vulnerable to serious human rights violations, such as discrimination, sexual and gender-based violence, amongst many others. And taking a feminist approach for us also requires a whole of society transformation. We're talking about, I guess, a cultural change, a societal change when looking at care and support. It means changing harmful social norms and expectations about gender roles in the care economy and raising the value that this work generates for everyone in the economy and society. And as Ambassador Locale said earlier, we also believe that care is a public good, that it is a shared responsibility between women and men, boys and girls, and the engagement of diverse actors such as communities, civil society, obviously the state, and the private sector in this space is critical. And that's why, to now come to your specific question, Sarah, why the Generation Equality, at the Generation Equality Forum in 2021, our Prime Minister announced that Canada would commit $100 million in new funding for standalone programming to address issues in unpaid and paid care work in low and middle income countries where Canada provides international assistance. Canada's standalone programming is also addressing this issue by seeking to transform social norms, as I said earlier, to recognize, address, and reduce the unequal distribution of unpaid and paid care work, and to ensure that unpaid and paid care workers are represented and have their voices heard and their rights supported and protected. To date, projects announced under the commitment are implemented in different regions in low and middle income countries and engage a broad range of actors, and they have so far surpassed our expectations. So we continue to see progress when we work together to implement projects aimed at transforming care and support systems, and Canada will continue to work with all stakeholders at all levels, including the UN, to ensure that care and support systems are effective, that they promote and respect human rights, and that they deliver on our shared commitment to leave no one behind. Thank you very much. Over to you, Sarah.
Thank you so much, Ambassador Gort, for highlighting for us the very transformative potential of a feminist international assistance policy. It was actually an unprecedented moment to hear the Prime Minister's announcement of $100 million of ODA dedicated to addressing care and support, both in terms of unpaid and paid care workers. And we're so thrilled to see the ways in which this investment is transforming lives around the world. Thank you. And now, colleagues, let's go yet again to another part of the world. Here we will return to Latin America. And I have just to my right, Her Excellency Alicia Buenrostro, the Ambassador and Deputy Permanent Representative of Mexico to the United Nations. Your Excellency, Mexico recently elected its first ever female president. Congratulations.
That's very right.
Yes. Thank you. What a historic milestone. Your Excellency, under this new leadership, how does Mexico plan to continue advancing in its transformative care policy agenda? The floor is yours.
Thank you so much, Sarah. And on behalf of Mexico, I would like first to begin by thanking UN Women, ILO, and the OHCHR for organizing this event and inviting Mexico to participate. I also wish to express that on the International Day of Care and Support, Mexico reaffirms its commitment to building an inclusive and supportive care system. Exactly 1 year ago, you will remember, I stood up in this room alongside other colleagues, sharing the importance of having achieved Resolution 77/317, and celebrating this day for the first time. Today, a year later, I emphasize again the relevance of this occasion. The historic adoption of this day has contributed to making more visible an issue that for many years was almost entirely ignored, leaving women, girls, and other caregivers in the shadows. As many here know, women and girls bear a disproportionate share of unpaid care and domestic work, and this labor is not acknowledged as it should be. Indeed, some authors have referred to this as invisible labor, work that women and girls often do but remain unseen. Yet, we are working to change this reality, and you have seen and you have heard from all my colleagues here in this panel. We are working to change this reality, and as you will witness, the testimonies of caregivers that we will hear today are not invisible. Let's keep shedding light on what has been hidden for years, because if we are here today, it's because someone, as Paula said, at some point took care of us. Thus today, as it always should be, we shine a light on caregivers. We recognize you, we see you, and we will defend you. This unequal distribution of unpaid care and domestic work between women and men, girls and boys, and within households cannot continue. Although it has persisted as a historical and structural inequality, it must change, not only because it prevents women and girls from realizing their full potential, but also because it holds back the world, including future generations, as well as those who shaped our lives, such as our parents and our grandparents. It also hinders our commitments as states, blocking the achievement of Sustainable Development Goal 5 and the 2030 Agenda as a whole. Yes, as a whole. Faced with this reality and recognizing that women and girls bear a disproportionate share of unpaid care and domestic work, we, as member states, have the responsibility to strengthen care and support systems and drive change. And in this regard, both internationally and nationally, Mexico has implemented policies and programs aimed at recognizing and redistributing care work. And it will continue to be so during our first female president that has taken over just 3 weeks ago. As part of our feminist foreign policy, we are indeed encouraged by the achievements we have made at the international level, starting with the creation of the Global Alliance for Care. We have also promoted the recognition of the right to care through the Alliance, which brings together governments, civil society, trade unions, philanthropy, international organizations, and academia to advance the care agenda from the local to the global level. Additionally, we have pushed forward 3 resolutions on this topic in the General Assembly, the Human Rights Council, and the UN Commission for Social Development. We take this very seriously. At the national level, Mexico has also taken action to recognize, redistribute, and value the care work that women and other caregivers perform daily. Our recent National Care System survey revealed that 77.8% of households in Mexico have individuals requiring care, and in most cases, mothers, grandmothers, and daughters are the primary caregivers. Among our efforts, I want to highlight the Mexican Institute for Social Security Daycare Centers, which provide care for children from 40 days old to 4 years old. From 2019 to 2023, these services supported more than 160,000 individuals, 112,700 mothers, and more than 54,000 fathers. Another innovative initiative is the creation of the Care Map, which helps citizens locate care services throughout the country, which has become very important and will continue to be so under President Claudia Sheinbaum. From a legislative perspective, in 2020, Congress approved the reform of several articles of our Constitution, which, among other things, recognizes the right to care, the freedom to care and decide on one's own time, and the creation of the National Care System and public care services under the law. This reform is still going through the whole legislative process, but we are confident that Mexico's first female president will further push the establishment of the national care system. Having outlined these actions, I affirm that within the framework of our feminist foreign policy, Mexico will continue to lead the path toward a future where equality and respect form the foundation of our international and social relations. Considering that we are soon to commemorate the 30th anniversary of the Beijing Declaration and the Platform for Action, and with just 6 years left until 2030, focusing on and investing in this agenda is essential. Finally, the impact of a care-focused society is undeniable, not just for individuals, but for all areas of life. Revolutionizing care means revolutionizing structural inequalities and transforming our relationship with ancestral knowledge, infrastructure, and public budgets. It also means continuing to make visible what was invisible for many years, because what is not recognized cannot be addressed, right? Nor can it be redistributed. Hence, the importance of this day and of continuing to shed light on the backbone of our society, caregivers. Thank you.
Thank you so much, Ambassador, for reinforcing also the power of visibilization. The power of visibilization to recognize and value care work, as well as to ensure innovations to strengthen care and support systems. And I'm so glad that you also raised as well the Global Alliance for Care, which has manifested such a strong multi-stakeholder movement to care and support and has influenced the advancement of new and influential normative frameworks. Thank you, Ambassador. And now, colleagues and excellencies around the room, both physical and virtual, we will now move to Southeast Asia, where we'll hear from the Philippines and from Ambassador Leila Laura Santos, the Deputy Permanent Representative of the Philippines to the United Nations. You are very welcome. Your Excellency, last year, the Philippines passed the Caregivers Welfare Act of 2023. Ambassador, we would love to hear what the scope is of this act and what rights it enshrines for caregivers. Ambassador, the floor is yours.
Thank you very much, Sarah. From the outset, I would also like to extend our gratitude to UN Women, ILO, OHCHR for organizing this year's International Day of Care and Support. The Philippines is very honored to be part of the core group and a main sponsor of the resolution that established this day. I'm also honored to be part of this panel with fellow strong advocates and implementers of care and support. We support and align with all that was said before me. Last year, the Philippines had the opportunity to share some of our insights, and I vividly recall one key takeaway, and this is the crucial role of legislation dedicated to care work. Building on these discussions, the Philippines further strengthened our legal framework by enacting the Caregivers Welfare Act of 2023, marking a significant step in protecting and empowering caregivers who play a vital role in our care systems. This legislation was driven by our recognition that the well-being of caregivers is foundational to achieving equitable, resilient care infrastructure and, by extension, the SDGs. It establishes comprehensive protections for domestic caregivers employed in private homes, nursing and care facilities, and other residential settings. By formalizing what was once an informal arrangement, we secure social protection for caregivers and recognize their role as essential healthcare contributors to national development. These protections apply whether caregivers are hired directly by an employer or through public employment service offices or private employment agencies. The Act guarantees fair compensation and working conditions. Caregivers are now entitled to standardized employment contracts that ensure fair compensation, including payment every 2 weeks or twice a month. Employers are further obligated to provide basic necessities aligned with the caregiver's religious and cultural practices, humane sleeping arrangements that respect caregivers' privacy and overtime pay, night shift differentials, and a 13th month salary. Those employed for a year are granted a minimum of 5 days of paid service incentive leave, as well as access to other statutory benefits such as Social Security and health insurance. In terms of protection against abuse, this law provides caregivers with the right to terminate their contracts if they experience verbal or emotional abuse, inhumane treatment, or physical abuse. We believe it to be a crucial safeguard to protect those who devote their lives to caring for others. To ensure that caregivers can continuously develop their skills, the law also promotes upskilling and reskilling through training and certification opportunities. This enhances the quality of care provided while supporting the professional development of caregivers. Importantly, this legislation contributes to the empowerment of women, as caregiving roles are predominantly filled by women in the Philippines. The Caregivers Welfare Act, alongside the Domestic Workers Act of 2013, work to elevate the status of caregiving and acknowledge its critical contributions to both families and economy. It ensures that women caregivers are safeguarded from exploitation and provided with the resources they need to thrive. Our Labor Department, along with other agencies, is working to finalize the implementing rules and regulations. This will include comprehensive provisions addressing the recognition of caregivers' rights, health and safety measures, and social protection. Additionally, our Department of Migrant Workers will issue specific rules for overseas Filipino caregivers to ensure their safety through their employment and reintegration upon returning home. To conclude, allow me to stress that comprehensive care and support systems act as cornerstones of building inclusive societies and serve as catalytic accelerators for the 2030 Agenda. Today's discussion highlights progressive policy approaches that drive transformation in care systems and advance gender equality commitments aligned with the Beijing Declaration and Platform for Action. As we prepare for the Beijing Plus 30, let us all commit to honoring and empowering caregivers through policies that uphold their dignity and essential contributions to our shared development goals. Thank you.
Thank you so much, Ambassador Laura Santos, for highlighting especially the crucial role of legislation to advance protection for caregivers across the Philippines. And now, colleagues, we will turn our focus to advancements on the global stage. And here, on behalf of the Ambassador and Permanent Representative of Spain to the United Nations, from Francisco Lopez, who is the Counselor for Gender Issues at the Permanent Mission of Spain. Counselor, we are very grateful you're here, and we know that next year is an important year, as Spain will host the International Conference on Financing for Development. Financing for gender equality will no doubt be an important issue on the agenda. We would welcome to hear from you what policy measures you see as important to ensure sustainable long-term financing for care systems. Councillor, you have the floor.
Thank you, Sarah. Let me first thank all the organizers and all of us present here at this event for the opportunity to celebrate today the International Day of Care and Support. Unfortunately, as I've been upgraded in this table, as you said before, Ambassador Gomez Hernandez could not make it here today. We are all destined to be cared by others at some point in our lives, or to be caregivers. And it is time we recognize the role of caregivers in our societies, in our economies, in our lives, when we most need them. As Ambassador Narvaez has said, if we are here today, it's because of somebody is providing care or has provided care for us. To come back to your question, the 4th International Conference on Financing for Development that will take place in the beautiful city of Seville next year is an opportunity for integrating gender equality and care systems in all the development components. In fact, the desired outcome of that conference is to consider a new paradigm for development financing, one that is not constructed at the expense of women, but for women and with women. In Spain, we advocate for a gender-responsive financing for development agenda. Therefore, in our national capacity, we will contribute to secure ambitious and transformative actions to address it and to ensure that gender equality is mainstream in the new Financing for Development framework. Boosting care systems on a global scale is one of the Spanish government's top priorities. In fact, the President of the government, Pedro Sánchez, has recently committed to this end when appointed as a champion for gender equality at the UN Women He for She Alliance. Allow me to point out 4 main ideas my country is working on and that we hope to bolster during the negotiations at the conference. All of them have implications for the care economy. The 4 points is resources, capacity building, data, and gender parity. Resources. Securing and mobilizing financing. Recommit to 0.7% of official development aid, more particularly increase allocation to partners such as UN Women to work on gender equality. Spain has done so in our new cooperation law. It defines our development cooperation policy as a feminist, sustainable development cooperation, and the 0.7% is now a legal commitment to be met by 2030. Capacity building. We need to invest in capacity building and concrete tools to make the gender approach in financing a reality. It needs to be embedded in all policies and instruments, including the care economy, women political and economic participation, access to finance and land rights, sexual and reproductive rights, gender-sensitive budgeting, among others. Data, as mentioned by Ambassador Gott, that is very relevant. Gender indicators, they are a big piece of the puzzle. As we increase strategies and design finance and innovative tools, data and data will be key, not only to measure the impact of the new tools, but to introduce data early in the use of these tools. For instance, from green bonds to sustainability bonds with a gender approach. And last, gender parity. The banks that make financing possible must have gender parity. As I pointed out before, development financing must not only be made for women, but with women also. If we want an international financing architecture for sustainable development that is fit for purpose. In conclusion, we need a persistent gender intent in financing. And for that, we need to amplify these debates, like today on the occasion of the International Day of Care and Support, and keep exchanging ideas to make the shift happen. Thank you.
Thank you so much, Councillor. Indeed, for your words. We look towards next year's Conference on Financing for Development as really a key imperative, a key moment to take care and support from the periphery and place it more at the center of financing dialogue, to explore not just public finance management systems and their critical role to open fiscal space, but to also explore, as you said, the imperative of data, the imperative of innovative financing mechanisms and solutions to advance important investment into care and support systems. Thank you, Councillor, and thank you for Spain's leadership. And now, colleagues, we will turn to listen to our final speaker of this panel, Ms. Laís Abramo, who is the National Secretary of Care in Brazil, who will provide her remarks to this panel through a video message. Please join me in listening.
Nesse segundo dia internacional.
On this second International Day of Care, I would like to thank you for the opportunity to participate in this important event and to talk about the progress we have made in Brazil toward the construction of a national care policy and a national care plan. Since the beginning of President Lula's third term in January last year, Brazil has been committed to developing a proposal for a natural care policy and a national care plan. The objective of this policy is to advance in guaranteeing the right to care for all people who need it. It is to recognize, reduce, and redistribute the unpaid care work performed by women mostly, and mainly by the poorest women, by African Brazilian women, by women living in rural or peripheral areas. Thirdly, the objective of this policy is to guarantee decent work for all paid care workers, promoting co-responsibility between men and women, and between families, communities, the state, and the private sector. A central theme of this policy is to advance in addressing inequalities, not only gender inequalities, which are fundamental, but also inequalities of race, ethnicity, territoriality, age, and disability. Care work in Brazil, as in the rest of the world, is deeply feminized, but it is also deeply racialized. And addressing these inequalities is a central theme of our policy. We're doing this in a country that has important care services. These are benefits legislation, mainly in the areas of social protection, health, education, work, and employment. But there is still a huge deficit in the state's capacity to provide them. Care services which are increasingly needed in a context of an accelerated aging of the population. So the objective of this policy is precisely to strengthen what already exists. It is to better integrate these various systems in order to provide better quality services and create new services, new benefits, new arrangements that can fill the gaps that still exist in our country in terms of guaranteeing the right to care. President Lula has submitted a bill to the National Congress, and this is to establish the policy under law and to establish the right to care in the Brazilian regulatory framework. This will be accompanied by a national plan which will include the various proposals that have been drawn up together with these ministries. This is a process of bilateral and trilateral discussions and also in consultation with civil society. In the process of developing this policy, it was extremely important to have the support of various organizations of the UN system and all the other multilateral bodies, as well as the exchange of experiences with other countries, especially in Latin America and the Caribbean, which have also been advancing in the process of developing their care systems. This exchange of experiences is key because Latin America is currently in an advanced position with regard to this issue, and we can learn a lot from experiences that have been made by brother countries and be able to move toward more quickly. For Brazil, it is very urgent that we move forward with the objectives that were defined by President Lula, which is the approval of the national care policy, which aims to establish care as a right in Brazilian society, and also to implement policies in various areas in public life. We are working hard. We are reaching the halfway point of the government term, and we intend that by the end of this administration, we will have advanced much more, always in this process of dialogue with other international experiences and within the scope of the discussions that have been made at the United Nations. I would like to extend my greetings and a big hug to all the people who are participating in the discussion.
And thank you also to Ms. Abramo for these important reflections. Colleagues and Excellencies, this completes our policy panel segment. Please join me in thanking our esteemed representatives for sharing these significant policy examples to advance a transformative care agenda. I would also like to reinforce, I think, the message that Ambassador Narvaez began with when she highlighted we are all here because care and support has made it so, whether at the household level, whether in societies, or whether in the economy. As we move towards Beijing Plus 30, as our Executive Director of UN Women highlighted, let us take these examples into our practice and advance them forward. Thank you so much. And now I turn back to our moderator, Reem, to take us forward to our next panel.
My thanks to this wonderful panel who's taking over. I'd like to invite our second panel to go up and please take your seats and we'll take a photo before we begin this. Sarah, thank you so much for expertly moderating that and helping us to understand the power of care when it comes to GDP in our international communities. Please feel free to go up and take your seats. When we look at care, what I've been hearing from the different countries is the implementation they are starting to incorporate within their economies, that the invisible sector is now being seen with policies that can change their livelihood, that can transform economies, and that can lead to a better future for everyone economically. I just want to remind our panelists who are seated and taking their seats right now that my colleagues on the floor here, Amber and Bobo, will also be indicating your time. So when you have 1 minute left, they'll hold up a sign for you. And when it's time to wrap, they'll hold up a sign. I'd like to welcome to the stage now Mr. Rio Hada, who's Chief of Equality, Development and Rule of Law Section in the Office of the High Commissioner for Human Rights, to take us to our next panel. We've got one more. Oh, yes, sorry, one more. As I'm reminding everyone, we're waiting to take the panel here. I was speaking earlier, and Sharai, who's over in the far left over there, was talking to us about what we really need when it comes to childcare. And she's saying more and more she's seeing that it's not just about finding anybody. They don't want robots. They want people who understand the full value of what it takes to create a household, have it running, and running with compassion. So without further ado, I'd like to introduce now, I believe our panelists are all seated now. We've got a full house now. Mr. Rio Hada, the Chief of Equality, Development and Rule of Law at the Office of the High Commissioner for Human Rights in New York. Mr. Hada, the floor is yours.
Thank you very much, Rina. So we are moving from high-level policy discussion to more grassroots level, looking at the rights of caregivers and care recipients. I'm very pleased to moderate this panel and also to join hands with our partners, UN Women and ILO, for this International Day. This is a manifestation of our institutional commitment to advance human rights respecting care and support system as a key enabler for sustainable development, working in partnership with all. Colleagues, it is important to recognize that women, persons with disabilities, children, youth, and older persons, and increasingly men, are all providing and requiring care and support. Indeed, as mentioned in the first panel, all of us are playing in both roles at some point at different points in our life, and that is a reality. But there's another reality. As the last video from Brazil shows, that there is deeply entrenched gender inequality, both in providing and requiring care and support. Women are often bearing disproportionate burden of providing care and support, but their rights to receive care and support are often deprioritized. So we must not lose sight of this reality. Care and support system must protect and promote the equal rights of everyone, both in providing and requiring care and support. So how can we create and strengthen a system that promotes and protects the rights of care and support workers, unpaid care and support providers, and those who are requiring care and support while leaving no one behind? We have a distinguished panel of experts to address this issue from the perspective of caregivers and care recipients. So let's get right into it. Our first speaker is Ms. Heba Hagras, Special Rapporteur on the Rights of Persons with Disabilities. Ms. Hagras, as the Special Rapporteur, what do you consider are the policy changes that is still needed to happen to ensure the recognition and the rights of persons with disabilities receiving care and support?
Thank you very much for your question. It's a privilege to be here amongst you today as we gather to mark the second day for International Day of Care and Support. I would like to extend my deepest thanks to UN Women, OHCHR, and the ILO for organizing this vital event and for inviting me today to share my thoughts with you. Actually, my first thought that came to my mind when I was invited to join this panel was, we all need to give care and to receive support. With that in mind, we should think about how care and support systems should be reformulated. The theme of today's event couldn't be more timely as relevant to me. It aligns perfectly with the work I am deeply committed to around gender equality and the rights of persons with disabilities, which will be the focus of my efforts in 2025. As the UN Special Rapporteur on the Rights of Persons with Disabilities, my mission is to ensure that the rights of persons with disabilities are championed and protected at every level, national, regional, and international. There is an urgent need to build care and support systems that are robust, resilient, and responsive to gender, disability, and age, while fully holding the human right perspective. I do firmly believe that we have a very important investing in the transformation of care and support systems. By doing so, we create frameworks to promote the independence, autonomy, and inclusion of persons with disabilities, ensuring that their human rights are respected, whether they are providing or requiring care and support. To build care and support systems that are inclusive and rooted in human rights, we must move away from institutionalized models of care and support and focus on developing community-based services. We must also ensure that those providing unpaid care and support, who are so often women and girls, including women with disabilities, older women, and women who are migrant workers, receive the recognition and support they deserve, respecting the rights of decent work. This transformation requires accessible infrastructure, inclusive social protection, and products designed to meet the needs of those requiring care and support, as well as those providing it. This can only be achieved with the meaningful participation of persons with disabilities themselves. Their voices and lived experience must be central to shaping care and support systems that truly meet their needs. There are still significant challenges. Women and girls with disabilities not only encounter barriers as recipients of care and support, but also face struggles when providing it themselves. Likewise, many women who provide care and support for persons with disability, whether they are children or adults, shoulder these responsibilities with little to no support. These realities will be at the heart of my thematic work for 2025. I plan to explore how key international frameworks, the Convention of Persons with Disabilities, CRPD, the Beijing Declaration and Platform for Action, and the Sustainable Development Goals can better complement one another to strengthen the rights of women and girls with disabilities, and to use the momentum of the 30th anniversary of the Beijing platform to spotlight the ongoing challenges they face in realizing their full human rights. I also want to focus on the critical role of families and relatives, especially women, who provide care and support for persons with disabilities. When families are not adequately supported, it's not just those providing care and support who suffer. The rights of persons with disabilities are also at risk, exposing them to abuse, neglect, and institutionalization. The CRPD Committee already acknowledged the importance of support for family and informal care and support providers. States must ensure that they receive the resources they need, so they, in turn, can support persons with disabilities to live independently within their communities. In conclusion, we need policy changes that benefit both those who require care and support those who provide it. By supporting both groups, we can ensure that states meet their obligations under the CRPD while building a more inclusive, equitable future for all. I thank you all.
Thank you, Ms. Hagras, for highlighting the urgent need to reformulate the care and support system, fully taking into account gender, disability, and age, and moving away from institutionalization to community-based care, which is a perfect segue to our next speaker, Ms. Shorai Chitongo, founder of the Zimbabwe Home-Based Care Alliance and a member of Wailu Commission. Ms. Chitongo, you have been a grassroots community leader advocating for community-based care. From your experience and perspectives, what are the policy changes that needs to happen to ensure the recognition of the rights of the caregivers in your case of community-based care?
Thank you so much. Like you heard from him, Shorai Chitongo, founder of the Zimbabwe Home-Based Care Alliance, and I'm also a member of the Wailu Commission. Before I share the policy changes that I want to see in the care economy, I would want to share my journey as a caregiver from the South up to where I am right now here in the US. I worked as a caregiver in my community. I wasn't paid. I heard you talking about unpaid caregiving. Yes, I wasn't paid, and there was no way I ever thought I was going to be paid at all, because the government was overwhelmed, especially during HIV and AIDS. But it gave me an empowerment to be a leader and to get into development. When I came to the US, I was so happy because I quickly got a job as a caregiver. And my happiness was short-lived because I discovered that I was a paid caregiver, but I was underpaid. I'm providing care in assisted living centers, in nursing homes, in home settings, but I'm providing that care through care agencies. So I've worked with clients who never want to find themselves in nursing homes. Why? They don't want to lose their dignity. They don't want to lose their worthiness. They don't want to lose their identity. And once you are in those settings, you lose all that. So with all this experience that I have as a caregiver in the South and as a migrant caregiver here in the US, I would want to share these recommendations for change in the care policies. And I must say, even as I'm a paid caregiver in the US, these recommendations still work for me. They still mean a lot to me. So firstly, I would want to see recognition of the constituents of local grassroots women caregivers organizations in our diversity as essential workers and agents of development. 2, publicize the scope and value of grassroots women community caregivers' contributions to foster local and national economic development and the overall economy, and ensure the national GDP incorporates care work. Develop and implement innovative policy and program frameworks that create sustainable revenue streams to compensate caregiver organizations finance underpaid work, and women's organizing campaigns for economic justice. 4, promote and secure the inclusion of grassroots women caregiver organizations and leaders in decision-making process related to social and economic policy and program development and budgeting, especially those tied to post-COVID-19 recovery stimulus plans, poverty reduction, and social protection investments that assist marginalized workers at all levels of government. 5, ensure decent work and social protection through comprehensive policies and tools that provide grassroots women community caregivers, domestic workers, and other low-paid care workers access to health care, income supplements, social security, retirement benefits, and affordable social housing. 6, compel nation states to guarantee essential services and infrastructure for life such as water and sanitation and good quality public services. Without these services, care cannot be guaranteed. 7, provide access to productive capital, including land, credit, technology, internet, and equipment, and invest in training and capacity building and other livelihood strengthening initiatives that produce equitable opportunities to access better markets and value chains and advance our economic independence. Lastly but not least, recognize and value care for the environment and natural resources and protect the ancestral knowledge of our cultures. I would not end this speech without giving a loud shout out to all the caregivers out there and to all the caregivers within this room. I know all the other caregivers out there, especially the Wairo Commission that is having a convention in Turkey. I know you are watching me right now. I give a very big shout out to you. The world would never be the same if your intervention wasn't available. Thank you.
Thank you, Ms. Chitongo, for sharing that grassroots perspective and concrete recommendations to reimagine care economy to value the contribution of care workers who's often underpaid and undervalued. Now, we will listen to 3 pre-recorded videos from experts who could not be here today. The first will be from Paola Simonetti, Director of Equality Development at the International Trade Union Confederation, whose work is aimed at ensuring that people can work and live in conditions characterized by equality, dignity, and justice. So let's listen to her presentation.
This 29th of October marks the UN's first official International Day for Care and Support, a moment that acknowledges the legacy of the original International Day for Care established by trade unions to promote public investment in the care economy. The care economy is now a critical priority for our societies. Health, education, and care for children, disabled people, and older adults are vital to ensuring resilient, fair, and more inclusive communities. This is how we enable people to live in dignity, as envisioned by the UN Sustainable Development Goals. Trade unions believe that care must be recognized as a public good, grounded in the principle of the right to care. The care economy puts these principles into action and forms a key part of the new social contract promoted by the global trade union movement. The trade union movement calls for comprehensive care economy frameworks based on the 5 R's approach promoted by the International Labour Organization. This means recognition, reduction, and redistribution of unpaid care work, reward for care work through decent jobs, and representation of care workers through collective bargaining and social dialogue. There is no quality care without decent working conditions for care workers. If care workers are forced to work in unsafe environments with inadequate pay or excessive hours, then quality care becomes impossible. The trade union movement urged governments to increase public investment in the care sector to create millions of new and decent jobs, to increase women's economic participation, and to ensure universal access to quality health, education, and care services. Governments must also adopt inclusive care policies, such as care leaves, family-friendly workplace policies, and gender-responsive social protection. These measures ensure fair sharing of care responsibilities and promote flexible working arrangements on a gender-neutral basis. All care workers must have decent work, including the right to organize, safe working conditions, and equal pay for work of equal value. The 2024 International Labour Conference resolution on decent work and the care economy is a milestone. It is essential that all UN initiatives on care follow these recommendations, ensuring that care economy frameworks are grounded in international labour standards and social dialogue. The global trade union movement is committed to make this vision a reality. Thank you for your attention.
I'd like to thank that important video contribution, which emphasized
distinguished members of the UN system
that the care economy as a public good and the decent working conditions must be observed. So we move to the next video inputs from Adriana Paz Ramirez, who's the General Secretary of the International Domestic Workers Federation, who advocates that all domestic workers deserve to enjoy the same rights as other workers. So please start the video.
Distinguished members of the UN system, dear organizers of the event, the ILO, the UN Women, and the UN Office for Human Rights, please receive my greetings on behalf of the International Domestic Workers Federation, a federation that represents over 500,000 individual domestic workers organized into 88 domestic workers unions in 68 countries. I am Adriana Paz. I am the General Secretary of the International Domestic Workers Federation. I am delighted to join to you today for the celebration of the International Day of Care and Support, because our movement has fought so much along with other sectors in the labor movement to see care recognized as a right and an essential work that deserves to be done under decent working conditions. There are 75 million domestic workers around the globe, and they account for 25% of the global care workforce. They perform essential tasks for the humans and society well-being, which support also national economies. There is no global estimate for the contribution of paid domestic work into the global GDP because it is not considered as a productive activity that generates revenue. However, nothing could be farther from the truth. Care work is the work that makes all other work possible. It allows people to leave their houses in order to work outside the house because someone, a domestic worker, is taking care of whom they love the most. On the other hand, domestic workers are also unpaid care providers, and their unpaid labor accounts for 9% of the global GDP. Despite the relevant contributions that domestic workers provide to the care economy, societies continue to place a low social and economic value on domestic work. Compared to other wage workers, domestic workers tend to have lower wages, 45% to 50% less than the wages of other workers in other occupations. They tend to have fewer benefits and fewer legal and social protections. Globally speaking, 75% of them are not covered by social protections. It is one of the sectors with a major concentration of child labor and forced labor, and where there are the highest deficits of decent working conditions. However, migrant domestic workers face high rates of forced labor, coercion, and abuse while working in countries of destination. If we conceive care as a right, as a work, and as a need, then we have a philosophy and a framework for action to reorganize societies and economies to place value and recognition to the work that makes all other work possible. The ILO Convention C189 on decent work for domestic workers sets minimum standards for decent work for domestic workers. However, only 36 countries have ratified this convention after 12 years. C189 should be recognized as a central pillar for all the national care policies and care systems. We call governments to reform the legal frameworks in countries that have not ratified C189. To the countries that have ratified C189, we call them upon effective implementation. We call for the promotion of organizations and social dialogue spaces to be strengthened. It is crucial to strengthen domestic workers' unions and to create unions of employers of domestic workers and to institutionalize social dialogue spaces. We also call governments to valorize domestic work, to recognize the value of domestic workers and to promote its professionalization through training, certification of competencies, and its recognition within the national care systems. We call for a rights-based approach to migration pathways. We organize and advocate for care to be seen as a human right and to the right to self-care, the right to receive care and to provide care under decent working conditions. Finally, care should be recognized as a public good, operating under the principles of solidarity, equity, and universality, and under the leadership of the state. Thank you all. I hope and I want to continue working with you all to achieve care and their decent working conditions and to promote care as a human right. Thank you.
Thank you very much for this video statement, which emphasized the important contribution of domestic workers and the need to better value and strengthen their protection. The last input is from Ms. Claudia Mahler, independent expert on the human rights of older persons, whose work focuses on the protection of older persons, human rights, intergenerational solidarity, and an enablement of their contribution to society as active agents and rights holders.
Distinguished participants, thank you for the opportunity to speak on this crucial occasion. Today, I will focus in my intervention on the human rights of older persons, both as caregivers and as care recipients. While ageism preconceptions make older persons seen exclusively as passive as a vulnerable group needing care from their families or institutional settings, older persons very often serve as primary caregivers for spouses, children, grandchildren, and other family members. When they do, they are exposed to a wide variety of human rights issues. The right to social protection. Many older caregivers lack access to pensions and other forms of financial support, increasing their economical vulnerability. The right to health. Providing care can particularly strain the physical and mental well-being of older caregivers who may neglect their own health needs. Ageism. Societal attitudes tend to undervalue the contributions of older persons as caregivers, exacerbating their social exclusion. The right to rest and leisure. Informal caregiving demands tend to limit older persons' ability to rest, a need that is particularly important for older persons as their own health may be declining. In my report on the rights of older women, A/76/157, I highlighted how worldwide older women are much more likely than older men to provide care to their partners, grandchildren, and relatives, and to reduce or quit their employment before reaching retirement age for this reason. It is essential that academic and policy discussions on caregivers pay specifically attention to older persons in that role. In 2018, the ILO estimated that by 2030, the number of older persons needing care, those aged 65 or above, their health life expectancy will reach 0.3 billion people. As care recipients, older persons often face discrimination and ageism. Their right to live independently and participate in decision-making about their care is central to the dignity of older persons. The widespread issue of neglect, abuse and violence in care settings also requires urgent attention. Older persons who suffer intersectional forms of discrimination also face additional obstacles to the enjoyment of the human rights in care settings. The COVID-19 pandemic also showed and exacerbated the vulnerability of older persons as care recipients to neglect. In its most extreme cases, the neglect of older persons in institutions and care facilities resulted in thousands of deaths, triggered international outcries. A particular issue to look at when it comes to older persons as care recipients is palliative care. While understood as part of the right to health, it is not explicitly in the legal framework, which is also the case for the term long-term care. The quality of care that older persons receive is also linked to the working conditions and well-being of carers. To ensure that carers provide care that meets the emotional and physical needs of older people with compassion and dignity, and to attract and retain people in the care sector. The better training opportunities, including academic qualifications, should be offered, therefore reinforcing a virtuous cycle that will contribute to the human rights of older persons, both as caregivers and recipients. I thank you for your attention.
Thank you, Mr. Mahler, for highlighting and urging us to shift our perception to aging and combat ageism in care and support. Dear colleagues, we have important discussion in this panel. Before concluding this panel, I'd like to share three key takeaways from my perspective, also reflecting from the first panel. First, establishment of a human rights-based care and support system and care economy is key for sustainable development without leaving no one behind and strengthening gender equality and intergenerational solidarity. Second, the transformation of care and support system and care economy can be better achieved if we conceive them as a public good and when we apply the full range of international human rights and labor standards. And lastly, the importance of meaningfully engaging and discussing this agenda with a diverse group of rights holders and stakeholders, including older persons, informal caregivers, persons with disabilities, and reaching out to those who are farthest left behind as active agents of change. And I hope we all seize these opportunities presented by this International Day to recommit ourselves to creating a rights-based care and support system and economy which will contribute to inclusive and resilient society for the present and future generations. Thank you very much, and back to you, Reem.
Mr. Hadawin, thank you so much for your remarks. And to wrap it up, thank you also to our incredible panelists for helping us to understand the real importance of the recognition of rights for caregivers and the importance of why it transforms society. To deliver closing remarks, I'd like to invite Dino Corello, Senior Multilateral Relations Officer and International Labor Organization Office for the United Nations. Thank you.
Excellencies, distinguished delegates, ladies and gentlemen, it is an honor to offer closing remarks at this event. Today's discussions have powerfully illustrated the fundamental importance of a rights-based approach to care and support, but also that care and support is a pivotal driver, gender equality, economic resilience, and sustainable development. As we heard from diverse voices across the globe, care and support systems touch the core of our collective well-being. Yet care work, largely undertaken by women, continues to be undervalued, unpaid or underpaid, and invisible. The gender division of care work remains a key barrier to achieving the Sustainable Development Goals and fulfilling the promise of the Beijing Declaration and Platform for Action. Today, the ILO has published its most recent updated global estimates showing that worldwide in 2023, 748 million people aged 15 and above were outside the labor force due to care responsibilities, of which 708 million were women. Globally, 45% of all women outside the labor force are out of the labor force because of care responsibilities. In contrast, only 5% of men outside the labor force report caregiving as the reason for non-participation. This stark gender discrepancy highlights the disproportionate role that women take on in child-rearing, care and support for persons with disabilities and those in need of long-term care, housekeeping and other care responsibilities, as well as the opportunity costs involved. Socio-demographic data disaggregation also highlights the interplay between age, education, and geographic location, and underscores the vulnerability of certain groups of women in some regions to shouldering a high share of care responsibilities. Care responsibilities disproportionately affect women between the ages of 25 and 54, particularly in lower middle-income countries, where over 74% of prime-age women outside the labor force cite care responsibilities as reason for their inactivity. Women with lower educational attainment are also more likely to be excluded from the labor market due to care responsibilities. Additionally, rural women face greater barriers, with care responsibilities accounting for higher labor force inactivity compared to urban women. The impact of climate change and demographic transitions could intensify these inequalities. These new estimates are particularly important as we approach 2030. They make clear that the unequal share of unpaid care work remains an invisible barrier, holding millions of women back from economic participation and keeping their potential and our progress on the SDGs unrealized. However, they also provide us another opportunity to share effective policy and monitor efforts to transform the care economy through initiatives aimed at promoting decent work and gender equality. We have heard today not just a call for transformation, but also concrete examples of policy innovation from governments, civil society, and international organizations. The ILO is deeply committed to advancing this agenda. Today's commemoration is particularly significant as it follows the historic adoption by the International Labour Conference last year of a resolution concerning decent work and the care economy. It is the first global tripartite agreement on the issue, paving the way for countries to tackle the challenges and harness the opportunities presented by the care economy. The resolution is a testament and a statement of our collective understanding that decent work in the care economy is not optional. It asserts that just as labor is not a commodity, labor in the care economy is not a commodity. It emphasizes the fundamental principles and rights at work for care workers, including freedom of association, the right to collective bargaining, equal pay for work of equal value, and protection against unsafe working conditions and discrimination. As we assess the progress made since 1995, we must renew our commitment to the ambitions set out in the Beijing Declaration and Platform for Action. With 2030 fast approaching, the urgency of our mission has never been clearer. Let me end by expressing our appreciation and gratitude to UN Women, OHCHR, and all distinguished speakers and partners who made this event today possible. The road ahead demands renewed focus and cooperation, and the ILO remains firmly committed to transforming care and support systems for a more equal and sustainable world. We stand ready to work alongside each of you to achieve this shared goal. Thank you.
Mr. Corral, thank you so much for your comments. I appreciate it. So today we've really gotten a sense of the need for robust investments in the care economy, the power of partnerships, of transforming different countries and their economies, and also the need to move beyond dialogue, just basic dialogue into tangible action that can really transform how we all live and work and also how we all grow financially. I want to thank everyone, all of our wonderful participants today for your perspective, for your good hard work, for your care, and also to all of you here for your interest and for your continued work in this sector. Thank you for joining us today. And in the age of social media, we'd love to invite all of you to come and take a photo in our background here. And I just want to remind you, if you're on social media, do use the hashtag 29 October Care and Support. You can see it right here next to my name tag as well. And if you can tag UN Women and our partners, we'd love to reshare all of that. Thank you, guys.
Hola, muy buenos días a todas, todos y todes. Muy buenas tardes también para quienes nos escuchan o nos van a escuchar después. Este es nuestro tercer día de jornada intensa de este segundo Congreso Internacional de Cuidados hacia una sociedad sustentable. Y esta mañana tenemos con nosotras, a la doctora Sara Moreno Colom, quien es doctora en Sociología por la Universidad Autónoma de Barcelona. Actualmente es profesora del Departamento de Sociología de esta universidad e investigadora de centros de estudios sociológicos sobre la vida cotidiana y el trabajo queer. Y del Instituto de Estudios de Trabajo ha sido vicedecana de Profesionalización 2009-2015 y vicedecana de Relaciones Institucionales 2015-2016 en la Facultad de Ciencias Políticas y de Sociología de la Universidad Autónoma de Barcelona y vicerrectora de alumnado y ocupabilidad de esta universidad. Su trayectoria académica empieza en 2002 como becaria en régimen de formación de personal investigador en el CUIT. En septiembre de 2007 defiende la tesis Tiempo, Trabajo y Bienestar, una aproximación desde la vida cotidiana, merecedora del Premio Extraordinario del Departamento de Sociología. Esta fue su tesis doctoral. Durante estos años ha realizado una estancia predoctoral en el Centro de Investigación Cambio de la Universidad de Florencia y una estancia postdoctoral en el Centre for International Business Studies en la Universidad de South Bank de Londres. Cuenta con varias publicaciones, es revisora de revistas especializadas en sus áreas de conocimiento, ha sido evaluadora de proyectos competitivos, ha formado parte de tribunales del ámbito de la investigación y es miembro del Comité de Investigación de Trabajo y es miembro del Comité de Investigación de Sociología del Trabajo de la Federación Española de Sociología y esta mañana nos acompaña aquí. Muy bienvenida, doctora Moreno Colom, a su casa, este es su espacio. Le damos el uso de la voz.
Pues buenos días a todos y a todas. Muchísimas gracias por la invitación y muchas gracias, Luz, por la presentación. Para mí es un placer hoy poder compartir este espacio de este segundo congreso. Y bueno, voy a proceder a hacer mi intervención que va a girar en torno a la idea de las políticas para impulsar comunidades de cuidados. Para organizar mi presentación partiré de 3 preguntas. La primera pregunta es ¿por qué son necesarias las políticas para impulsar las comunidades de cuidados? La segunda pregunta que intentaré responder es ¿para qué son necesarias estas políticas? Y finalmente, para terminar mi intervención, responderé a la pregunta de cómo impulsar estas políticas para fomentar las comunidades de cuidados. Entonces, para empezar, antes de abordar estas 3 preguntas, sí que querría hacer como una previa a nivel conceptual y plantear de qué hablamos cuando hablamos de cuidados y de qué hablamos cuando hablamos de comunidades o de comunidad. Se trata de 2 conceptos que son de un uso muy frecuente a nivel cotidiano, que además tienen como cierta presencia en la agenda política, social y en la agenda científica en los últimos años, ¿no? Están, podríamos decir, ¿no? Conceptos que están en boga y están en cierta moda, ¿no? Entonces, creo que es necesario preguntarnos qué entendemos para uno de estos 2 conceptos, porque hay una tendencia, ¿no? Hay un riesgo a utilizarlos en exceso, en abusar de estos conceptos y acabar por banalizar su uso y su contenido. Desde mi punto de vista y la mirada que voy a desarrollar a lo largo de mi intervención, los cuidados hay que diferenciarlos en primer lugar del trabajo doméstico, de las tareas domésticas, porque tienen una naturaleza y un contenido específico. Serían todo aquel conjunto de actividades que contribuyen a ayudar, ¿no? al desarrollo de las actividades necesarias para la vida diaria de las personas que cuentan con algún tipo de dificultad para poder hacerlo en autonomía. Aquí entraría tanto lo que son personas menores, criaturas, como personas adultas que tienen algún tipo de dificultad. Y aquí también sería preciso diferenciar lo que son los cuidados de criaturas de los cuidados de larga duración, porque precisamente tienen naturalezas distintas en relación a lo que hace su horizonte, en relación a lo que hace su contenido y en relación a lo que hace su valoración social, ¿no? Vivimos en sociedades a nivel global y es obvio que hay diferencias a nivel territorial cuando hacemos una mirada global en todo el planeta, pero que los cuidados de criaturas, los cuidados de la primera infancia, tienen una visibilidad y un valor social mucho mayor que los cuidados a las personas dependientes o de larga duración, que son mucho más invisibles y cuentan con un menor reconocimiento social. Entonces, a partir de aquí, afinada un poco esta mirada hacia los cuidados, la segunda cuestión es plantearnos qué entendemos por comunidad, ¿no? También estamos ante un concepto que puede ser muy laxo, puede tener muchas utilidades, tantas utilidades que corre el riesgo también de ser banalizado, ¿no? Mi perspectiva para hablar de las comunidades es partir de una idea de comunidad que cumple 5 criterios. En primer lugar, que ocupa un territorio concreto. En segundo lugar, que hay una dimensión de identidad conjunta o compartida. En tercer lugar, que hay interacciones entre las personas que forman parte de esta comunidad que podemos ubicar en un territorio y en donde podemos identificar esta identidad compartida. Y esta interacción implica participación continuada en esta comunidad y un vínculo en clave de interdependencia y no de jerarquía. No es una cuestión de dar sin esperar recibir, sino es una cuestión de una interdependencia donde no hay unas jerarquías de dependencia o de subordinación-dominación. Esto sería lo que podríamos entender como comunidad y ahora mi objetivo será vincular los cuidados con las comunidades, hablar de estas comunidades de cuidados y hablar de ellas desde el impulso de la política pública. Entonces, hechas estas aclaraciones más conceptuales, voy a proceder a la primera pregunta que os planteaba. ¿Por qué son necesarias estas políticas que permitan impulsar y fomentar las comunidades de cuidados? Pues a mi modo de ver hay que situar, ¿no?, la respuesta a esta pregunta en un contexto que viene marcado por la crisis de los cuidados. Estoy convencida que es sobradamente conocida la manifestación de esta crisis de los cuidados por todas las personas que están siguiendo esta intervención, pero para simplificar un poco la explicación podríamos entender que esta crisis de los cuidados se da cuando hay un desencaje entre la oferta y la demanda de cuidados, ¿no? Cuando hay una desincronización en lo que son las necesidades de cuidados y de atención a las personas que necesitan algún tipo de soporte para desarrollar sus actividades de la vida diaria y la provisión, que puede tener distintas manifestaciones y concreciones, para satisfacer estas necesidades. Entonces, en las últimas décadas, todos los cambios, especialmente, bueno, sociodemográficos, pero especialmente en clave demográfica, de envejecimiento de la población en muchos lugares del planeta, que no podemos generalizar, pero que sí que hay una tendencia a envejecer la población a nivel mundial, se da a la par de un aumento de los fluxos migratorios. Y ello conlleva pues, que se moviliza el capital tanto de cuidados como las necesidades de cuidados. Cuando hablamos de cuidados y sus necesidades de larga duración, no estamos hablando de un problema nuevo, pero sí que la intensidad y el volumen con el cual se manifiestan hoy en día es novedad. Esta intensidad y volumen, una situación de desencaje de oferta y demanda, de provisión y necesidades, es lo que, entre otras cuestiones, nos permite hablar o nos lleva a hablar de esta crisis de los cuidados. Además, a mi modo de ver, hay que añadir otra consideración, que es en lo que sería lo que se conoce como las oleadas del feminismo, ¿no?, la que podríamos denominar según cómo lo miremos, pero esta cuarta oleada del feminismo, hay una emergencia muy clara de la reivindicación de poner la vida al centro y poniendo la vida al centro, focalizando la mirada en lo que son los trabajos de cuidados, que han existido siempre, pero han permanecido invisibilizados y subestimados social y económicamente durante décadas y décadas a lo largo de la historia de la humanidad. Al invisibilizar los cuidados, se invisibilizaba a las personas, tanto aquellas que ofrecían y satisfacían las necesidades de cuidados, como las personas receptoras de cuidados. En el contexto de la cuarta oleada del feminismo, emerge la reivindicación de los cuidados, que si bien no podemos generalizar como una demanda en todos los movimientos feministas, tiene un protagonismo mayor, podríamos decir, y al emerger esta necesidad en un contexto de crisis de los cuidados, se pone encima de la mesa la necesidad de hablar cuál es el sistema de provisión de estos cuidados, si está dando respuesta a todas las necesidades existentes y sobre todo se está planteando si este sistema ha quedado obsoleto porque es reproductor de desigualdades sociales que existen en todas y cada una de las sociedades que configuran el planeta. Entonces, a pesar de que mi mirada puede venir, ¿no?, de estudios focalizados en el contexto europeo, sí que hay planteamientos que se pueden generalizar a nivel mundial. Llegados a este punto, ¿no?, y cuando nos planteamos el revisar los sistemas de cuidados que difieren a nivel de países, es obvio, sí que hay un modelo de análisis que nos puede servir para analizar de partida todos estos sistemas. Es el que se llama o el que se denomina como el diamante de cuidados. A mí me gusta mucho este concepto porque nos permite partir de un marco conceptual que puede ser perfectamente adaptable en cada una de las situaciones contextuales, políticas, sociales e históricas para identificar cuál es el sistema de provisión de los cuidados y si este sistema de provisión de los cuidados está dando respuestas desde un punto de vista justo socialmente o bien está reproduciendo desigualdades sociales desde los distintos ejes de desigualdad. Este modelo, que se llama el diamante de los cuidados, lo que hace es dibujar un diamante donde hay 4 vértices, donde un lugar lo ocupa el Estado, el otro la familia, el otro el mercado y el otro la comunidad. Y nos permite analizar cuáles son las relaciones que se establecen entre cada uno de ellos para dar respuesta a las necesidades de cuidados. Cuando el Estado cobra mucho protagonismo, estamos hablando de sistemas públicos que tienden a socializar estos cuidados desde la dimensión pública. Cuando es el mercado que cobra mucho protagonismo, estamos hablando de sistemas que están individualizando, privatizando y mercantilizando esta provisión de cuidados, generando desigualdades sociales, produciendo y reproduciendo las que ya existen. Cuando hablamos que la familia tiene un peso muy importante, estamos hablando de sistemas de provisión que tienden a familiarizar y, por eufemismo, a feminizar la provisión de cuidados. Y cuando hablamos de comunidad, estamos hablando de sistemas que tienden a comunizar, socializar y repartir la responsabilidad de los cuidados entre distintos agentes y hacerlo desde una lógica comunitaria. Cuando se analizan, ¿no?, los distintos sistemas de provisión, vemos que hay una prioridad y un protagonismo de los mercados y las familias y que es mucho menor la presencia del Estado, y que apenas cobra protagonismo la comunidad. En una situación de crisis de los cuidados, donde los estados tienen sus sistemas obsoletos o intentan revisarlos y reconfigurarlos y hacer estos sistemas de transición hacia modelos de cuidados que puedan dar satisfacción a estas necesidades globales, lo que vemos es que los recursos que hasta ahora han funcionado son absolutamente insuficientes para dar respuesta a todas las necesidades y que a veces las respuestas lo que hacen es reforzar desde lo público el mercado o reforzar desde lo público la familia. Y es aquí donde surge precisamente el planteamiento de una política pública que pueda impulsar iniciativas público-comunitarias para intentar no dar protagonismo al mercado y a la familia, que reproducen desigualdades sociales en muchos aspectos, y dar protagonismo a la comunidad, no para que sustituya al Estado cuando hay posibilidad de que tenga protagonismo, sino para alcanzar allí donde no llega lo público estas necesidades de cuidados. Es así que planteamos la dimensión comunitaria como una dimensión que tiene un emplazamiento real en el nivel local y no estatal, y que nos permite trabajar esta respuesta a las necesidades de cuidados desde la proximidad y la dinámica cotidiana de las personas, ¿no? Este precisamente nivel local de proximidad y cotidianidad, lo que hace es complementar una mirada que a menudo a nivel estatal acaba siendo muy distante de lo que es la vida cotidiana de las personas y de lo que son en realidad estas necesidades de cuidados y estas condiciones materiales de existencia de las personas que están dando provisión y dando respuesta a estas necesidades de cuidados. Para decirlo de alguna manera, nos permite acercarnos la mirada local y comunitaria a lo que sería la capacidad de transformación material y simbólica del sistema de provisión de cuidados. A partir de aquí, surge, ¿no?, un poco la respuesta a la primera pregunta del por qué. En el contexto de la crisis de los cuidados, un modelo obsoleto, unos modelos que reproducen desigualdades, hay que explorar e innovar y buscar soluciones que permitan trabajar en la línea de la justicia social. Y esto nos lo da a nivel local y comunitario. Entonces, la segunda pregunta que planteaba es el ¿para qué? ¿Para qué impulsar desde lo público estas iniciativas público-comunitarias para fomentar comunidades de cuidados? Pues bien, yo diría que lo podríamos resumir en una frase muy simple que en buena parte reproduce algunos de los argumentos de Joan Tronto acerca de esta cuestión, y que sería, ¿para qué? Pues para detectar realmente necesidades de cuidados que a menudo están invisibilizadas, y la detección de estas necesidades es para poder redistribuir o para poder repartir responsabilidades en su respuesta y en su provisión, para evitar precisamente que la responsabilidad de los cuidados no recaiga siempre encima de las mismas personas, que son aquellas muy a menudo que están en situación de mayor vulnerabilidad y de mayor desigualdad. ¿Vale? Entonces, de lo que se trata en este para qué es de subrayar la dimensión pública de la responsabilidad de los cuidados, para precisamente sacarla de una responsabilidad que a menudo se vive como individual, y al vivirla como individual se buscan soluciones a nivel individual, privatizado y familiar, reproduciendo las desigualdades sociales que existen para acceder al mercado o dentro de las familias. Son desigualdades que básicamente tienen que ver con la clase social de las personas, con el género de las personas y con el origen de las personas. Entonces, es en este punto de reivindicar la dimensión pública de los cuidados donde surge, ¿no?, el para qué de las comunidades de cuidados, para detectar necesidades y redistribuir responsabilidades desde la lógica de la democratización de los cuidados, desde una lógica que tenga en cuenta precisamente los parámetros de la justicia social y no reproduzca estas condiciones materiales de existencia desiguales que son el punto de partida de estas necesidades. Entonces, para desarrollar esta idea del para qué, yo siempre me refiero a los des y a los res. Y ahora voy a desarrollar esta idea, y refiriéndome a los des y a los res, van surgiendo un poco las propuestas en términos de actuación. Entonces, cuando hablamos de los des, estoy pensando en las relaciones del diamante de los cuidados que antes os he explicado, donde tenemos Estado, mercado, familia y comunidad, las relaciones que se establecen, que pueden ser, ¿no?, de mercantilización, de privatización, de familiarización, de feminización, etc. Cuando hablamos del para qué estas políticas que impulsen comunidades de cuidados, y yo me refiero a los DES, es precisamente para poder detectar unas necesidades y repartir unas responsabilidades que eviten estos aspectos de relaciones que reproducen las desigualdades sociales. Y ello quiere decir desmercantilizar, en primer lugar, sacar la respuesta de los cuidados, sacar la provisión de los cuidados del mercado privado, porque esto restringe mucho el acceso de la mayoría de la población, además de que puede reproducir precariedades dentro del propio mercado laboral para dar respuesta a la compra y venta de cuidados. Con lo cual, el primer des es el de desmercantilizar, sacar del mercado. El segundo des es el de desfamiliarizar, sacar de la familia en la medida que la familia no es un dado por descontado en todas las situaciones vitales. No todo el mundo tiene y cuenta de una misma familia, y dentro de las familias hay que recordar que se reproducen situaciones de desigualdad y relaciones de poder. Hablar de familia en los cuidados es un eufemismo de hablar de la responsabilidad que la mayoría de mujeres asumen dentro de estas familias para asumir esta provisión de cuidados. Una feminización que también encontramos en el mercado privado, porque mayoritariamente el sector de los cuidados es un sector feminizado, que es un claro retrato de la segregación horizontal, y esto quiere decir precariedad laboral en cada uno de los lugares de trabajo que proveen cuidados en el mercado privado o en el mercado de pago. Entonces hablamos de desfamiliarizar, hablamos de desfeminizar, y también tenemos que hablar de desinstitucionalizar cuando parte de las respuestas públicas desde el Estado pasan por crear instituciones que lo que hacen es serializar el cuidado, despersonalizando este cuidado y serializando lo que sería el cuidado como prácticamente en cadenas de montaje. Hay ejemplos de residencias donde se trata a las personas internas como una más en una cadena de montaje, sin tener en cuenta cuál es la característica y la naturaleza de los cuidados que necesita la persona, despersonalizando estos cuidados y con lo cual reproduciendo también determinadas desigualdades que tienen mucho que ver con la calidad del cuidado recibido. Lo mismo que se habla de desinstitucionalizar, porque la institución puede serializar los cuidados y con ello repercutir negativamente en la calidad de vida de las personas dependientes, también se habla de desinstitucionalizar para introducir nuevas culturas de cuidados, aquellas que se llaman centradas en la persona y en las relaciones, que tengan en cuenta precisamente la situación vivida por la persona, que repercuten en las necesidades de las personas, pero también la capacidad de la persona de poder mantener su vida anterior a la dependencia con el máximo de normalidad posible. Y también hablamos de desinstitucionalizar, pero es necesario hablar de deshogarizar, porque a veces el hogar se puede convertir en un cuidado institucionalizado. Cuando la persona se encuentra en una situación de dependencia grave o de dependencia severa, donde no tiene capacidad de movimiento o de desplazamiento autónoma, hay el riesgo de que si permanece en el hogar, puede permanecer en un hogar institucionalizado, donde solo recibe la atención puntualmente a lo largo del día o de la semana y el resto lo pasa sola, en solitud o en unas condiciones que no son las óptimas para poder dar respuesta a su situación. O unos hogares que no están preparados para recibir un cuidado profesional externo y que permita desarrollar un trabajo de cuidados profesional en las condiciones que necesita y, en consecuencia, recibir estos cuidados en la calidad que serían merecedores en otras circunstancias. Con lo cual, hablando de los DES, estamos hablando de desmercantilizar, desfamiliarizar, desfeminizar, desinstitucionalizar y deshogarizar. Y estos DES tienen relación directa con lo que serían los RES. Y los RES hacen referencia a esta frase que decía al inicio para responder a la pregunta del para qué, que sería el reconocer, el redistribuir y el representar. Cuando hablamos de reconocer, estamos hablando de la necesidad de poner en valor los cuidados, tanto desde el punto de vista del trabajo que implican, como desde el punto de vista de la calidad de vida y del bienestar cotidiano que ofrece. Reconocer los cuidados quiere decir romper con el círculo vicioso, que durante muchos años y actualmente aún han sido los cuidados de larga duración, que estaban referidos y están referidos a colectivos vulnerables con poca capacidad de articular reivindicaciones y demandas sociales, que son las personas necesitadas de estos cuidados, con colectivos que ofrecen y proveen estos cuidados, que se encuentran en situaciones de precariedad en el mercado de trabajo y en situaciones de vulnerabilidad y poca relación de poder en el ámbito familiar o en el ámbito doméstico, mayoritariamente todas ellas mujeres, y de un trabajo que no tiene reconocimiento social y reconocimiento económico que tienen otros trabajos, pero que es absolutamente imprescindible para la reproducción de la vida humana, que es el trabajo de cuidados. Nos guste o no, nacemos necesitadas de trabajo de cuidados y probablemente moriremos necesitadas de trabajos de cuidados. Es aquello más universal que nos une a todas a nivel global, pero es aquello que tiene y cuenta con menor reconocimiento social y económico. Este círculo vicioso que representa los cuidados necesita de romperse a partir de un reconocimiento de la gente que necesita cuidados de larga duración, reconocimiento de las personas que ofrecen y proveen estos cuidados y reconocimiento del propio trabajo que implican los cuidados. Y aquí quiero insistir en que cuando hablamos de cuidados estamos hablando de trabajo. Estas actividades necesarias para ayudar y atender las necesidades de la vida diaria, para desarrollarlas con autonomía, que os decía al inicio, son trabajo. Los cuidados son trabajo. Y los cuidados pueden ir acompañados de relaciones de afectividad, de emociones, de sentimientos. Pero estos nunca son solos, siempre implican trabajo. Por eso es importante que los Ds se acompañen de estos RES, y el primer RES es el de reconocimiento del trabajo de cuidados. El segundo RES es el de redistribución de este trabajo, precisamente para no reproducir desigualdades, vulnerabilidades y relaciones de poder. Es absolutamente imprescindible plantearse la redistribución del trabajo de cuidados. Y esto permitirá avanzar en los Ds que antes os nombraba. Y finalmente, el representar. Y el representar quiere decir dar voz, dar capacidad de emancipación y dar capacidad de decisión a las personas receptoras de los cuidados y a las personas proveedoras de los cuidados, en el ámbito formal y en el ámbito informal, en el ámbito del mercado de trabajo profesional, en el ámbito del mercado de trabajo profesional pero informal, y en el ámbito del trabajo de cuidados informal dentro de las familias y el espacio doméstico. Todas y cada una de ellas deben ser merecedoras de representación y capacidad de decisión y voz. Entonces, descrita la columna de los Ds, descrita la columna de los Res, es necesario ver cómo hacemos este para qué. Y aquí, a mi modo de ver, surgen como mínimo 3 líneas de actuación: el reconocimiento de derechos, la revisión de los modelos de provisión y la revisión de los modelos de gobernanza. Y todo ello, que ahora lo voy a explicar de manera muy breve, nos apunta a la necesidad de impulsar comunidades de cuidados como una estrategia para fomentar la socialización de los cuidados, de su redistribución de responsabilidad y la profesionalización de los mismos, pensando en reconocer un trabajo de cuidados que hay que prestigiar y hay que reconocer su profesionalidad. Entonces, esta tercera columna del cómo avanzar, ¿no?, para impulsar. En primer lugar, os decía derechos. Los derechos nos permiten avanzar en el reconocimiento. Y esto quiere decir reconocer el derecho a recibir los cuidados cuando se necesitan y que estos cuidados sean en la mayor medida de lo posible personalizados, adaptados a la situación de cada una de las personas. El derecho a cuidar, a ofrecer un trabajo de cuidados con dignidad, reproduciendo o tomando como horizonte lo que sería la definición del trabajo digno de la OIT, de la Organización Internacional del Trabajo, con condiciones laborales dignas, ¿vale? Con lo cual, el derecho a cuidar desde la dignidad y el reconocimiento, ¿vale? Y esto nos permite avanzar también en la redistribución. Y el derecho a decir no a asumir la responsabilidad de cuidados, cuando la asunción de esta responsabilidad repercute negativamente a otros derechos que tienen las personas. El derecho a tener un trabajo, el derecho a tener tiempo, el derecho a poder desarrollar un proyecto vital. Cuando cuidar es una obligación que implica renunciar a otros derechos, no una renuncia al derecho a no cuidar desde el privilegio, sino una renuncia al derecho a cuidar cuando hay renuncia a otros derechos básicos, a recibir educación, a salud, a tiempo, a trabajo, a ocupación, hay que plantear la posibilidad de un derecho a no cuidar. Esto sería una primera línea. Una segunda línea, os decía, revisar los modelos de provisión de cuidados. ¿Para qué? Pues precisamente para pensar en modelos que no reproduzcan las contrapartidas de los Ds que enumeraba, ¿no?, la mercantilización, la familiarización, sobre todo que hay muchos sistemas de cuidados que se basan en una mercantilización, en una familiarización y en una reorganización y reinstitucionalización. Esto en primer lugar. Y en segundo lugar, a no fragmentar las necesidades de cuidados por colectivos y entender que es a lo largo del ciclo vital que en distintos momentos vamos a necesitar cuidados y que somos personas interdependientes, que a veces seremos receptoras y a veces podemos ser proveedoras o acompañamientos de la provisión de cuidados. Y finalmente, la gobernanza colaborativa para impulsar precisamente unos sistemas de provisión de cuidados que no sean desde una visión estatal, global, que no consigue materializar al nivel de la vida cotidiana y que nos permitan plantear gobernanzas horizontales donde la comunidad cobra sentido, no por sustitución del papel del Estado, sino que se impulsa desde lo público para dar precisamente esta posibilidad de tomar decisiones a nivel horizontal que den respuestas reales a las necesidades de las personas que se encuentran necesidades de cuidados, pero también a las personas que están proveyendo estos cuidados desde lo formal y desde lo informal. Así pues, tenemos la columna de los Ds, la columna de los RES y la columna de las actuaciones desde los derechos, desde la provisión, desde la revisión de los modelos de provisión y desde la gobernanza o el impulso de las gobernanzas colaborativas. Todo ello nos sitúa en el para qué, ¿no? ¿Para qué impulsar estas comunidades de cuidados? Pues precisamente para poder detectar necesidades, repartir responsabilidades desde la perspectiva de la justicia social. Llegados a este punto, y dejadme que controle el tiempo, bien, yo creo que voy bien, me quedan unos 10 minutos. Voy a pasar a responder a la última pregunta que formulaba para ir cerrando con mi intervención. Y esta pregunta, ¿no?, respondidas el por qué y el para qué, hace referencia al cómo. Para dar respuesta a esta pregunta del cómo, voy a fijarme en experiencias que son las que más he investigado y más conozco del contexto español y catalán, ¿vale? Que son experiencias que obviamente hay que situarlas y contextualizarlas también en un contexto europeo, que difiere, como es sabido, conocido y obvio, del contexto de América Latina, y donde se manejan unas concepciones de comunidades que a veces son distintas a las que se manejan en el caso de América Latina, ¿vale? De hecho, yo siempre cuento que la comunidad en el contexto europeo surge a posteriori de lo que se trabaja de la acción comunitaria y de la tradición comunitaria de América Latina. En el contexto europeo surge en un contexto de crisis del estado del bienestar, cuando el Estado, como os contaba anteriormente, no alcanza a dar respuesta a todas las necesidades, no alcanza a poder captar muchas de las necesidades e impulsa la acción comunitaria a nivel local. En cambio, en el contexto de América Latina hay una tradición anterior de las comunidades, anterior al Estado y a la intervención del Estado, ¿no? Con lo cual yo creo que lo que voy a contar ahora hay que contextualizarlo también en estos dos contextos que no son estrictamente equiparables y comparables, ¿vale? Cuando hablamos del cómo, en el contexto en el cual yo ahora me sitúo, aparece la innovación política como una respuesta desde la política pública que surge del fracaso y de la necesidad. Perdonad que quizás se escucha un ruido de fondo. Voy a esperar que pase, va a pasar enseguida. Y así podréis seguir mejor mi discurso. Ya está. Hablaba de la innovación política como una respuesta política que surge del fracaso, cuando la política pública no ha podido lograr alcanzar la respuesta buscada con las políticas, y del fracaso de esta política pública y de la necesidad de explorar otras vías de actuación para alcanzar respuestas satisfactorias. Entonces, es aquí donde aparece la innovación política en el terreno de la acción comunitaria, y donde la dimensión territorial, como os decía anteriormente, en clave local, ofrece esta mirada de proximidad a la vida cotidiana de las personas que permite captar mejor las necesidades para redistribuir las responsabilidades. Es un cambio de paradigma que trabaja con la prevención, con la acción y con el acompañamiento en los cuidados, y que yo voy a intentar desarrollar con 4 experiencias muy concretas que se han impulsado en los últimos años en nuestro contexto. El cómo puede pasar, pues por ejemplo, por impulsar lo que en el País Vasco se ha venido denominando lo que son ecosistemas de cuidados. Ecosistemas de cuidados entendidos como unas comunidades de cuidados donde hay una coordinación para fomentar, ¿no?, el intercambio de conocimiento para seguimiento de los casos de personas que necesitan cuidados desde lo social, desde lo sanitario, desde lo familiar y desde lo comunitario. Se crea así, ¿no?, un seguimiento y acompañamiento de los cuidados con una coordinación de todos los servicios administrativos, pero también de la acción comunitaria, para dibujar los casos de las personas que necesitan cuidados como un continuo, no para abordarlos de manera fragmentada, desde lo social, desde lo sanitario, desde lo educativo, desde lo familiar, desde lo comunitario, sino generando este continuo que permite este abordaje integral a la persona, pues quizás que requiere de una combinación de servicios y que no solo se le puede dar satisfacción a esa situación desde un servicio de atención domiciliaria, sino que hay una combinación de un servicio de atención domiciliaria con la asistencia a un centro de día o con el seguimiento o el acompañamiento en un programa de intercambio intergeneracional con escuelas del barrio. Todo ello lo que permite es una mirada global que no fragmenta la situación de cada una de las personas, que mejora el abordaje profesional de todas las personas que participan profesionalmente para dar respuesta a esta situación, pero también mejora la calidad de vida de la persona receptora, porque no se institucionaliza su respuesta, sino que se le da esta dimensión de abordaje continuo, donde se rompe con las lógicas institucionales para dar respuesta a cada uno de los casos en función del colectivo al cual representan. Esto sirve tanto para una persona mayor que vive sola como para una persona adolescente o un infante que tiene alguna enfermedad crónica y que vive con su familia. Esto sería una primera actuación que nos permite actuar desde esta lógica del continuum de los cuidados para no fragmentarlo, para integrarlo desde la dimensión local y sobre todo trabajando desde la prevención y desde la atención. Otro ejemplo que puede ser muy significativo para hablar de estas comunidades de cuidados es el proyecto RADARS. Este es un proyecto que se viene impulsando desde hace muchos años, desde el 2008, en Cataluña. Se inicia en el Ayuntamiento de Barcelona, en el municipio de Barcelona, pero actualmente forma parte de mucha de la política local de distintos municipios de Cataluña, ubicado en una comunidad autónoma también ubicada en España. Y el proyecto RADARS tiene como objetivo parte de la premisa, de la realidad, de que una ciudad como Barcelona se encuentra con una realidad muy cruda, que es que gente mayor muere sola en su hogar y servicios sociales pues tardan entre 2, 3, 4 semanas a tomar conciencia de que aquella persona ha muerto, ¿vale? Porque vivía en soledad y nadie estaba pendiente de ella. Ante esta realidad se plantea cómo poder dar respuesta desde lo público comunitario para que no ocurran estas situaciones. Y se decide implementar un modelo que en realidad lo que intenta reproducir es la lógica de funcionamiento de muchos ámbitos rurales. Que el vecindario, la comunidad, esté pendiente con una mirada atenta pero respetuosa a su comunidad, a sus vecinos y vecinas. Se articula de esta manera un programa de voluntariado donde dentro de la comunidad, el territorio, barrio muy restringido, se articulan distintas radares que se llaman, ¿no?, estos radars que sirven de tener una mirada atenta y respetuosa a las personas mayores que viven solas. ¿Qué son estos radars? Pues son personas, vecinos, vecinas, comercios que forman parte del programa y se ocupan de pasar, ¿no?, un poco de revisión semanal a cada una de las personas que están censadas y registradas en el proyecto y que son personas mayores que viven solas. Por ejemplo, una farmacia donde semanalmente acude una persona mayor a buscar su medicación, o una botiga, una tienda de comestibles, una panadería, una carnicería, una pescadería, o el casal de barrio para gente mayor, o la asociación de vecinos. Todas aquellas entidades, todos aquellos comercios, todas aquellas personas que forman parte de la vida diaria de las personas mayores que viven solas y que tienen algún tipo de contacto con ellas, asumen la responsabilidad de anunciar, de despertar las alarmas, de encender las alarmas si la persona en cuestión, la persona María, la persona Juan, quien sea, no va a su reunión del casal de barrio, no va a la biblioteca a buscar el libro que semanalmente va, no va a la farmacia, no va a comprar el pan. Despertar la alarma en servicios sociales para activar qué es lo que pasa en aquel hogar donde hay una persona mayor que vive sola. Es un proyecto muy simple que no hace más que intentar reproducir las dinámicas que por inercia y de naturaleza en el ámbito rural y comunitario funcionan en un contexto de ciudad grande, metropolitana, con unas dinámicas que a veces van a la contra de esta situación. El proyecto RADARS, pues desde el 2008 que está funcionando, ha tenido una escalabilidad a nivel local en muchos otros municipios, ha dado muy buenos resultados, pero tiene sus límites. Y sus límites pasan en que si activa por un lado la comunidad de cuidados, por el otro esta comunidad de cuidados tiene un rostro muy feminizado y mayoritariamente son mujeres las que participan tanto en la recepción como en la provisión de esta mirada atenta y respetuosa que ofrece el hecho de ser honrada. Y esto también es una cuestión que hay que trabajar para poder revertir en la lógica de la desfeminización. Finalmente os quería hablar de dos otras iniciativas que también son muy concretas y tienen pues sus referentes en la ciudad de Barcelona, pero también en otros municipios a nivel catalán. El primero es el SAT, el nuevo modelo de gestión del SAT, del Servicio de Atención Domiciliaria. Es lo que se ha venido llamando las superillas sociales por una configuración en la política municipal del Ayuntamiento de Barcelona, pero que vendría a ser la idea de intentar organizar de una manera comunitaria, en una lógica de equipo, lo que es el servicio de atención domiciliaria profesional impulsado y ofrecido por el Ayuntamiento en la lógica de la política pública. En el caso del SAT tradicional, nos encontramos con trabajadoras familiares que se van desplazando a los domicilios de las distintas personas usuarias, ofreciendo unos cuidados puntuales que normalmente tienen una franja de tiempo restringida y una franja de días semanalmente también restringidos. Esto que supone un trabajo aislado por parte de las trabajadoras familiares que trabajan además bajo una presión temporal y de tareas muy estricta que no permite desarrollar bien su profesionalidad y su trabajo. Y por la parte de la persona receptora de los cuidados, pues un servicio que a menudo tiene una calidad que podría ser mucho mejor porque como está tan serializado y tan pautado temporalmente y diariamente no da respuesta a sus necesidades. Por ejemplo, reciben el servicio por la mañana para que les saquen de la cama, los visten, les den la comida, la medicación y se van. Y no hay un cuidado que vaya más allá de satisfacer las necesidades básicas de la vida diaria. ¿En qué consiste la superilla social? Pues precisamente en romper en la lógica del trabajador a familiar, trabajo individual y aislado y en configurar equipos de trabajadoras familiares que dan respuesta a necesidades de comunidades más cerradas que no necesitan de desplazamientos largos a lo largo de la ciudad y que trabajan en equipo. Y ya no es la relación de una trabajadora con un usuario, sino que es la relación de un equipo con un conjunto de usuarios que forman parte de una misma comunidad y que pueden ajustar los servicios a las demandas y necesidades. Si hay una persona que realmente solo necesita que le vengan diariamente a poner una pomada en la espalda porque ya no alcanza y lo que necesita es una atención de 20 minutos, media hora diaria, pero diaria, que no puede estar concentrado en un solo día semanal, 2 horas, el equipo SAT permite dar esta respuesta. Al igual que puede dar otras respuestas en distintas franjas horarias a distintas situaciones. Con ello, se atienden mejor las necesidades de cuidados, se genera un equipo de cuidadoras que a la vez forman parte del barrio y del territorio, que captan mucho mejor las necesidades, que pueden participar de esta vida comunitaria y que además tienen tiempo para sacar a las personas receptoras de cuidados de ese hogar para formar parte de esta vida comunitaria. Esto sería el caso del nuevo modelo de gestión del SAT, que tiene muchas ventajas a nivel de condiciones de trabajo, pero tiene sus limitaciones a nivel de condiciones laborales. Porque es verdad que la autogestión que implica este nuevo modelo de gestión por parte de las trabajadoras familiares también va o acarrea una mayor presión o carga de trabajo y responsabilidad para estas trabajadoras. Y si no va acompañado de una revisión de las condiciones laborales en términos de contrato y salarial, puede repercutir negativamente sobre ellas. Y finalmente, y con esto terminaré, intentándome ajustar al tiempo, hay una última experiencia que se ha impulsado en los 2 últimos años en el Ayuntamiento de Barcelona, que se llama Vilaveïna, que vendría a ser el impulso de un nuevo servicio que quiere impulsar estas comunidades de cuidados a nivel también territorial, micro, que no alcanza ni a la situación o a la dimensión del barrio, sino que serían pequeñas comunidades configuradas por unas 10.000, 15.000 personas, donde se instaura un nuevo servicio, con la dificultad que implica desarrollar un nuevo servicio donde no haya un imaginario social que lo reivindique, lo demande, ¿no? Pero este nuevo servicio tiene por objetivo dar respuesta a todas las necesidades de cuidados a lo largo del ciclo vital en un territorio pequeño que se identifica como potencial comunidad de cuidados. Este servicio funciona con una persona técnica referente que hace atención individual e impulsa acción comunitaria para hacer emerger necesidades de cuidados que no están ni percibidas ni para las personas receptoras o necesitadas, ni visibles socialmente, hacerlas emerger y articular respuestas que ya existen a nivel de administración pública o comunitaria y que no conoce la persona. Es una situación de hacer encajar necesidades con respuestas que existen de manera desencajada, pero que las puedes hacer un matching para satisfacer aquella situación. Entonces, las personas técnicas referentes de cada una de estas bilbaínas son personas con un gran potencial capacidad de hacer emerger estas necesidades a pie de calle, haciendo mucha calle, hablando mucho con las personas y también de captar respuestas que existen a nivel público, pero también a nivel comunitario. Esto en relación a la atención individual y en relación a la acción o al fomento de la acción comunitaria, lo que hacen estas técnicas referentes es hacer una introspección, retrospección de qué existe en aquel territorio a nivel comunitario, que a veces tiene una expresión comunitaria y una identificación comunitaria, pero a veces no. Funcionamientos de bibliotecas, pues casales, grupos informales de cuidadoras, grupos informales de adolescentes, que pueden actuar, grupos informales de teatro, que pueden actuar como articuladores de una acción comunitaria ante una necesidad de cuidados. Y aquí se da respuesta desde necesidades de cuidados de criaturas a gente mayor dependiente, necesidades de cuidadoras informales, necesidades de situaciones de colectivos, por ejemplo, que se las da muerte personas, necesidades de colectivos que viven una situación de soledad no deseada, un amplio abanico de situaciones, tanto de receptores como de cuidadoras, que pueden ser articuladas a una mejor situación desde la lógica comunitaria que intenta impulsar la vida. La dificultad de impulsar este servicio, como decía, es que no tiene precisamente un imaginario social construido de qué utilidad tiene este servicio. Sirve de engranaje entre lo público comunitario porque permite potenciar mucho más lo que existe y hacer emerger lo que existe pero no se ve. Pero es necesario un trabajo de largo recorrido para constituirlo como un nuevo servicio y para poder desarrollarse, para impulsar estas comunidades de cuidados desde la visibilidad y el reconocimiento social. En definitiva, he intentado desarrollar, ¿no?, el por qué son necesarias el impulso de comunidades, de políticas que impulsen comunidades de cuidados. Lo he hecho partiendo, ¿no?, de una definición de qué entiendo yo de cuidados, en esta definición muy imbricada en la dimensión de trabajo, qué entiendo yo por comunidad, y respondiendo a 3 preguntas: el por qué, el para qué y el cómo lo he centrado en 4 experiencias muy puntuales situadas en el contexto europeo, español y catalán, que son los ecosistemas de cuidados, el proyecto RADARS, el nuevo modelo de gestión del servicio de atención domiciliaria bajo el nombre de las superillas sociales y las bilbaínas como nuevo servicio para impulsar estas comunidades de cuidados. El resumen o la conclusión de estas 4 experiencias que he tratado y he analizado en distintas investigaciones es que todas ellas permiten avanzar mucho más en la lógica del reconocimiento de los cuidados y tienen muchos más límites y dificultades para avanzar en la lógica de la redistribución del trabajo de cuidados y de la representación de los colectivos que forman parte en una lógica de gobernanza local. Es decir, hay una lectura positiva que estas iniciativas permiten reconocer las necesidades de cuidados y el trabajo de cuidados, de poner la vida al centro en la política pública con el impulso de estas comunidades de cuidados, pero tienen mucho camino y muchos retos para recorrer y para responder en términos de redistribución de este trabajo de cuidados y de representación de todos y cada uno de los colectivos que forman parte de este diamante de los cuidados y de su parte más prioritaria y protagonista, que son las personas que proveen los cuidados y las personas que son receptoras de estos cuidados. Y hasta aquí llegaría mi intervención. Agradezco muchísimo la atención. Espero que haya dado respuesta a la petición que me hacían desde...
No, nada más de trabajo. Pero ya no está. No, ya se desconectó. Bueno, damos las gracias a la doctora Sara Moreno por esta ponencia, por compartirnos sus investigaciones y poner en diferentes contextos las propuestas, la propuesta que ella está trabajando. Que tengan muy buenos días y les invitamos, perdón, a seguir nuestras transmisiones. Habrá 2 mesas más sobre infancias y sobre cuidados digitales en unos momentos. Muchas gracias. Recuerden poner sus dudas, sus comentarios en la liga del Face. Gracias.